you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Global Namaste, Rajiv. Carry on and we can begin our wonderful journey on healing our earth for the Ayurveda session.
Thank you so much, Nikumar. It's so nice to really be with our colleagues, friends, and well-wishers healing our earth. It's 141st episode, and that is very big achievement. Let's begin with the prayer to God. Om Bhurбhava Swaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. Om Shanti Shanti Shanti. Let God give us health, happiness, and move us from darkness to light. Om, peace, peace, peace. I'm so delighted that we have a dignitary of speakers today who are going to help us learning more and more about an ancient science. Around 3,000 years ago that we acquired. Dhanvantari was the originator, as I'm told, and it has been in the Charak Samhita. It is something which is not developed yesterday. We know modern science is modern science. This is ancient science. And the idea we are going through the integrated health is connecting old science to the new science and connecting all different types of disciplines of the healthcare, including Ayurveda, homeopathy, acupuncture, acupressure, Tai Chi, yoga, and very different ones. And we know that each one has got something good to contribute. So let's begin with Ayurveda today. I have my co-host, Ish Sharma, who incidentally is from the same place in India, Jodhpur, and we are really delighted here to help contributing to this worthy session, how we can help healing ourselves through the natural means. So should we have a couple of words from Ish, and then I will invite our first speaker, Baljo.
Thank you very much, Dr. Gupta. Thank you very much, Neil. And this is really a very special day when it comes to Ayurveda, because we have got some like very fresh speakers for this platform. And this is how the family is in an ever expanding mode. And we get a chance to hear like new versions of the same science, the new experiences coming from the same academic background. Still we like emerge as an individual, as a special mix with the given experience, with the given training, with the given inclination. And I'm very fortunate to announce that we have got with us my counterpart from the University of Latvia, Professor Shantala Priyadarshini ji, who would be gracing the occasion in the due course today. And having such an immense experience, we are bound to benefit from the richness of her credentials. And we have maintained a sequence where, very nice to see you, Dr. Shantala ji. Namaskar to you. And for your introduction, we are the two Ayurveda chairs active globally today. One is at the University of Latvia and myself being at the University of Mauritius. And there are 11 more which are vacant and still awaiting some incumbent to go and join them. So we are a very we feel quite connected. We have never met. I have never personally met Shantalaji, but this is like always an encouragement.
Always
Yes, yes, to get to
virtual.
know from her what are we doing. That is how we remotely keep supporting each other and try to represent Ayurveda in India in the best manner possible. So Rajivji, without like wasting much time, because we are quite tight today, maybe can you please invite Dr. Baljot Kaur for the talk?
Thank you, Ish and Shantalaji. I think we're going to have a fantastic discussion today. For those viewers who are on various different type of social media, including the YouTube, Facebook Live, Periscope, and rest of the stuff, please keep asking questions if you want, and we will have our very valuable speakers who would try and give as answer as possible. Our first speaker today of the big galaxy is Dr. Baljit Kaur, and she's going to talk about a very, very important and a very natural body system and a natural event that happens, and that is called menopause. And we know it all. It's a very natural thing happening to women, and how it can cause difficulties and how we can help to remedy it so that it doesn't become a problem, just remain a natural process. Dr. Baljot Kaur is a professor in the department in Ayurveda Medical College in Ludhiana. She has 20 years of clinical experience and 12 years of teaching experience. She has written books and published chapters, I think mainly on the plant contraceptives and into the gynecological disorders which can be treated with Kalpana. And I think that is very amazing. She has actually compiled the Panchkarma and various local procedures that can be used for gynecological disorders. I think that is really very, very useful. I do have knowledge of Ayurveda and has been involved in it for quite some length of time. But I think this is enlightening to hear that particular aspect of Ayurveda. So with all the best, let's welcome Baljotji. Please shower us with your wisdom and knowledge. Dr. Baljot.
Okay, Dr. Rajiv, I think she's still struggling with sound.
Okay.
She can hear us. So, Dr. Baljot, please ask somebody to help you to connect with the sound. You may sign back in and please join the audio. Meanwhile, Dr. Rajiv, Dr. Ish Sharma, little do people know how professional and knowledgeable you both are in the Ayurveda. Lead us to the journey, why Ayurveda, how Ayurveda, and where Ayurveda should be going to. Over to both of you.
Thank you so much. It gives us a chance to reflect on where it came from what I heard. And if you can add this, I think initially it incarnated itself from King of Varanasi, who taught medicine to a group of physicians, and that including Sushruta. And that then become a traditional medicine over next, I think, something like 100 years. And then Ayurveda developed, and then I think around 3,000 years ago in India, and developed with all the natural melodies and the 5 elements, the space, air, fire, water, and earth, which I think sometimes represent all 5 fingers. That's how I remember it. So I think that's so good. Do you want to tell us really why these 5 elements are important? And also, if you get time after that, how do we connect that to different doshas?
Very rightly put, Dr. Rajiv Gupta. And surely it is like an opportunity in a way, because Dr. Baljot Kaur is trying to connect. And Baljot, we are available to listen to you. Anytime you can just interrupt and inform your availability, and you'll be taking up from there. So,
Okay,
yes.
I'll join from phone.
Yes, yes. Okay, Baljot. Are you comfortable?
Yeah, it's okay.
Okay,
Let me share my screen.
right.
You can, that will be great. Fantastic. We can see you and we can hear you too.
Yeah, okay.
So you're welcome to share screen now and welcome to Healing Our Earth. Over to you, Dr. Rajiv and Dr. Ish Sharma.
Fantastic. While she's setting up the screen share, Ish, do you want to talk about like why these 5 elements and how does it connect to our health?
Maybe till Dr. Baljot is available. The 5 elements represent all the anatomy, all the structure. And so Ayurveda believes anything which is like living or non-living, or a human being like living or after death, the 5 elements, 5 elemental composition remains the same. And the only difference between a living and non-living, or a living person and a dead person as per Ayurveda, is the presence or absence of tridosha. 5 elements merge to make tridosha, the 5 mix to make 3. So 5 anatomical components mix to make 3 physiological components. So Vata, Pitta, Kapha, tridosha are the physiology, and Mahabhuta, 5 elements, is the anatomy. Yes, Dr. Baljot, are you ready?
I think it's somebody else. Can everybody else mute themselves?
No, it's Dr. Baljot. Let me see if I can mute her. Okay. That's fine. Carry on. It's wonderful. Dr. Ish, you mentioned about Vata, Pitta, Kapha as well. For our viewers who are mainly into English, could you explain a bit more over?
Ish, what is Vata, what is Pitta, what is Kapha? I know.
Yes,
like,
yes.
more
Vata, Pitta, Kapha. Really,
Personality.
Vata, Pitta, Kapha is a big topic. Like, it is all Ayurveda in a way. So we can keep talking it about like all the session long. So surely we need another slot to when we can be having a session about like introduction to Ayurveda. We have got Dr. Rajan. Please, Dr. Rajan, if you can unmute and comment, contribute us with your comments, maybe in a very short, like for maybe 1 minute when Dr. Baljot starts.
Dr. Rajan is not on a video, so we can't spot.
Don't worry. So from what I understand is that Pitta is more like aggressive, more like, I would say, fire.
Yeah, Vata is like air, nervous system. Pitta is like metabolism or fire, and Kapha is more like a strength, immunity, or water.
Yeah.
So we will take this up another time if Dr. Baljot is available.
So, Professor Ish, when Dr. Baljot is available, she will automatically be spotlighted. They are struggling to connect, so please just do carry on. Automatically, you will see them on the screen.
Okay, perfect. Okay. So when it comes to like balancing, maybe Dr. Rajan, would you like to add something?
Yes. As you said, so full session of at least 6 to 8 hours should be given for only description of Vata, Pitta, Kapha, the basics of Ayurveda. So yes, you had rightly said, and if it's possible, they can arrange something like that. So thank you.
So we will arrange for it. I'm trying to use the time effectively so that our audience doesn't get disenchanted. So just for me to say, let me just add in there here. So Vata is, in my view, like a cold, light, dry, rough kind of a person. And these are the ways to identify it, because in Ayurveda, very much different than my kind of typical conventional science, where if it has got a pancreatitis, it's same pancreatitis depending on whatever. And if it is a pneumonia, it's a pneumonia for all. In Ayurveda, the same pneumonia could be treated differently for different people. And therefore, that is how the Vata personality is. And on the other hand, Pitta is very different. So Pitta dosha is like fire on water, and therefore it's sharp, oil, liquid, something like that. And therefore that needs to be treated differently. And I always feel Pitta is more like an athletic person, strong, but at the same time, he's quite aggressive and tenacious. And that's how, in my mind, I have found, because there are different personalities, which, because I do behavioral science and emotional intelligence. So in NLP, there are different type of people. So same is disc personality. This is like dominant, desirable, and active. And there is C type person who are cautious and careful, and people say they will read the Xerox copy to check it is right. So Pitta is actually a copy, reading the small things and at the same time being quite aggressive. So they're high D as well as high C. And I believe that their strengths are being quite like intelligent, purposeful, very determined, mastering the skills, and they're very strong natural leaders. On the other hand, they have quick metabolism and they're impatient, they're prone to conflict, always hungry, has mood swings, and I believe they're very prone to acne and inflammation, and also sensitive to hot temperatures. So currently in UK, the temperature is very hot, and I've found that people who are Pitta personality are having a lot more problems than the Vata personalities. So I think that's kind of a short description while we're waiting. So I think you might add a bit more about Kapha. I haven't talked about, otherwise we can talk that.
Okay. Yeah. Vata Pitta Kapha Tridosha, as Dr. Patankar told, requires altogether an elaborate session. If we go ahead with simplification, Vata Pitta Kapha is the common currency in Ayurveda. This is the common currency. For example, we have a common currency like pound or rupees or dollar, you know. So even non-material things are converted to that currency value. Because you insulted me, I sue you with 1 million pounds, you know, defamation case. Now, insult or respect cannot have a monetary value. You killed someone, you have to pay a monetary value sometimes, you know, because like this is a monetary like translation to someone's life or someone's insult, you know, which surely cannot have any monetary value. In the same manner, Vata Pitta Kapha is a common currency. It could be your body type, it could be your disease, your mind, your herbs, your thoughts, your dressing sense, everything, every ingredient of your food, your wheat or your spices, your milk or fruit, everything has to translate to one common currency, Vata Pitta Kapha. What does it do to Vata Pitta Kapha? Your age, you are a kid, you are old, you are young, you know, you are sleeping, you are awake, you are happy, you are sad. No exception. Everything has to fall back to Vata Pitta Kapha because that is the common currency. This is a simplification. And this common currency can also be Mahabhuta. You know, like if I have to mark you out of 3, I'll give you like 1 mark, 2 marks or 3 marks. If I have to give you marks out of 100, then I can be more specific. Like I give you 77 or 78 or 53 or 54, you know. The larger the parameters, the more finer, more analytical is the outcome. That is how some experts from Maharashtra, Pune, they came up with Panch Bhautik Chikitsa. That is, as we were seeing, like it is more Vata or more Pitta or more Kapha, 5 parameters are better than 3. The larger the set of parameters, the finer is, the better is the outcome. So they went for Mahabhuta, and how to judge if you have got more of earth or water or fire or air or space. Which element is enhanced, which element is reduced. So they went for Panchbhautik Chikitsa, but original Ayurveda was about Tridosha Chikitsa because Tridosha is the only like attribute for the living, and this healthcare science deals with the living only, not with the dead or non-living. That is why they Charak and Sushruta, they deemed it better, fitter to go ahead with the life entity, with the physiological entities Vata Pitta Kapha, than Mahabhuta. But surely there can be that take as well.
Right. So I think just to complete that, as you say, they are kind of very contemporary. So I believe that kapha is based on earth and water. And I believe these are the type.
Dr. Rajiv, sorry to come in here. Dr. Biljot is struggling presenting her PowerPoint, but I think I might be able to help. And we'll ask her to see if she puts the sound on, or Professor Ish or yourself can talk us through her presentation. So just bear with me one moment, and I will share the screen. And if you could tell me, can you see the presentation?
Yes, we can see.
Okay, Dr. Biljot, if you can hear us, unmute yourself and see if you can talk us through it.
Yeah, hello, sir. Can you hear
Good.
me?
Perfect.
Please go ahead.
Can hear you.
Okay. Sorry for the trouble.
We got it. Don't worry. Carry on. Empowering the transition. Menopause.
Yeah, with the blessings of Lord Dhanvantri and all my gurus, I thank all of you for giving me this opportunity to present my topic, menopause, empowering that transition with Ayurveda. Next, please.
Nil, can we move the slide, please?
Yeah, the slide is a locked one. She hasn't sent a version that clicks on.
Okay.
Okay, maybe let's
can
keep
keep
for a
talking.
while and just talk about 2-3 minutes of your powering of transitions with Ayurveda in the menopause.
You don't worry about slides. Keep talking.
Okay. Menopause as such has not been described in Ayurveda. It's just a part of life. It's part of aging. So it's just how you are living that will affect the later part of the life. So
We can't hear you.
Okay, Dr. Rajiv, let's skip Dr. Biljot. I think we've tried our best. Carry on, both of you were talking interesting points, so tell us more about it.
Maybe we can go ahead with the Jayant, who was to follow if Jayant is available.
It's fine, Jayant. Dr. Ish, Jayant's slot is in about 10 minutes, so just please carry on. It will bring it.
So we were discussing about Vata Pitta Kapha, whereas Dr. Rajiv ji was complimenting where does it come from? Where do Vata Pitta Kapha come from? Actually, what happens is when the pregnancy takes place, that is the time, as per the Ayurveda viewpoint, as per the Darshana viewpoint, as per the Vedic viewpoint, a soul would be entering the combination of sperm and ovum. Atma enters the combination of sperm and ovum, and that is the point when the pregnancy takes place. And the soul is so potent, so powerful, with its entry into this combination of sperm and ovum, the soul would be converting some non-living Panch Mahabhuta into something living, Tridosha, something physiological, quality, like holding entities, Tridosha. In the same manner, as we insert a key in the car and we just move it, and the car comes into function. Earlier, the car was an anatomy only. It was standing, it was not moving. No organ, no part was active. But now, as the key or the soul enters, now parts are moving. Engine is moving, tires are moving, lights are on. The car from anatomy entered into a physiology. And when death occurs, if you take the key out, if the key is out, soul is out, now you cannot, from a distance, you cannot tell the car is like in anatomical condition or is it working. Seeing the car, you cannot tell, is it like, will it run or not? In the same manner, seeing a person unconscious or a dead person, from a distance, you might not tell that like one is living or not, because anatomy is not missing. Eyes are 2, fingers are 10, bones are 206. Anatomically, nothing is missing after death. What is missing is working. There are 2 eyes but cannot see. There are 2 ears but cannot hear. There is the same nose but cannot smell. The same hands but cannot hold. So the structure doesn't change after death. As soul leaves, the soul brought Tridosha into activation. When the soul leaves, departs, the Tridosha stop working. The physiology finishes, and the structure of Panch Mahabhuta we are left with. That is a dead body. So this is the main difference, anatomy and physiology. Yeah, maybe Dr. Raji.
I think that's brilliant, and you brought the point home that, and I can relate to it. My father, I can share that experience, was ill, and he was in intensive care, and he was on ventilator. Now he was on ventilator, and I believe that he is getting the medicines. There is artificial ventilation going through the ventilator, and everything is being done. But despite being in intensive care and on ventilator, early morning, suddenly they've called that he is no more. In the typical medical science, the heart is being pumped, the lungs are being ventilated, oxygen is being pushed. So what has changed? The body is exactly the same.
True.
That is the time I realized that this is the soul that actually keeps you alive. And that's the difference between a body that is alive and that is not alive. So everything was same. The whole body, organs, everything was same. But the life is given to the organs through the soul. And that is the spark. Once that spark is gone, I could see that spark going. And this is one of those things where we come to realize that there are different aspects of science in a different way, and they are not quite equivalent to each other. And the idea is how we become more tolerant to one or the other science, how we can learn more from each other so that we are more informed and get a better quality of care for our patient.
Very true.
Jayant is here, I think.
Yeah, so, Jayant is there.
While we are talking about it, do you want to give your views on it?
Yes, Jayant.
Okay, fine. Let me introduce him formally, and that is easier.
Yes, Dr. Raji.
So here we have Jayant Khullar. He's from India, and it's very important that he is a craniosacral therapist, which is a different type, as we were talking at the beginning of this session, that all different type of sciences or disciplines of sciences, including the traditional conventional medicine or modern medicine, Ayurveda, homeopathy, and homeopathy associated with yoga and rest of the stuff. But craniosacral therapist, which is very close to osteopathy, is a different science. And I know within UK, there is increasing recognition of it. And particularly if there is backache, etc., they go. And I think it'll be good to hear from Jayant today, his knowledge, because he is a certified yoga teacher and evaluator, but also a craniosacral therapist. He is also from Ministry of Ayush, very similar to yourself, Ish. And he has gone a lot of training, quite extensive training in Rishikesh. And I think it's very important. We were just talking about the ancient spiritual wisdom. So spirit or soul is what keeps us alive. And that is the part that gets missing. So same anatomy, same body, same organ, same function. If we have got that lost, it's gone. So I think it'll be very, very nice to hear from Jan what you think about it. I know he has explored some parts in modern science as well, nutrition and fitness, and he can bring it all together. So I think it'll be good to welcome Jayant and to share your wisdom. The power of CST touch is kind of your topic, but I think it'll be good to see where you want to take us, and we will have a little bit more conclusion at the end. So welcome, Jayant.
Thank you so much. Am I audible?
Yes, we
Yes.
can hear you.
Thank you so much, Dr. Rajiv. Just let me. Okay. So I'm very happy, very glad to be part of this beautiful group. I was so happy to see the kind of work you all are doing, and that too not for 1 or 2 days, but consistently since so many weeks. So very happy to be part of this group. So my topic for today is the power of CST touch. And I was listening to Dr. Ish, and he just shared that I have written it down. So he said the soul is very potent and powerful, and how beautifully all these sciences are connected. Every day when I read about CST, I get to learn more and more. And this line which Dr. E said, the soul is very potent and powerful, which is there in Ayurveda, I am practicing it in the form of CST, and it is bringing wonders. So without wasting our time, I'll share my screen quickly and just share my little knowledge about CST. So let me know if you can see my screen. Is it audible, visible?
We can see it, Jayant.
Okay.
Therapy.
Yeah. So craniosacral therapy, which is called as CST, and we will be talking about CST touch, which means that it is a touch therapy. So it's a very profound healing modality. So in this slide, I will be covering most of the questions which I have heard from people about CST, and after that we can open the discussion forum. So I would like to ask you, and you all can put it in the chat box, from your experience. You all are so experienced people in the medical field. So why do you think that we need healing, especially in today's time? What are the reasons? What are the cases you are overlooking? So why healing is needed? If anybody would like to unmute and share. Apart from diseases, why do we need healing in day-to-day life?
Yes, Jayant, we need healing because the way we are observing a downfall in the quality of life with the enhancements in the so-called medical science, it is doing good to a few pharmaceutical companies in a way, but it is bringing no good to a common man. The quality of life is deteriorating. That is where waiting to get ill and then going into a reactive medicine sometimes could be too late, too little. That is where to be predictive, preventive, promotive, to be like proactive, to be proactive against the incoming diseases, and not to wait for them, but to react or to proact much in advance is the only way out. That is where, and touch is the most powerful sense we have got. It has got compassion, it has got everything, it has got healing, it has got a scientific backdrop. We release endorphins, like endogenous morphins. That is why touch can be analgesic. A touch can make you happy. So that is where the power of touch, as you are rightly going to elaborate, is very relevant and most required today. Jen.
Yes, definitely. So, like Dr. Ish shared that the modern medicine, we all are into the reactive mode. Yeah. And like Shilpa is sharing, to lead good healthy life, Sonal stress-free life, to become more efficient and productive, as Nancy shared. So I just want to share you one story, and I was reading about it. It's in one of the village in China. So there are there are many doctors in that village, and those doctors are paid fully when everybody is healthy throughout the month. And it was so fascinating that if you are being paid to heal a sick person, that is sick care, and most of 99.99% of the world is functioning like that. But if somebody is being paid so that nobody falls ill, is I think actual healthcare. So healing is very much needed in today's world, and like Dr. Ish also said, we are under so much of stress due to lifestyle disorders because of our modern lifestyle and our health. These are very strongly correlated, and there are so many things we are all going through, and we all are aware of all these things: unhealthy diet, lack of movement, so much relationship issues, environmental degradation. Yeah, we were talking about how climate is increasing, it's too hot in UK because of climate change, technology addiction, stress, then insomnia, lifestyle issues. So all these things are taking a big toll. And I would like to ask you, how much percentage do you think that in the healthcare segment, how much percentage of the problems are coming due to this? You can put it in the chat box quickly. Just to make this interesting, I would like to know, since you all are expert, you can tell me much better than any other.
The figure, Jayant, is every every healthcare ministry, all the like governments the world over are spending 5% on the infectious disease control, and 95% is on preventive or what we call non-communicable diseases. The disease could be spreading through a microbe, bacteria, virus, fungi, protozoa, helminth, or they could be non-microbial, what we call non-communicable. So 95% goes on non-communicable, only 5% goes on infections. This is one figure, but it can surely vary.
Okay, so I have got my answer, and my job is like 90% done now. So that means 95% of the diseases are coming from this, which I have shared on the screen, and 5% is the actual diseases which should be treated by what we call as the medicine, yeah, where we should reach there. So CST is one thing which can really help in this. So I'll just quickly decode about CST, what CST is. So when I say I'm a CST practitioner, some people don't even understand what it is, because it's relatively new, although it's 200 years old science. But let me just help you with the CST terminology. So CST comes from the cranium, the cranio part, craniosacral therapy. Cranio comes from cranium, then the sacrum comes from the sacral, and therapy, you all know, it's the healing mechanism. Yeah. So craniosacral and therapy. So very important two parts of our body system, which is the cranial and the sacral part. We extensively work on these two parts, not only on these two, but these are the major thing. Yeah. So let me tell you about the history of CST.
Would you cover also how this can be integrated into the main line? I know we have got like 15-16 minutes, so if you touch on that aspect as well as the practical utility. Thank you.
Can you please repeat? It was not audible.
What I'm trying to say is that it's good to know the history, but also on how it is useful in the modern era, and how we can integrate that into the modern science, how we can bring it together, how it can be integrated.
Surely, I'll cover that. History, just one slide. Okay. So coming to the history of CST, so ET still is considered to be the father of osteopathy. So osteopathy is the main science from which CST has taken birth, and Dr. William Gordon Sutherland developed and he specialized the cranial part of it, the cranial approach in the practice of osteopathy. So he studied osteopathy and graduated from the AT Still University in 1900s, and during his school days, when he was studying in the college, he chanced upon a disarticulated skull, and he was wondering why the skull bones, the cranial bones, resembled the gills of a fish. If you can see this, these are the gills of a fish, and there was a resemblance, deep resemblance between the cranial bones and the gills of a fish. So in osteopathy, he has already studied that there is a relationship between the structure and the function in the body. So the gills are meant to breathe. So he thought that if there are gill-like structure in our cranial bones also, then those are meant to move, to make some movement. And after a lot of experimentations, he finally gave birth to CST. These are the gills of the fish. So there are 5 major principles which he developed, and it was, the first one is there is inherent mobility of the brain and the spinal cord. So when he proposed this in 1900s, there was a lot of rejection coming from the medical field because they never considered this and they rejected it. So he also said that there is fluctuation of the cerebrospinal fluid. There is motility of the intracranial and intraspinal membranes, and there is mobility of the cranial bones, and there is also involuntary mobility of the sacrum between the ilia. So these were the 5 principles on which he developed craniosacral therapy. So about CST now. So CST is a very safe, non-invasive, it's a gentle touch healing modality. It enhances the natural healing ability, propelling you towards vibrant health. It's a very profound transformative process. So how does CST help? So it brings a good balance in the mind-body system. It helps to in deep-seated trauma also. It has a lot of benefits in the entire range of health, not only in minor aches and pains, but also chronic and acute conditions. It primarily helps to restore the balance across various systems of the body, and ultimately leading you towards what we all need is vibrant health. So how CST works is, so just consider a case when somebody is not feeling well and the body system is activated to fight for the health. So during CST, we all know that the human body has a powerful inherent potential, and even when there is a disease, a trauma, a stress, the body fights for it. So CST triggers that inherent healing mechanism to bring a lasting relief from the diseases and the associated system. So with the help of a CST touch, the actual magic starts to happen. So why I am calling it as a magic? Because it creates a very, very safe and powerful space. And I should even say it is the most powerful space, because this space is very, very close to the space which we all have gone through, which is this, the womb. So that is the space where the maximum growth of a human body has happened, and with the help of this CST touch, we all can experience that. So what all can CST treat? I'll show you some pictures which you all can relate to. And now the names. So back pain, immune disorders, frozen shoulders, addiction, joint pains, and all these issues have shown significant improvement after taking CST sessions, and there are many more. So till now, if you have any question, let me know, and then I'll cover the last few minutes of this session.
It will be good to just carry on so that we can finish and then we can ask the question.
Yeah, sure. So about the powerful touch, so the number of diseases which can be treated through CST, we cannot say, because CST we directly don't work on any disease, not on any particular symptom. We work on the overall body's inherent healing mechanism. After that, the result is that whatever disorder is there in the system, the body automatically tries to heal. Like the body, the intelligence knew that the nose should come here and the ears should come here. So body is very intelligent, the whole space is intelligent. So when we go through that safe space, the diseases, the symptoms automatically improve. Yeah. So how a CST session is conducted? Is the screen visible?
Yes, we can see it.
So CST session is carried out with the patient lying down, fully clothed in a quiet and a peaceful environment. It involves a very gentle touch of the practitioner's hand. It is very gentle, not even as close to the acupressure touch. It's just that somebody is gently touching you over your, like a mother touching a baby. So this light contact may be taken up on the head, on the tailbone, feet, trunk, or any other part of the body as appropriate, as the body of the client guides the practitioner. So who all can take the session? So CST can be taken from newborn babies to elderly to young people, and it can help in illness, trauma, many stresses, strains, both physical and emotional. So basically it's everyone who can take the CST session. So does CST help healthy individuals? Yes. So those who are healthy, for CST boosts all the systems of the body and mind and creates a deeper level of well-being. So I just want to read one quote which was written on the grave of Dr. William Sutherland. So he said that be still and know, which is, I would say, the summary of whole CST. So when you are still, when you give the inherent doctor, the most powerful doctor sitting inside us, a chance, then you can overcome all these issues which we all are going through. So presentation I'm done with. It would be good if we can just discuss on if you have any question.
When you say that this is helpful, how does it actually differ from osteopathy? Because I found it slightly different than my understanding was. So there is osteopathy and various other things. We all do something different, which is like joint and bone manipulation. What you are describing is low touch technique. What actually does, how does it really work? Because, and what's the science behind it?
So osteopathy is the parent science, you can say, and the cranial approach of osteopathy, which specifically work on the cranial part, is craniosacral therapy. So I'm not an osteopathy practitioner, but a CST practitioner.
Okay.
Maybe Jayant, can you share maybe a couple of maybe or one or two success stories in brief, which could have been like delivered by you, or which your peers could have done that, just to give us a chance to appreciate the goodness.
Yeah. So Dr. Ish, I have recently helped one client of mine. So she was suffering from epilepsy since last 10 years, and I have the whole case study. I can show you, but I think it will be good to just share. So she, from the age of 18, she used to have regular seizures, and the frequency and the occurrence of those seizures were around like once a week. Every week she used to have, not like it used to last for around 60 to 90 seconds. So I have given her 8 CST sessions over span of last 8 weeks, and her duration of the seizures, the occurrences have reduced significantly. So relatively, I would say now she is lasting for around 20 to 30 seconds, and the frequency has also reduced. So from like once a week, it has gone to like once in 3 weeks.
Wonderful.
So for 2 to 3 times she had during the period when her this occurrence of has occurred.
Great.
And a lot of improvement in other things in the terms of quality of life. Like she was very timid, she used to think a lot, very introvert, and she has seen a lot of improvement in her studies also, confidence level, and all these things.
Wonderful. Thank you very much, Jayant. And I very well recall when Jayant was pursuing his graduation in information technology, and that was a time when we happened to meet, and I saw him for some of his very trivial health conditions, and somehow being in a very very different field, being in technology line, and from nowhere he had that spark and he changed his path altogether. Now he is into full-time healing and he has quit his corporate job to be a healer, which is a very bold decision and very big decision. And this platform extends you best wishes, Jayant, and a wonderful speech. Thank you very much. Dr. Rajiv ji, now maybe can we have Dr. Mridu or Dr. Baljot? Dr. Mridu is available.
I am thinking is that Dr. Mridu is available, so we might just carry on and then bring it back as the time goes. So let's just welcome Dr. Mridu Sharma is excellent, and I think the main area of her focus is managing the anxiety and neurosis through Ayurveda. And I think that is amazingly powerful from the point of view that there is modern world with increased mental health disorders, and 90% of them stem from directly or indirectly through anxiety and neurosis. So it will be really good to have her. Dr. Mridu has done her MD in Panchkarma age of 25, which is quite young, and she is associate professor in Panchkarma at Urmila Devi Ayurvedic College, and she is also vice principal there. So Hoshiarpur is again, I think, in Punjab. So I think we have a dominance of Punjab today. She has published 15 papers in journals, and I think she's practicing Ayurveda. So teaching Ayurveda and practicing Ayurveda together, I believe, is quite useful. So I think she's going to be sharing a lot of her wisdom with us. So are you ready, Mridu? And do you have a presentation, or are you just going to talk it through?
Thank you very much, sir. I have a presentation. I'll share the screen.
Cool.
First of all, I would like to thank Dr. Ish for just giving me this wonderful opportunity. Thank you, Dr. Rajiv Gupta ji, for such a wonderful introduction. And I would also like to thank this organization who's working very nicely, organizing lectures in Ayurveda and promoting the health and saving the earth as well as healing of earth. It's a very nice initiative. So myself, you have given a good introduction. I'm associate professor in Panchkarma and also the vice principal at Srimati Urmila Devi Ayurvedic College, Hoshiarpur, Punjab. And my topic for today is managing anxiety neurosis through Ayurveda. So before discussing any kind of disease or what leads to anxiety neurosis, I just want to discuss the definition of health according to Ayurveda. Acharya Shushruta has given it. Sam dosha, sam agnishya, sam dhatu malkriya, prasanna atma indriya mana swastha iti abhidhyate. That means all the doshas must be in equilibrium. Dr. Ish has elaborated the doshas in a very nice way. And I think it's clear to everyone in the session now. The digestive fire must be in a balanced state, and the tissues, that is the dhatus and malas, that are the waste products of the body, must work in a normal state. And the sensory and motor organs, as well as mind and soul, must also be in a pleasant state. Such a person is called healthy person or swasth person according to Ayurveda. So Ayurveda is a science which is almost more than 5,000 years old. So at that time also, the importance of mental health was known, and Acharya Shushruta has mentioned it, that if a person is healthy mentally, then only he will be considered mentally Only physical fitness is not enough. So why the mental health is important? Nowadays, it's mental issues are more prevalent as compared to the physical problems. So mental health is something that impacts our eating and sleeping habits. It is just our daily routine is like very much elaborated or focused by these mental health issues, and it has a lot to do with our physical health as well. As sometimes if a person is in anxiety or is in depression, he feels sick, he gets the headache, he's not able to eat properly, not able to perform his daily activities. So it is very important to address our mental health needs, or oftentimes we will feel the impact of it in the other areas of health as well. So now coming to the topic, in this era of stress, confusion, and competition, almost 45% of world population suffers from some kind of mental illness. And out of it, 25% of adults suffer from anxiety at some point of time in their life. So what is anxiety? Anxiety is a normal emotion. It's not a disease. It's a normal emotion. It is your brain's way to react to stress or alerting you of a potential danger ahead. Like if someone is having a big interview tomorrow, it's obvious he'll get stressed, he'll get a little bit of anxiety. Everyone feels anxious now and then. If there's a result coming or anything, the person gets anxious that what is going to happen, will I score good or not? But what is the difference between the normal anxiety or the disease? That the normal anxiety is occasional. It has a reason that why it is happening. That I have a big interview tomorrow, so I'm nervous. Once it will be done, I'll be selected, I'll be all normal. So, but in case of anxiety neurosis, it is an extreme form of anxiety or worry. Like patient or the person is constantly worrying that what is going to happen, what has happened to me in the past, what will happen to me in the future, what will happen to me after 5 minutes, what will I do, what I'm doing. He is having such kind of thoughts that compels the person to feel intensely worried. Anxiety is the abnormal fear that is out of proportion to any external stimulus. Like if a person is prone to anxiety and someone tells him that what has happened to your dress, he will just get that I'm not looking good, maybe there's some problem with me, maybe I'm not suitable for this place, and he will get that anxiety, or he will have that, you can say, the fit of anxiety. Anxiety was viewed primarily as a psychological response to internal or external stress. But the disease, anxiety neurosis, it is either a constant or a reoccurring feeling that like the person gets up in the morning, he's all healthy. Once he starts his day, he started to get anxious, and by the end of the day, his anxiety is at the peak, or vice versa. So what are the causes of anxiety? The most common cause is the environmental external factor like stress. If a person is stressed by his personal, professional, or financial life, then it's very, very easy to get anxiety. Trauma, any kind of trauma he or she has faced, can also leads to anxiety. Lack of oxygen in high altitudes. Generally, it's you can say there's a less oxygen there, so the person feels difficult to breathe and sometimes gets anxious. But if it persists or if it pertains, then it can lead to you can say pathological anxiety. Any kind of addiction to drugs or self-medication is also a very major cause, because the person gets into drugs and that dose increases or anything, their hormones changes, and then they face anxiety because of it. And there are several diseases like thyroid, heart, lung diseases. Patients with such diseases are very prone to anxiety because already a lot of symptoms or signs they are facing in their body, and they are worried that what will happen, will they survive, will they overcome this problem. So patients with such problems are more prone to pathological anxiety. And there are some kind of infections or some kind of accidents sometimes. Bad accidents happen that also leads to anxiety. And the another factor is genetics and brain chemistry. There are some kinds of problems which runs through the family, and now the new problem which runs into the families of depression or anxiety. Like I have seen many patients come to my clinic and they say, my father had this problem, so I'm having anxiety or I'm having depression because it runs in my family. So it's very normal for them, like diabetes. Many patients have come to me with this history that my father had that problem. My sister is also in depression, so I'm also in depression. So that is also very major factor coming along the way. And the another is brain chemistry. In a study, it has been shown that there are some people whose brain circuits are arranged in a way that they are overthinker and they can catch anxiety early as compared to other people. So what are the risk factors? Childhood trauma, if there is a child abuse or a sexual abuse happened, then there's a risk that the person might develop anxiety. Negative life events like the loss of a loved one or typically parents at a very young age can lead to anxiety or any kind of mental disorders. Low self-esteem, if a person is not confident in his body or is not confident in a place or event where he or she is, that can also lead to anxiety. And the one factor which I have observed a lot is being shy. If a person is a very introvert, you can say, and he's very afraid to meet people, and he has been put to such condition or position, then he might be very anxious, and sometimes it goes to a very high level. So I'm from Ayurveda, so let's discuss before treatment what is anxiety neurosis according to Ayurveda. So in Ayurveda, anxiety neurosis is called Chittodveg, and it is made up of two words, Chit and Udveg. Chit means mind and Udveg means anxiety. So Chittodveg is the anxious state of mind, or it is the unsteady state of mind where a person is not able to take good decisions or is not able to behave normally. He behaves a little panicky, a little anxious. It can be correlated with anxiety neurosis, which is a very common disease. And in Ayurveda, Chittodveg is considered as an individual disease also, or as an etiological factor for many other psychic and psychosomatic diseases. Like it is mentioned in Unman, like that is schizophrenia. We can correlate to schizophrenia, that if a person is having an anxious state of mind, it is very common that he might develop the next stage, that is the schizophrenia. So what are the factors according to Ayurveda? Dr. Ish has discussed the doshas. So there are also mental doshas, that is Raj and Tam. So Raj and Tam are the main etiological factors for Chittodveg or anxiety neurosis. So in Ayurveda, all the diseases are caused by three factors, that is Pragya, Paradh, Parinam and Asatmi Indriyat Sanyog. I'll discuss it one by one. Pragya Paradh means intellectual mistake. The mistake which is done knowingly, like ignorance. Everyone knows that eating junk food is not good for our health, but still we do it. Why? Because we are ignored about our health, or we don't take it very seriously. Then what will happen if we had a burger or a pizza? It will not affect much, but we know it is not good, but still we do it. Rebelliousness, which we say sahas or sometimes adventure, you can say. We know that jumping from a height is not good. We might fall, we might break our leg, but still some people do it. We know that riding a bike on a jerky road for a long distance is not good, but still we do it because we are rebelliousness by nature. We are just like, no, nothing will happen to me. I'm all young. It will not happen to me. Or the forgetfulness. Forgetfulness is that we know we should not do wrong to any person for just our momentary benefit. But we do it, and in the later stage of life, we might feel guilty about it and might develop anxiety neurosis. The next is Parinam, or the seasonal variation. Seasonal variation is very common when it comes to, or is a very common factor when it comes to the mental diseases. So the external environment, it is seen then when the seasons are damp, or when there is a lot of snowfall in a place. Like I have seen a patient who shifted from India to South Korea, and he had a very good job and position at all points. But when there's a snow at that place, he He got all panicked. His anxiety, he got so anxious that he left his family and flew back to India and said that I cannot survive in the cold temperature. I'm just feeling that something will happen to me. I'm getting anxious and I'm highly to develop the depression. So unexpected climatic conditions are also like in UK now, the temperature is gone to 40 degrees. So this also leads to some kind of diseases. And if a patient is prone or a person is prone, he might develop the anxiety. Because all the seasonal things have influence on our doshas. Like in the rainy season, naturally Vata increases. So if the Vata increases in the mental disorders or the Manas doshas, we consider Vata as Raja. If Vata increases, Raja Gun increases or Raja dosh increases, which is also etiological factor for the anxiety neurosis. Third is asatme indriyat sanyog, that is misuse of senses. We know that looking at the mobile for a long time is not good for our eyes, but still we do it. We know listening to loud music or using the earphones for a long time is not good, and it might affect our body, our mind, our concentration. But still, if we do it again and again, it's not a one time that you are listening or you are watching a mobile one time and you will get anxiety or any kind of disease, not particularly anxiety or any kind of eye disease. But if you do it regularly, persistently, it will affect your concentration, and naturally, if you are prone to, if your sattva is low, what we say, if your sattva is low, you are prone to catch any kind of psychological condition. So what are the signs and symptoms of anxiety neurosis? The first sign and symptoms is unsteady state of mind. Patient is not able to focus, not able to concentrate. He is not able to make good and wise decisions. Fear of facing public. This is the most common symptom which appears, that the person says, I want to stay alone. I don't want to go to any party or go to any place. Loss of confidence is another factor. Weakness, loss, and either the loss of sleep or excessive sleep can be seen. Palpitation, if the person is told or put in the public, he feels a palpitation. He feels that, no, I'm not comfortable here. I need to get out. Something will happen to me. I will get some kind of disease, or I will just faint. So such kind of conditions are faced by the patients. Negative thinking, another very, very common or very, you can say the first positive or the first symptom that comes in a patient with anxiety neurosis. He thinks negative, that something bad is going to happen to me and that will affect my life, all my worldly possessions will be lost or something like that. He gets the negative thinking. Headache or the loss of appetite. So what is the treatment of anxiety in Ayurveda? Ayurveda is an ancient science based on doshas and dhatus. There are various types of treatment in Ayurveda. There are mainly 3 kinds of treatment. First is Nidan Parivarjan. That is, if you know that this factor is triggering your disease, just avoid it. But as we come to the treatment part, that is, if we use the medicines or any kind of, there are 2 types of mainly treatment. One is Shaman and one is Shodhan. Shaman is pacification, that is to treat the disease with the use of medicines, medicated powder or medicated tablets or anything. Purification is the treatment using Panchkarma. So the basic difference between pacification and purification is, if we have a disease and if we give medicine to the patient and the disease subsided, it is a pacification treatment because the toxins or the disease causing organism is in the body but is inactive. But in purifications, we detoxify the body. We take out that toxin or that disease causing organism which is causing the, or the factor which is causing the disease. So in pacification, we give all the brain tonics or all the medhya dravyas which are mentioned in our text. The most common are Brahmi, Shankpushpi, Jatamansi, Shatavari, and gold compounds or turmeric latte, nowadays very famous in Western countries. It has been used very widely in the treatment of mental disorders. And as far as homely treatments are advised. So ghee and milk, they are considered best rasayan and best medhya rasayan to be taken in case of any mental or psychological disorders. Shodhan Panchkarma is of 5 types: Vaman, Virechan, Basti, Nasya, and Raktamokshan. So out of which Vaman and Virechan are indicated in psychological disorders. But as it comes to anxiety neurosis, Shirodhara and Nasya, they can be, they are very, very effective in the acute and chronic stages of anxiety. So I'll discuss prominently these two. So what is Shirodhara? Shirodhara is basically the pouring of fluid, that is medicated decoction, oil, takra, anything over the forehead, that is between the eyebrows where the Agya Chakra resides. It is done either in the oscillatory motion or in the fixed position. The temperature of the oil or the medicine is slightly warm, and it is done from a certain height of 4 angul, that is 4 angul. It is done. So why Shirodhara is effective? I will try to explain it. Because it produces a constant pressure and vibration, which is amplified by hollow sinus present in the frontal bone. That is also the site of Agya Chakra. The vibration is then transmitted inward through the fluid medium of CSF. This vibration, along with little temperature, may activate the function of thalamus and basal forebrain, which then brings the amount of serotonin and other hormones to the normal stage, which are increased in the stage of anxiety. It soothes the mind. And another thing, if we pour something from the height, the physical energy is converted to the kinetic energy or the electrical energy, which soothes our nerves. And pressure also has an effect on impulsive conduction. If prolonged pressure is applied to a nerve, impulse conduction is interrupted, and a part of body relaxes. And Shirodhara has 4 major effects. The first one is tranquilizing effect. I told you earlier also, patients suffer from lack of sleep or are very anxious. So the first line of treatment should be that to make patient calm. So Shirodhara does it very nicely. It has a tranquilizing effect because the oil we pour through Agya Chakra reaches the brain cortex. The second is on the autonomic nervous system. It helps in the, may also have alpha adrenogenic blocking effect. It helps in the secretions of certain adrenaline or noradrenaline hormones, which helps in the treatment of anxiety. The third is effect on endocrine system. As our mind is soothed, our all hormones, all the nervous system are basically working properly than before. It also has effect on the hypothalamus, which is responsible for the all the functioning, emotional state of the body. So if hypothalamus is properly regulated, our emotional and behavioral patterns is also regulated, and hence the patient gets relieved or shows a significant result from his anxiety condition. The second treatment is Nasya. Nasya is basically the pouring of medicated oil or any medicated drug. Basically, oil is poured in anxiety neurosis through nose. So why is it important? Because Nasa hi shirso dwaram. In Ayurveda, we say nose is the gateway to brain, and it helps in the cleansing and opens the channel of the head. It relaxes the mind. It has a tranquilizing effect. It nourishes the mind because oil is used, and it is a we can say snehan karam is done, oleation is done of mind. So it nourishes the mind. And another thing, it is a known habit forming, and a type of nasya, that is pratimash nasya, is also described in daily routine in Ayurveda, that it should be done daily with anu tail, that is 2 drops or 2 bindu basically, but in modern times we use it at drops because our sattva is not as much as mentioned. So other procedures which are beneficial in the treatment of anxiety neurosis is abhyang. So why I have mentioned abhyang? Abhyang is basically the body massage or the oleation of external body or internal body Snepan is also done, because I mentioned it earlier also that Raja Gun corresponds to, or Raja Dosh corresponds to Vat. So if there's a dryness in the body, Vat increases. If Vat increases, Raj Dosh increases. So this is related to the anxiety. And Shirobhyang, that is oil massaging of the scalp, again the same function, it nourishes the brain, mind. The another thing which is very good in the treatment of anxiety neurosis is yoga. Yogascha chitta nivriti nirodha, that is yoga is the complete settling of the activity of the mind. So what yoga practices can be done? Regular practice of Kunjal and Jalniti should be done in the presence of expert only, not self practice is not recommended here. Shavasana, very common asana, and it can be done without any practice. Relaxation techniques like meditation or anything. Pranayam like Ujjayi and Bhramari, again needs expert guidance. And asanas, some of the asanas, that is Shashankasana, Tadasana, Bhujangasana, these asanas are, or Balasana, these asanas are very, very effective in the treatment of anxiety neurosis. And besides that, counseling should be done to the patient. Patient should be advised to practice light exercises, yoga, meditation to keep himself or herself healthy. He or she should follow a hobby. Like if she likes to sing, if she likes to write, she should follow that, or he should follow that. So that will divert his mind and he will not overthink. Listen to some music, soulful music of his or her own choice. Stressful conditions should be avoided. Heavy meals should be avoided at night, and the tea, coffee, smoking and alcohol use should be restricted. So in conclusion, I would like to say that every person almost suffers from anxiety at some point of time. It can be normal anxiety, it can be pathological anxiety. That depends on person to person. But basically, the pathological anxiety is the unsteady state of mind with or without symptoms, and it deteriorates patient's confidence. The first thing we see is change in his behavior or change in his or her daily routine. Ayurvedic treatment is non-addictive or has no known side effect, which makes it safe for the prolonged use. Meditation and yoga are the treatment without infusion of medicine, any medicine in patient's body, and is highly beneficial in the treatment of mental ailments, and it should be practiced by healthy as well as by any diseased individual. By this, I'm ending my session. Thank you very much. If you have any questions, please.
Excellent. I think it was one of the most brilliant presentation, Vidhu. You have
Thank
actually
you.
summarized everything, and it matches my thinking, and it matches to a great extent what we do even in the modern science. So one of the main aim of this integrated health, that project which we have, is to have the similarities together so that we can find it one or the other. So I think you have done that job very well. Second, you have also given very succinctly all the points with a clear explanation of what is Shirodhara, what is done, how it is done, what is the benefit. And I think that is very good, because anxiety, as you mentioned, is very common, and changing the anxiety into anxiety neurosis is where difficulty arrives. I think it is one of the best thing which we can do for mental health. So I would be very keen to have more discussions, and probably we're going to come out with a journal of integrated health within the practitioners. So I think I'll be delighted to get an invited article from you on
Sure.
what you have mentioned.
Sure, sir.
Can I ask you a question? So, of various modalities that you have described, what would be good to give to people who have a stressful period? And I know the main thing is to remove the stress, and then your anxiety will go away. But with all difficulties in the world that's happening, particularly with the COVID time, people had anxiety due to the death of near and dears, loss of jobs, So that is still there. So what would you say to do in case we cannot remove these factors?
I would like to say that if a person cannot, like most of the mental or psychological conditions, we don't seek help in the beginning. So what I can recommend is follow the daily routine. In daily routine, Abhyang, that is massage of the body, is indicated, which I have mentioned in the treatment. Nasya is indicated, which I have mentioned that it is very good. So if someone do Pratimash Nasya daily, it is very, very like unreal that he might be infected or might get anxiety or any kind of psychological disorders, because in Ayurveda it is said if you follow the daily routine and seasonal routine properly, you will not get any kind of disease. You just have to maintain your health.
Neha has a question. Neha, can you come in? You can unmute yourself.
Yes, thank you. It was wonderful presentation, Dr. Sharma, and I'm very pleased that you took such a wonderful topic, which is very much needed during and post-COVID. One question I had, you seems like compiled everything which we do require, but in my understanding, I'm not Ayurveda, so understanding of mine and most of us that it is very individualized therapy. So it seems like what you have compiled, it can be practiced by all, or it still needs an individual therapeutic approaches by the Vedyas.
Ma'am, as far as the meditation, I'll start one by one. First, if the meditation, you want to do meditation, you can start at the basic level of your own. But if you want some advanced level, obviously you need help. Yoga, basically the pranayam, basic breathing exercises, basic asanas, that can be easily learned from the net. It is easily available and they are not very tough to do. But some kind of yogic kriyas, like I mentioned, Jal Neki or Kunjal, they need the expert opinion. And Abhyang, that is massage of the body, you can do it yourself.
Okay. One more thing, Dr. Sharma. In the UK specifically, we have many concerns with the touching. I'm sure Dr. Gupta would agree that with the Shirudhara, with the oil application, with massage, Abhyanga, as you mentioned, we found it the feasibility questions were very tough. People go private, but we cannot administer in the community level or in the support groups. So what we found here, I was told, and I'm not sure, but I think you would be the best guide to support planning this community intervention. Somebody mentioned about Sattvajaya Chikitsa. Now, in my understanding, you covered it, the counseling part and the yoga part. Am I correct? So that could be a good combination to start with from general way, but then of course with Vedyas, it could be more specific and guided. But do you suggest that could be a good way to integrate in the community?
Yes, ma'am, that is a very good way, because it is first a non-interventional treatment. You don't have any fear like that. But the second thing is, I will show you an image if I find it. There's a self-massage. You can massage your body by yourself. I will try to find it, and if it is possible, I'll share it now. Because why I'm recommending it, because you live in a cold or a dry country. So obviously in Ayurveda, we feel, or it's obvious that there's a Vata Prabhu. So there's a dryness is there. So if you do self-massage, it will be very good. And it will obviously benefit you more.
Yes, we had a session by an Ayurveda expert. He showed marma, which he also showed doing on your own. So is that the same thing or it's something else? I would really like to have that.
No. It is different, ma'am. Okay. Because they are expert in it. Mine is just in self-massage, you can only apply oil to yourself. Because it will not be good to advise myself that, because I'm not expert in it myself.
Yes, yes. My concern is the same, that when it comes to marma, or when it comes to, the specific, as you said, kunjal or jalneti, they need to be supervised. We cannot suggest, and this is my concern, that if we bring it something as a generalized management, it should be no concerns at all. So if you kindly can share the massage you were mentioning, it would be very helpful.
Yeah, ma'am. I'm just trying to find it. If I find it, I'll just share it now only.
Thank you. Thank you. It was really wonderful.
Thank you,
Hi,
ma'am.
Jiva. Seema, do you have any comment or question? And then we can ask.
Global Namaste. Yes. So basically, when you're talking about self-massage, I've come across something very special that's called a Kansa wand.
Yeah, ma'am.
Yeah, and it's got brass. It's brass, right? And I use that for my night routine of Padabhyanga.
Yes, ma'am. You can use
and
it.
It's a great nighttime self-massage. And I do want to ask you. You spoke about the different, prescriptions we can employ in our daily routine, especially in dinacharya when we wake up in the morning. For example, we can oil pull, and of course, nasya is a very important part of our morning routine, as is kavala.
Ma'am.
What is gandusha, putting oil in your mouth and holding it in. And you spoke about Abhyanga now. The lovely lady just before me asked, how do we do a self-Abhyanga technique, which you said you'll be showing us a video, which I would really appreciate as well, because this is something I always struggle with, is how to do a self-massage. I do use the Kansa one, but is it as effective as the actual Abhyanga that you traditionally teach for self-massage?
Actually, ma'am, Kansa wand is very beneficial. But before using the Kansa wand, also we apply oil. So if you apply oil and then it's all, you are doing a good procedure.
So what I was told, the prescription I was given was, if you suffer from insomnia, to apply mustard oil, sarso ka tel, on your feet at night, and it will enhance good sleep, or ghee.
Yes, I recommend ghee.
Ghee, okay.
Yeah, then I recommend ghee, but maybe.
Is it because sarso makes your pitta go high?
No, basically the main effect of using the oil is to oleate your body and calm your muscles, basically all the nerves. So yeah, it does not basically aggravate pitta in an instance. Like, the quantity is obviously very less to aggravate or elevate any kind of doshas, but naturally it soothes.
I'd like to also touch on oiling the belly button. The benefits of oiling the belly button. There's a lot of talk these days about the benefits of oiling the belly button. You have all these different oils popping up in the market. You've got Nabi oils, they call them Nabi oils, and there's this new brand in India called Nabi Sutra. So do you recommend oiling the belly button, and what are the benefits?
Yes, I recommend it very highly to my I recommend it in the patients with constipation. If a person is having constipation, I recommend them castor oil, nabhi puran, or the filling your belly button with the castor oil. If the person is having any kind of pain, so I recommend oils like that. If a person is having the menstrual problem or PCOD kind of problem, I recommend them sandhavadi or chincha tel. So yes, I highly recommend it, and it basically it reaches the site of Vata, so it reduces Vata basically.
Vata, okay.
I've experienced in my practice.
So for arthritis, what do you recommend?
There are a number of oils present in Ayurveda for different kind of doshas, but for arthritis, typically if there's an osteoarthritis, so basically it needs a lot of oleation. So massage, anima therapy, virechan, basically in Panchkarma if you are asking. So such things are very beneficial.
Virechana.
Virechana.
How about the poultice? How about the
Yes, ma'am.
poultice? You know, you
Poultice is also very
make the poultice in Ayurveda with the cloth,
sorry,
and they do the poultice massages. I don't know what they're called.
yes, ma'am. That is
I
Patra Pindi
forget the Indian word.
Yeah, there is Patra Pindi Swed or they are either Upnaha. They both are very beneficial in the treatment of arthritis.
So I had a Panchakarma treatment a couple of years ago, and actually not so long ago, I'd say 2 years ago. And the doctor recommended I do the poultice massage. So they actually had red rice in the poultice.
Yeah,
And
yeah, ma'am. That is, yes.
it was fantastic.
Yes, ma'am.
It was amazing. I loved it.
Yeah, it was,
I
I
felt
think,
so. I can't remember the name, but it was just the most amazing massage I ever had.
Yes,
I
yes,
have
ma'am.
to
It is
admit.
also very beneficial and also very good. Also in the treatment of like some kind of, there's a muscular dystrophy or any kind of weakness, that is also very good. Shalishashtik Swed is also very good in that.
I think it has been extremely good session. Mridu, there are so many questions. We probably need to bring you back again to answer so many questions. So we have come to a time. So I think we'll keep in touch to really do more work.
Sure, sir.
Speaker is here, but before that, Ish, any last minute comments?
Yeah, thank you very much, Dr. Mridu. This was wonderful and very enlightening. And we will be requesting you to be present on this platform every week as much as possible with Dr. Baljot, Dr. Pradeep, Jayant, Sonika, Mamta. We have to expand this message. And you all, being Ayurveda teachers, you have a responsibility to bring your teachers along with you so that the students are motivated in right time. When they are in their first year, second year, third year, they come to this platform and listen to like stalwarts across the globe. Then those can be really motivated in time when they are in their like budding years. So this will be the real good we can right motivation we can give to the students, Dr. Mridu. And I have personally witnessed you doing so well. Dr. Rajiv Gupta ji, we were at the same place in Hoshiarpur, and our workplaces were very much nearby. And she is a very enthusiastic, very hardworking person, very sincere doctor. And we look forward to more associations with her. Maybe can we move on to, and Dr. Mridu, you will have to hold on because so many questions will be waiting for you. Dr. Gupta ji, Dr. Rajiv ji, can we move on to Dr. Pradeep for the time being?
Fantastic. I think that's brilliant. So as more time is going, and it is so good when the speakers are good. There is so much of buzz in it, and the people feel so much like relieved with the degree of questions they have in mind, but also there is more stimulation, more thinking, and that is purpose, that we are not doing it as a rote learning. We are doing it to stimulate thinking, to help people heal themselves, and hence the healing of earth, the name. And we know that it has been a long journey, 141 episodes. Really, it's a big achievement, and I am grateful to the whole team of Healing Our Earth for bringing it into action, doing tireless work. And that is really very clear here, that the whole day is just going round, 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 without realizing how much time we have lost. So two more things. The next week is our 15th of August, the Independence Day, and hence I will request people to really have a good celebration. It is India's Independence Day, and we must really have a joy. So people who want to sing, people who want to have mono acting, anything else, any act that you want to do, or even to come and just join us for fun, please do. 15th of August, next Sunday. Now let's bring here you go, here's the flyer. So जरा याद करो कुर्बानी, ऐ मेरे वतन के लोगों, जरा आँख में भर लो पानी, जो शहीद हुए हैं उनकी जरा याद करो कुर्बानी जय हिंद जय हिंद जय हिंद की सीमा. Thank you so much.
Thank you.
Let's get Pradeep. Pradeep is a professor. He's a postgraduate in basic principle of Ayurveda and Panchkarma. And it is a very good combination of both clinical and academic field. And he has a professor position in the Institute of Panchkarma Center. And I find it very interesting that he has visited so many countries, including Asia, Australia, New Zealand, Nepal, and many other places. And Panchkarma is one of basic thing that is not offered in any other science, and it give relief to so many acute and chronic ailments. And therefore, it will be good to hear from Pradeep himself the promotion and globalization of authentic and traditional treatment of Ayurveda, including the Panchkarma, because from every time Ayurveda, Panchkarma is like unique selling point. So let's welcome Pradeep. Please share your view.
Thanks a lot, sir. I'm hearable?
Yeah, I can hear you.
Thank you, sir. Good evening, all of you. Great pleasure to see you all at the same platform of Healing Our Earth once again. As Dr. Saab told about me that myself, Dr. Pradeep Kumar, I am professor in basic principles of Ayurveda and working as HOD Department of Sharir Kriya in Guru Nanak Ayurvedic Medical College, Shri Muxar Sahib, Punjab. The topic of my today's promotion is promotion and globalization of authentic and traditional Ayurveda. As Dr. told that I am running my own Panchkarma clinic on the name of Herbal Miracles Ayurvedic Clinic. As we are talking or we are going to talk about promotion and globalization of authentic and traditional Ayurveda, first of all, I would like to thank Healing Our Earth authorities, which is already doing this all. Every Sunday, every lectures, and it is motivating people all around the globe with its online discussions, Sambhasha Parishads, and all motivating lectures. And it is great work helping society and motivating our next scholars and graduates and postgraduates already working in Ayurveda by seeing your lectures, sir. Thanks a lot for the same again. Ayurveda is gaining popularity at the global level and it is increasing day by day, but which is at slow pace, what I think so, by visiting a lot of countries. Because to get recognition at government levels, it is just possible mostly in India or in some neighboring countries, what I see in my practices, with free hands practice and using Ayurveda protocols in regular practice. Like, I will like to share my journeys of Ayurveda globalization along with the patients coming all over the globe from mostly Schengen countries, Asian countries, Australia, New Zealand, USA, to my place, which is not even on the map, the small city Faridkot in Punjab state in India. And I will like to thank my Guru, Dr. Ish, for giving me this opportunity for setting up a Panchkarma center. I will start my journey. And first of all, I visited in Asian countries, mainly in Thailand and Malaysia. What I seen there was some massage therapies. There I visited one center which was giving some Ayurveda style restaurant facilities, having Vata tea, Kapha tea, Pitta tea, and some Ayurvedic paranthas, whatever the style was there. They were giving some yoga therapies, some meditation purposes, and massage therapies. I liked it very much, but that was some near the picture or trailer of Ayurveda, what I felt there. The people were doing very good. Then I visited in some Malaysia, some place in some Ayurveda center that was having some patients for Panchkarma from all over the globe. They were having one patient at that time for muscular dystrophy from Japan. There was some other patient for rheuma and knee arthritis. They were giving traditional Panchkarma, like that was rated to some company. I think so, that was Kotakal. Then I seen or given some lecture in some gurudwaras, some temples there for Ayurveda. People were very enthusiastic and I got some local products on the name of herbs, blended herbal oils there, but not some good medicines from very good famous companies, you can say. But that was just, I think so, that was just commercial angle of that products. I was eager to get some raw herbs to give some treatments to patients on the honorary basis, because I was on the visitor visa mostly, and I was not allowed to do work there. So, but I got some ready products and raw material there. Then I visited in Nepal for some international conference in some Ayurveda college, Tribhuvan University. There again, I seen a very big scenario of Ayurveda, a lot of enthusiastic students, a lot of people. Before people visited there from India, and that was a big deal for globalization of Ayurveda. Now these days, a lot of colleges, a lot of societies are working in Nepal, Kathmandu and other places for globalizing and promoting authentic and traditional Ayurveda with its Ayurveda curriculum. And they people are allowed also after graduation to visit in India for post-graduation, like Dr. Ish is sitting in Mauritius, and there people are allowed after graduation for post-graduation and graduation in Ayurveda in India. Then, with the blessings of Dr. Ish, I visited with him to Schengen countries for some Ayurveda tours, and there we visited for mainly ISRA, which was working for Ayurveda. There, we taken some lectures there in Netherlands. We did one clinic in Belgium with Dr. Ish. We gone to France and Germany. I visited in Tübingen University in Tübingen in Germany. There, I visited a very good and great herbal garden where I seen the herbs from all over the globe. But people were using those locally. Again, the same scenario. I have not seen any ready product or any good center there. Only merely massages were there or some spa treatments were there, what I seen in the Germany. But I heard a lot of lectures on globalization of Ayurveda, or I heard a lot of people talking about this. They are saying that there in some universities, there are some running courses in Germany, which are giving some authentication to the Ayurveda courses. But again, it is not allowed at the free hand service. Actually, as all, we know that what globalization stands for, as it is exchange of topics, culture, and ideas. The best example in Ayurveda for the purpose was our wandering physicians. What I see, as last week, it was Charak Jayanti, and the legendary foremost father of medicine, Acharya Charak, was known for its name because of the wandering physician for visiting all over the globe. And the best example I heard and I taken for that Charak Jayanti lecture was that we seen on the net, on the research, that there was one club registered in New York in 1898 on the name of Charkacharya by giving the Charka Club. Its name was Charka Club, and they honored a stamp to Acharya Chark as father of medicine on the name of Charka Club. There was a stamp registered in 1898, and this company worked for 44 hours up to approx 1944. They were giving its volumes, they were giving its journals for the which was working for the globalization of Ayurveda. Then the people are very eager to visit Prod by using the ladder of Ayurveda or along with some other fields. It is hard to believe that to earn some bucks or merely on the name of some visiting working globally with the raw herbs or some ready products as just or massages or some diet formally. Being Ayurveda Vaidya's, these malpractices should be restricted with authentication with the government stance or some other levels. I think so. If we will use the basic knowledge, basic principles of Ayurveda at these places, or the our NGOs or our societies or our associations of Ayurveda will talk to government, then these things can happen at some level. There are a lot of societies or NGOs or associations are already working globally, like our society, they're Healing Our Earth, maybe NAMA in USA, National Ayurvedic Medical Association, or California College of Ayurveda, or I visited in Australia and New Zealand. There I seen AAA, which was Australian Association of Ayurveda in Melbourne. I visited one center there also. Again, it was attached with Ayush protocols. Then there is some ASAP, Association of Singapore Ayurvedic Practitioners. This is also working good with yoga practices. IA, International Academy of Ayurveda, ISRA is there, APNA is there, and again, a lot of other societies are there. I visited in Auckland with some Dr. Ajit. He has also got some Panchkarma clinic there in the name of Planet Ayurveda, and he's also running AIAS, Australian Institute of Ayurvedic Sciences. The people from a globe, they are taking courses from there and getting treatments also. What I want to share, these type of other companies are there in USA, Germany, and other places. These days, WHO and Ayush are also joining hands for the same, and for the research products also globally going on. Ayush International Chair is there. We have got good example of Dr. E. Sharma, who is working in the University of Mauritius in the Department of Medicine as an international chair of Ayurveda, which is a big deal. And for the globally, he is already doing the promotion and authentication of the traditional Ayurveda. International seminars are going on, sir, already. Like WAC, World Ayurveda Congress, is in pipeline in December in Goa, in India. And one surprising thing, one AugustCon seminar is going on today onwards in Goa, which is international seminar by some Nanal Foundation in Pune. International research journals are already there, which everybody knows. And as we people are mostly here related with the UK, and I heard about, not visited there, and that there is practicing herbal medicine is allowed, and but not too much. And I don't know what level it is legalized and or what level we can do that. As I have heard about that some Ayurvedic curriculum is there, which is planned by the government, maybe from some years course for practicing Ayurveda, or both Ayurvedic way in academically and clinically. But I heard that again, it was not possible to use herbomineral drugs there. Even people were using mostly the supplements there, or only as a wellness coach or therapist, not as doctors of Ayurveda. They are restricted to use only the supplements. And some 5 principles use is more there on the name of the NIMS, NYMMS, which is nutrition, yoga, meditation, massage, or some social sport, spirituality. Means there is again our traditional treatments like maybe typical Panchkarma or some other pathies are not involved properly. Not much funding and insurance is allowed or available. But I heard, I visited a lot of times to Europe, 4 times mainly. After Brexit, it is a bit easy what I seen and from local people. But again, it will take long time for proper globalization of Ayurveda on those areas. Maybe some people are working in Ireland or some other are working in other places in England. We, being the properly globalizing Ayurveda with authentic level, by visiting a lot of places, I was blessed by Lord Dhanvantari that I got a lot of patients from abroad to my clinic, that is Herbo Miracles Ayurveda Clinic and Panchkarma Center. I will like to share some patients who came as for 4 to 6 week programs for Panchkarma. As I told that Faridkot, the small city of Punjab state, is not on the map even, and people don't know where they are going, as they are getting free treatments, free medicines in their countries. Besides that, they were so much weird from their symptoms of the diseases, mostly chronic diseases. So they visited our place while they were in touch with us, while we taken some workshops or events in mostly Schengen countries. I would like to share my first patient was in 2017 from Dunker place near to Paris from France. It was 170 kg guy with Lyme's disease, having elephant type swollen lower limbs. And I will first discuss my patients and tell what we done there. And all these were for 4 to 6 week programs for Panchkarma therapy. Mostly we were using the Vasti Karma, Vrichna, Vamana, whatever was comfortable. Then we got some patient with SLE, sclerodermy, lung fibrosis, having 29% lungs only from Schengen. And this disease was 33 years old. To have that patient, which is the Sita Gulab, she is like to get explored all the time, so we don't kept her name hidden. And I would like to share one thing, that she was on mercy killing. She was patient of Dr. Ish, and she visited us 4 times through India, and she was given only 2 months, sir, in November 2017, and till date she is working. She is doing meditation. She is visiting India. She is exploring Ayurveda, yoga, and other spiritual therapies, and she is alive with Ayurveda Panchkarma, and she is taking our medicines till date, only herbs. Then we got some patient from California for Sjogren dry eye syndrome with some knee arthritis, one couple of couple from Toronto for insomnia and depressive disorders, one patient from Muscat, Oman for Pakshaghat, IDDM, hypertension, and IHD, and that patient was came on the wheelchair flight, followed by 3 people: his son, his friend, and one colleague. One from the New York, USA for renal disorder, having retinal level more than 3 and having other symptoms. One patient we got before COVID, drooping contraction, one Dutch guy of 64 years, having more other problems related to the rheuma. And that was our last patient before COVID. Now, after COVID, one patient just left my clinic from Melbourne with the alcoholic hepatomegaly and splenomegaly and sleep apnea and low immune symptoms with some panchkarma treatments. And I will share one more patient from Auckland, which was with herpes and other related STD symptoms. Like these, we have shared a lot of other patients like coccydynia, osteoarthritis, GERD, or myomas all over the body, or arthrosa, and one with the RLS, which was restless leg syndrome from Holland only. I am sharing all these patients as we are talking about the globalization of Ayurveda. Maybe it is the sharing of the culture or ideas or some treatment protocols. Maybe we are visiting abroad or people are coming here in India. As Ayush has also made some protocols these times that people will be easy to visit India for Ayurveda treatments. Last Modi ji government has done something about this. And like that, people can take courses and we people can move to India, move to other places. Like this, all in these cases, which were not allowed, the challenges mainly abroad India for doing Ayurveda and fully practices, like we were not recognized fully abroad in these places where we visited in the countries or neighbor places. We were not given the perfect prefix as doctor. We were just a therapist there or some practitioner. We were not having some direct license. We were not the open practitioners with free hand with some Ayurveda protocols. Like in Holland, we were not allowed to do Nruhavasti at proper, it's with its full pace. No fully raw herbs or ready products, even import is very tough. And I was surprised this time, one of my package from Holland and one of my package from Australia came back after custom. I don't know, it was properly packaged and stamped with the full documents. Like these, a lot of challenges were there. I shared my patients because it was easy to let them treated here with full herbs, with full consultations, with full team of doctors, with proper stay and easy food, whatever they were spending in their countries for a month, that was enough for them to visit India along with treatment and their bread and butter. So I shared all these things with you because this was not easy process for our team, for our Ayurveda people to get globally recognized. But this is the dream of everybody, that our traditional system of medicine, our this holy, what we will say, charitable, jaise sir ne bola ke punya dene wala, what is the our pathy should be spread all over the world with the full full heart. As at last but not the least, I would like to share one line that Ayurveda can be promoted from the basic level by spreading and exploring its basic principles from our original Indian old traditional texts like Charak Samhita, Shushra Samhita, Vagbhat Samhita, and other treatises, as it is also now globally authentic spread of Ayurveda, that these books have been written in Arabic language, Persian language, and in some Dutch languages are there. Dr. Ish also written some books in Dutch language for Ayurveda, for Ajra Institute and other places. And I have, when I visited in Nepal, I seen that Charak Samhita in Nepalese language there. And so we can, in collaboration, do it all. This process could be very slow, but it will be long lasting. Thanks a lot, sir.
I think that's brilliant. Ish, do you want to kind of add a value to it?
Yes, sir. Thank you very much, Pradeep. This was really enlightening. Your experience, like where did you start from and how did you proceed with your dedication, and you reached out to the globe literally. You went to so many countries and you saw the patients, you fetched them back to India, delivered good results through a combination of Western awareness and Ayurveda treatments. And I remember you presenting your students with your patients, like as you bring your
Yeah.
patients to the students to motivate them. Can you tell something about it?
Yeah. So when the patients were visiting us, we were taking that patients to our institute. Like earlier, I was in some institute in Moga, and right now I'm working as a professor from 4 years in Guru Nanak Ayurvedic College. We take our patients 1 or 2 days to our institute to motivate our students, our scholars. They talk about their disease. They talk about whatever can be possible for Ayurveda in their country, and it is a very good deal that students get motivated, and they routinely ask about my guru Dr. Ish and about me, that how sir we can go there, that like I talked that merely some people want to go just to earn their bread and butter, some other things, but we can do these things at very, very good level. Like if I told my students that I will not be available maybe in the next month, they again asked me that why sir you are talking like this. I told them that after these inspections and all these exams going on, I will be again visiting to Australia, because a lot of patients are waiting there to get consulted honorably, because I am not ready to do openly work there on the visitor visa. And see, a lot of patients are waiting even from the Mauritius, again from the Dutch places, and even Australia, New Zealand, eagerly to come to India whenever they will be getting their visas. So even students visit my place to give the treatments to these people, and they get in touch with them. They see our videos. Even maybe today they are watching our this live video on YouTube. I shared these links with my students, mainly with the final year students, because again I will say that mostly people are ready to do work abroad, because a lot of places are empty, a lot of places are there, spaces are there to work Ayurveda. The whole field is open. As according to my vision, if the teamwork of good doctors like Dr. Ish told that they are going to integrate some all the pathies for making some common protocol of the particular disease. Like today's, even there is one lecture of some doctor there after me maybe, for integrative approach of all the pathies for some common disease. And there can be some seminar also maybe in the next year, and we will like to be the part of that, representing India and some other colleagues and maybe some students. Like I would like to share one more suggestion. Like our healingearth.com is doing these things. These can be done in the college level, or they can make some conference in different countries like UK or maybe Mauritius, or maybe they can arrange some conference for students in India, which can be online, not offline, or maybe offline besides online, because that will be giving more and more power and more pace for our system to get established. And it will be go to government level, their government ears, that of the abroad countries, as everybody knows that these pathies are not harming, without side effects, and giving very good results. Then we can take it granted that our Ayurveda will be get globally promoted authentically and traditionally very well. Thank you, sir.
Thank you very much, Dr. Pradeep. Dr. Rajiv ji.
I think it's really getting into a very nice, cozy environment where we are actually having a very vibrant discussion on different aspects, and these are finer nuances. They are not like very well known to public, and we are going from like small niches to global and the international representation. And Pradeep has actually shared the experience, and Ish, you are in somewhere stalwart, rearing and nurturing so many of the students who are singing your praises. So it's really, really good to hear that. It's so good. I'm thinking is that I've got Neha's hand up, so let's hear that comment and then we'll move to our next speaker.
Thank you. I won't take long, because I think my main question is with Dr. Rajiv. But thank you very much, Dr. Gupta, Dr. Kumar, sharing such a wonderful presentation about the global scenario. One thing I learned over my recent years, that one thing about the recognition that we are lacking, every time in US and in England, in UK as a whole, we are questioned about evidences. Now, in this scenario, it's not that we don't have evidences. Like what you just shared is the clinical evidence right here with your clinical practice. So the gap behind with this question and actual practice is that we are lacking a network called PBRN. Now, this is a recognized network of the primary care system around the world. It's a medical card. And recently, a couple of years back, US also set it up for the dentistry. So we believe that there should be a network where we can fetch on the practice-based, actual real-world data into the research rather than setting a clinical trial, because Ayurveda will never be successful on those trial model where we have limitation of the practice and protocol. It's individualization. So I'm very glad that it's just very recent, last month, the first PBRN of Ayurveda was set up in England, and we are fetching up all the practice-based data. So I think that should change the scenario. But my question with Dr. Rajiv, and not just Dr. Rajiv, but of course from the clinical side in NHS. Now, do you think, Dr. Rajiv, that what wonderful work all the physicians do, and if we gather practice-based research data, which is very kind of acceptable way of doing it. It's not something we are doing observations, but it is actual research methodology. So then do you see a possibility that we can integrate at least into the primary care or in the community care?
I think it's extremely good question, slightly difficult because it is still has got a long journey to do. But my personal view is that in the first instance, we have got a foundation which is based on research. So I don't see any reason for it not to be applicable. I know there will be patches of application. It will not be universally applicable. We have got people who are part converted. They are part of our Healing Our Earth and the International Organization of the Integrated Healthcare. So people, when they believe in integrated healthcare, they need to believe in this. And if we are providing scientific data, I'm reasonably sure there will be people who would be up for it. And in primary care, I know some of our GPs are part of our Healing Our Earth, and they will be delighted. And we should have a discussion after the session in order to design a strategy so that we can have stepwise implementation. It probably a few pilot sites and then multiple sites. And I don't see, because it's going to save money. Currently NHS is deprived of money, so it will save money. It's scientific, it's evidence based, and it has got some endorsement. And more we apply, we can collect more clinical data, and then we can really go to CCG. And in some way I am dreaming of that day where we will compel CCG to implement it in benefit of the public and the healthcare. So I am pretty sure, Neha, you
just a very quick note at the end, just to again add on. There is a network called Social Prescribing, and I think all the GPs do a wonderful support for this network. Do you think, and I'm not talking about, of course, we understand the concerns of NHS in terms when it comes to supplements, to the herbal, they are quite risky for us to recommend to the patient because safety and ethics come into as a barrier. But if it is about the diet and lifestyle, again, with the concept of Ayurveda as a whole, rather than what we do right now, then in the social prescribing, could that be still possible? Because even if that part does happen in the primary care, I think that will open the doorway for the further research, even in the trial setting. Now, this is a wonderful platform to brainstorm because we are researchers, we are physicians, we are practitioners all together here. Then on my bit, I can get the ethics approval. But on your bit, if you think that, okay, social prescribing is feasible, and we have all the practitioners to design the feasible model for UK and system like where we have limitations, then it could be a very good collaborative work to actually integrate Ayurveda into the main practice, mainstream. Now, again, it's a question of how we do it, but I'm sure you all in your able guidance will be able to do it.
Just to answer that question, Neha, we would definitely do it. And if you stay till end, we have got a very good speaker from Italy who is going to talk. He's a primary Ayurveda practitioner, but he has done work on integrating into the modern medicine. So I think that will be good, and we will be able to do it. Let us hear from Milind. He wants to say something.
Yeah, hello everyone. Lovely to meet you all. It's the first time I've come onto this platform. Just a very brief background that I'm a GP, but I'm known as a holistic GP with a passionate interest in Ayurvedic medicine, which I've studied since I started studying modern medicine, and I was trained as a surgeon. But my wife, Dr. Asmita, was the first qualified Ayurvedic doctor. And when we came to this country, I helped her because of my passion to, and so we set up the first Ayurveda and Panchakarma clinic in Brighton in UK here. And we promoted Ayurveda. So perhaps we were the pioneers in the beginnings of those. And throughout the last 2-3 decades, we have done a lot of work, which I won't go into now, but would love to share with you. I was the co-founder of the BAF, the British Association of Accredited Ayurvedic Doctors in this country, and we have mentored a lot of the younger Ayurvedic doctors who have now sort of flourished in this country. So very proud of that. Just wanted to share some aspects of our experience here, because then I worked on an integrated Ayurvedic medicine model for the last 25 years, 30 years really, actually. So first to sort of start with your point, Dr. Neha Sharma, and that I did in 1998, I presented or worked with the CCGs and the PCTs at that time, and we created a model with the local director of the health. So I have some experience on these and the challenges that we face. And of course, over the years, there's still challenges, but there is a big opportunity now because there is a shift, as you know, in the paradigm of the healthcare. The government wants to reduce the budget of the prescribing plus the burden on the NHS. So they are trying to find ways of encouraging these are the various disciplines, if you like, which can be used in the outreach centers like the community centers. So we've got a big opportunity. That we need to create that model, starting with some of the pilot works, and we will talk about that later on, and we'll all get together in there. Dr. Madanji and I have been talking for a while now, and so it would be lovely to sort of discuss with Dr. Ish Sahib and Rajiv Sahib and Dr. Pradeep Kumar, who is absolutely given these. So we need that clinical evidence collated into a format which can be accepted and which appeals to the NHS authorities and the CCGs and the policy makers. And I may be able to help there with whatever, I have experienced over the years. And then just a little bit on the anxiety bit, which was absolutely a brilliant presentation by Dr. Mridhi. I can tell you that Asmita and we have been treating several anxiety and mental disorder patients with Panchakarma. I just sent a message on the chat to Dr. Rajiv and the others. And exactly that with the Shirodhara, the Nasya, and also that combination of the Ashwagandha Brahmi Shatavari, which we made with Tulsi, particularly because I went through an anxiety period and I created that with that and found it. So a lot of our patients, so just to say that these 6 herbs have worked for us. And so I can endorse that. So, and I'm now feel more confident that Dr. Mridhu has endorsed this for me. That yes, this is the right.
Thank you very much, sir.
Thing. Yes.
Very proud for me.
Yeah, and then it just gives me that that sort of thing. Of course, I know of the herbs and things, but when somebody like yourself, says that on that platform, then we feel more confident. So thank you for that. And of course, the yoga and Ayurveda, we've done lots of talks and lectures and things, and we speak the yoga people. So one message I want to give you from my experience is that for me, Ayurveda is about empowering the patient to take control of their health. This is the message I worked on for 30 years and with the CCGs. So if we help them, how we can modify the Ayurvedic model which we have in India, to a modified model which the British people, the Western people can accept. That is what Asmita and I have done over the years. And that, even Charaka has said that you have to change and modify according to the Desh and Kal and whatever you and the people. So that's the principle. And that's what we have, and we'd love to share that with you. And so, you can actually, and I have, demonstrated to my patients, taught them how to do the head massage, self-massage, and actually I identified and made a chart of all the marma points which can be useful clinically. Way back in 94, I published that. So it was way ahead of people, and we were working on saying we can teach patients and clients and individuals to do that safely. Do we not do a good head massage at home? It doesn't need any particular technique. You can take nice warm oil, sesame oil with lavender or something like that. Just add some good essential oils in it. That is Ayurveda. It's not anything different. And then, we can use all sorts of things like Sahacharadi, and I use Bala Ashwagandha tel, Karpur with Karpur Yukta Bala Ashwagandha tel, and it works excellent. You know, a very standard, you know, strength building and de-stressing. So there are some very good common Ayurvedic formulations which we have worked with over the years, selecting those so that they can be safe and effective. So yes, you can teach them safely. There's no problem with that. And I can assure you that we have an experience on that. And of course, with the pranayama and the yoga, what I have found is that I simplified the relaxation, the breathing, you know, with the anuloma, viloma, and with the sort of purak, rechak, etc. But keeping it simple and nice abdominal relaxation, breathing with shoulder, and that works. And that can work very well with the Brahmari. That works very well to reduce anxiety. So I'm just trying to throw in these little things of my experience, which, and I've heard this from you lot. So it has given me also confidence that yes, I'm doing the right thing. Okay. But there's been a great sort of response to this. So I'd love to interact with you guys more, and hope we can take this Ayurveda. I've worked very hard to promote Ayurveda in this country for 30 years. Dr. Madanji will tell you. And it's a passion. So I'm part of the BAAP and the BAMC Executive Committee, and my work continues on that. So now that you guys are there to support us, I can talk more about it. I could talk to you for 3-4 days on all this. I have such passion on it, but love to help and support you guys. Thank you so much indeed for all these beautiful enlightening talks. And with the craniosacral therapy as well, I did some osteopathy and things like that. Just the difference is osteopathy is more joint and muscle manipulation, but also manipulation for soft tissues in the abdomen, etc. It works very well. I have some experience of treating patients with this. While the craniosacral therapy, which we have heard just from Jayanji, thank you very much for that. And that is more for the finer touch, the softer touch. We have tried that as well. And it is like any touch, you know, like you said that when the mother touches your head nicely and say, look, son, don't worry, everything will be fine. That is what it is. It is reassurance factor I found in craniosacral therapy. And the healing, but why do we need healing? We are healing our emotional factors. That's the key. Healing is about stabilizing the emotions. And that comes through this, like, and it reminds me of a very nice slok in Charak on the Sutrasthana, where it says that Atmendriya Manoarthanam Sannikarshat Pravartakaha. When these four come together, only then Sukha Dukha Mana Arambhat Atma Se Manasi Sthire. So that is what these things do, like sacral, craniosacral therapy. They try and still the mind into your soul. And this is my understanding. And that's what meditation and pranam is about. And this says nivartate tadubhyam vashitvam cha upajayate. So that's what's happening with this. And then craniosacral therapy is part of it, but the self-help is the pranayama and the meditation, as you said. So I just wanted to summarize all these beautiful messages I've got from them and try and sort of bring it into my own experience with that. So do carry on. Thank you so much indeed. And I'd love to join you again. I hope that was useful.
Very useful, Dr. Milind.
Thank you.
Thank you very much.
It was wonderful. Milind, actually, we have another Milind in our Healing Our Earth, who is a GP, but a holistic GP, is very much into it. And I'm so glad we found another Milind. And from your talks, it looks like you are a part of us, and you have committed to us, because we have been doing a lot of work over past several months, almost in fact a year and a half now, on building these groups. And we are in a stage where we are having, and actually I and Ish were talking yesterday or day before yesterday, that we are ready to have a smaller group, Ayurveda, integrating Ayurveda with conventional medicine and with other things. and what is the evidence, how we can make it effective, and taking it to the next step and next step and next step till we get to a stage where it is integrated. It's a big task, but a doable task. I firmly believe in it. I'm putting a lot of my time, effort, and energy into it, and I'm glad that I've found people who are like-minded. So I think after the session, within next week or so, we should try and form that group, a small group of around 8 or 10 people who are focused on getting it done. As you know, as I know, that eventually if we have enough evidence and we have got money saving technique, there is no reason they should not accept us. And then you have been doing it and using it in your clinical practice for such a period of time, and Neha has done that, and she has given a previous talk on that, how mental health disorders which are rampant within the health system are consuming so much of energy and time of the mental health workers that can be prevented coming into the health system. They can be treated in community. Why are we not doing it? So let us all meet together. We might actually have a separate Zoom session on it so as to have a further progress on it. So I'm delighted that we have people like you. So let's meet afterwards and get some more ideas into it. So I think from my point of view, it looks like it's coming to what I call it like a peak of everything melting together, and we are having such a hot, nice discussion. It will be really brilliant to see that. So, Bradu, I think there is, to me, mental health is very easy go area. There are so many people with anxiety, depression, and then we've got a degree of psychosis. Let's leave psychosis alone to deal that. But anxiety and depression is so common.
Yes, sir.
What do you think we can go without any cost-effective assessment to start with, and then we can have some cost-effective interventions? And I'm opening it to Neha and Milind, myself, Ish, and Jen, and whosoever else is in the panel, how we can crack it earlier, and we take some niche project, not the whole thing, just two things, anxiety and depression. How do you think we should
the very first thing is to realize that there is some change. Most of the people ignore by that they are having some work pressure or some midlife crisis, so they ignore that condition. They don't realize it early that there is some change in their behavior. Maybe they are a little bit more stressed than usual. They generally take it like, oh, I'm having a lot of work stress or tension. Maybe because of that, I'm behaving like that. A lot of negative thoughts are coming. So people usually ignore it in the initial state. So that is the very first treatment we should do. We should realize that there's a certain change in our behavior, and only the person who's experiencing it can say that yes, I'm feeling some change, and I don't know what has happened. My all life is good, but I'm having such kind of thoughts or such kind of emotions. What should I do about it? The second thing is to have a proper daily routine or have a proper routine of your life. Like I have seen many patients with depression who just sleep almost 16 hours a day and are all awake at night. So that should not be the thing. Most of these things, the bad thing about psychological disorder is it is in your thoughts. Nobody can see it. Nobody can feel that what you are thinking. It's just what you show, it is shown. So first of all, you have to take a step for self-healing that yes, I'm not feeling good, but I have to change it. So the first thing you have to do is get up and make a routine, follow the proper healthy routine. Get up early, make your bed, take shower daily. These are the basic steps. Basically, everyone does this, but the person with depression or anxiety, they generally miss it. If they have to reach office at 10, I have seen many patients to get up at 9:50 and then run and do nothing, not having their breakfast or anything. So the first thing which we can do is follow a daily routine, and it will be very good if you follow it according to Ayurveda or according to the seasonal or daily routine is advised. And I personally recommend that use of Nasse and Abhyang, because Shirodhara is not a procedure which you can do yourself, but Nasse and Abhyang, these are the massage, these are the procedures which anyone can do. Maybe you will not massage your body properly, maybe you not massage yourself the way the other person can do, but still you are getting the oil, you are getting the like oleation, and bath is pacifying. So basically you are healing, and you can see the change in 21 days. I have realized that in many of the cases. Sometimes I don't give them any medicine. I tell them to just massage their body before bathing, and I've seen change in their behavior. Because I might.
Mridu, you are doing fantastic. We're getting a lot of compliments on the way you presented yourself. So keep up the good work. The confidence Professor Ish had in you has come to fruition. So Ish from Mauritius, thank you very much. Rajiv, Maurice, what we're going to do now for the next 6 minutes, I would like to go around the panel. We want to remind people that the viewers are actually on the YouTube, Facebook, Twitch, Periscope, website, and social media, and Twitter, and places like that. So these are just invited guests. We'll go around the panel here, and in about 90 seconds, could you tell us, because the audience is anywhere in the globe, so don't think as an Indian, don't think as a British, don't think as an African, could each one of you tell me your 5 favorite Ayurveda products that can be readily available at home that one should be consuming? And then after that, is Ayurveda or can Ayurveda be harmful in any form? So we start first with Jayant. Jayant, you can unmute yourself. Your 5 favorite Ayurveda that can be readily available in any country on the earth.
Okay, so I'll go first with the Anutel, like Dr. Mridu mentioned about Nasya. So Anutel is one. Second is sesame oil, again a very good for Abhyanga. Then third would be favorite ghee, cow ghee. Fourth would be ashwagandha, and fifth would be
some touch from a CST, Jayant, like you can tell us touch like this if you want.
CST touch is more experiential because you have to give a full-fledged session, so it's not a self-touch technique. I cannot give CST to myself but to others.
Okay.
Okay.
Yeah, 4 is fine. It's okay. Yeah. 5 is a symbolic number.
Okay.
Yes.
Jayant, thank you very much. When you are talking, think as an international person, because the audience comes from any of the 180 countries that we are tapped into. Ashwagandha is not available in every country. It's a good choice because it's one of the top Ayurveda one. Think for the general public who is tapped into us, who is a consumer, who are not Ayurveda expert. We move over to you, Mridu. Your 5 favorite common Ayurveda products are readily available in the kitchen.
I think turmeric will top all of it. Dry ginger, ghee, clarified butter, milk. Milk is very good, almost good for each and every doshas. And another one is oil for massage, because I highly recommend Abhyanga.
And could you tell us, can Ayurveda be harmful in any way?
Yes. Every has good and bad effects. Like what I'm trying to say is, if some person is healthy or fat or obese, and I'm mentioning 5 things, and I have mentioned ghee in it, milk in it, and he's taking it without the consultation of the expert, he may get harm. He may get like some disease or cough prakupit in his body, and that can be harmful for him. Because in Ayurveda, every Purusham Vikshe, every person is different. So if something is good for me, it's not necessary that it is good for you. You have to analyze your doshas, your prakriti, and then decide what is good for you.
So we conclude that we must take guidance from the experts. Okay, thank you.
Yes. If, for using it regularly on a daily basis, then definitely you should have a expert advice.
Thank you, Mridu. We move on to Milind. Milind, you are a British person over here. You've got vast experience. As of now, you will be part of the family.
Thank you.
All you people, you've got relevant phone numbers of the people you need to connect to on your WhatsApp. If you look at your WhatsApp,
Yes,
you are now connected to the right relevant people from what you were talking. In case if you are missed out, just tap into me because you're all connected to me over here. Milind, the beautiful part is that you are also a doctor, you know allopathy quite well, and you practice Ayurveda. You come from the land of Ayurveda by origin because you are Indian, your surname suggests. Milind, your 5 favorite Ayurveda products, like turmeric is in every house, most house. What are your 5 favorite? And as an allopathy doctor, what would you caution people for Ayurveda?
Right. So the straight answer for 5 favorite products is, if you start, I agree that tulsi and ginger in the kitchen, because they are very good anti-anxiety products, they are digestive products, they can do amapacha and everything. And so I like those 2. Then the herbs, the 2 herbs, I think everybody should have ashwagandha and brahmi, 100%, because they are just rejuvenators. And I would add ashwagandha, brahmi, shatavari as one part of that. And I think everybody should use Mahanarayan tail. These are available in the UK. We have been supplying this for 20, 25 years. There are other people who are now coming on. They are also available in Europe widely. I can assure you that a lot of the Ayurvedic herbs, we are still working with the authorities to try and gain all that. It goes on, but still the supply of Ayurvedic is still available and we can work with it, and we are working with it. So those are my 5 very favorite ones, because I know I do regular abhyang with Mahanarayan oil. So those are the 5 favorite ones, really. For the Anu tail, the second answer on whether Ayurveda can cause problems, yes, it can. You have to be careful with Anu oil, because if people don't use it properly, they can get irritation of the nasal mucosa and they can also get dizziness and further. So you have to be careful. If you see the ingredients, and even in Charak, he has mentioned that for the Anupan and how you need to take care. So I'm sure you experts will. I'm just talking from. So yes, those are my 5 favorite ones, because other people have mentioned the turmeric and all that. But I would strongly recommend that everybody should have tulsi, ginger, and you know, with these they can aggravate the pitta. So you need to have some pitta balancing herbs like mint, cardamom, and danajiru.
Brilliant, Milind. Thank you very much. You've been very succinct about it. Do keep in touch with our producers, Rajiv Gupta and Ish Sharma, which are very important. So we'll come back to you in a moment. Let's go to Neha, who is not an Ayurveda expert, but by virtue of the fact that she comes from integrated health and she practices other methods. Neha, as a house person, what are your favorite 5 most common Ayurveda products?
Yes, thank you, Neilji. As you said, I'm not Ayurveda person, and I am more concerned about the safety to the side effects, if not in the right combination with not right property. So what my favorite, and as what I have seen the best, I think, sorry, my background, what I know the best, and I would suggest and recommend supervised, but of course, dietary modification, very simple, very effective, and it can be used by all, simply changes in the diet, whatever availability. Sorry, is that mine? Then we have lifestyle modification, as suggested, was suggesting. So diet, lifestyle, yoga, general yoga with pranayam, simple exercises that could be recommended. There's a beautiful work, like we have CBT, mindfulness, but in Ayurveda also, I recently been learning Sattvajaya counseling method, how we integrate this counseling, and then you can watch your own thoughts. So self-care techniques of Ayurveda. I know they're not traditionally the product type, but they are still part of Ayurveda. I think everybody should learn the basic self-care from the Ayurveda, from diet, lifestyle, and the counseling methods.
Thank you, Neha. Stay around, and what we do at 6:30, once again, we are going to have a common round where everybody can join in. So it's beautiful. Now we'll go to our 2 experts. Little do people know that Professor Ish Sharma is from the Ayush Ministry and has been assigned into Mauritius. He is actually an expert in Ayurveda. He is a professor. That's why he's a producer. So, Professor, what are your common that you feel that readily people, so they can't make an excuse that, hey, look, I don't have this product in my kitchen. You can include any fruits and vegetables that you feel are very good for Ayurveda. You can extrapolate for more than 5 if they are common. And your final thought on today's session so far.
Yeah. First of all, because we discussed a lot as triggered by Dr. Midhu Sharma, anxiety neurosis. So my one word suggestion would be, if we have to prevent anxiety neurosis, if we have to prevent stress, then we have to educate each one and everyone about unrealistic expectations. That is the biggest triggerer. When your expectations are not realistic, when you want some a hike in your salary or promotion in your job or certain behavior from your relations, when your expectations are not real, that is the only triggerer to stress. That is where you have to re-establish your expectations, your priorities, and you should know that the world might not be behaving as you expect. So this is one thing which can be really preventive and wonderfully told in Ayurveda, that the mental fraternities, mental qualities, sattva, rajatama, these are changeable. So with proper education, training, experience, you surely can change your mindset. So maybe someone, if we all, because we all are healers, if we all start telling the world about being realistic in expectations, someone can listen to us sometime, and really one's life can change. Now coming back to your last question, Neil, what are my takeaways from Ayurveda, 5 top takeaways which apply to the world. The most important will be, wonderful products are told by all, ashwagandha, brahmi, shatavari, ginger, and kurkuma. All are they are beyond doubt, those are helpful, and those are, most of them are available everywhere, including Mahanarayana Tel and sesame oil told by Jayant. My take would be, overeating is killing more people than starvation is doing. We all are dying of overeating. We all are overnourished. We do not know what is real hunger, and we keep on eating by clock. It's 8 a.m., it's breakfast time. We are hungry or not, we eat breakfast. 1 o'clock in the afternoon, it's your lunchtime, you eat. You are hungry or not, you will eat, because the wall clock says it's 1 o'clock. We are ignoring the body clock and we are driven by wall clock. So I believe we have to go for periodic fasting, which all can apply. Leave some food for those who are hungry. Wait for real hunger, and this strongly applies to all. Why do we eat? Yeah, please.
Professor Ish, I would like to add this. Before you feel tired, drink a glass of water. Before you feel hungry, drink a glass of water. Before you feel thirsty, drink a glass of water. Before you get up, drink a glass of water. When you go to sleep, at least half an hour before, drink a glass of water. Water is a very good therapy. Thank you, Professor Ish. We'll now move to our resident doctor, Dr. Rajiv. Before we move to you, let's remind the viewers we are going to go to a very good expert in Latvia, introduced by Professor Ish Sharma, who is going to help us today because we are all struggling with our eyes, watching a lot of smartphone, a lot of Zoom sessions, lots and lots of phone, smartphone, etc. So if you could stop your share, Santanalaji, please. We'll go it after you are introduced, please. If you could stop share your screens. Santanalaji, if you could just stop.
Yes.
Okay, I will break it now. Don't worry about it.
Okay.
So Dr. Rajiv, don't worry, we can extend our chat with Shantanala, because that's the today's most important section today is going to come about our eyes. Our eyes are very much struggling with so much watching smartphones and tablets and phones and Zoom sessions and working from home. But Dr. Rajiv, what are your 5 favorites? And what tips could you give us? And then we move on to our Latvia guest.
So I think again it is such an exciting session which brings my memory back when I was like spending a lot of time reading about Ayurveda in concurrence with my medical studies. So medical college in a heavy time consumption, but then this was going on. The things which impressed me was the cardamom powder, which is a natural thing, and there is good evidence. It's also called the Elateria cardamom, and that act is queen of spices, and we can use it. But the powder shape increases the uptake of oxygen into lungs and reduces pneumonia and all recurrent infections, and that is excellent. It is also known to reduce the blood pressure, and recently has been found to reduce the Helicobacter pylori, which is a cause of major stomachache and pain and gastritis, which is not treated with the thing. So I think, in my view, that is one of the brilliant thing. Second thing is licorice, and we have used licorice for a long time for our throat infection, but now there is an increasing evidence for reducing inflammation and increasing the immunity and fighting against the bacteria and viruses. My third one is cumin seeds, and I eat too much. My wife keeps saying, "Why are you eating?" But I like it, and it's very good for digestive system. It reduces irritable bowel syndrome. It controls blood sugar far better than any other medicine in diabetes, and overall is a simple thing that can be used regularly. Further to it is Triphala, which I think I'm pretty sure Shantala would emphasize. When I was young kid, 5-10 years old, I was told with Triphala you can wash your eyes and that helps the eye health. But also it has got systemic effect and is very good for increasing the longevity. And last is Ginkgo biloba, which is a natural herb, and that is actually similar to Brahmi. Increases your memory, it decreases your nerve construction problems and neuropathy. So I think these are, in my view, top 5. That's the question to it. And my even more emphasis is on breathing. I'm a big fan of breathing. A proper breathing and proper pranayam is amazing. Anulom Vilom, Kapalbhati, and Brahmari. I teach all the patients who come to me in the clinic, and I teach them Kapalbhati to reduce the weight. I do a special clinic called obesity clinic or weight management clinic into the NHS, and I teach them that take a deep breath and breathe out. And basically, because it is massaging your tummy, the fat which is deposited into tummy, particularly the belly fat, reduces tremendously if you use it regularly. So I think we should welcome now Shantala. It's just amazing. So
yes, Dr. Rajiv. Let's go to the highlight we were waiting for. Everybody's struggling, which is our eyes. I'm now getting lots of response on the WhatsApp groups that is set up. So they are voting which are the best 5 products. So at 6:30, maybe we'll try to declare to the people which they think are the 5 best products. Go ahead and please introduce our next wonderful guest who is going to help us how to soothe our eyes.
yeah, so I mean, it is such an amazing opportunity to have our Shantala Priyadarshini, who is from Ministry of Ayush, and she is in Latvia, and she is with us, and we have communicated to each other over past couple of hours on how well we can introduce this session to introduce the eye health. She has particularly interest in eye and ears, and she's a postgraduate from Rajiv Gandhi University of Health Sciences, and currently is in Latvia with the Ministry of Ayush. I think she has done amazing work. She's a clinician, but she's also a writer. She writes articles for public and scientific community, and we would love to have her articles for our Journal of Integrated Health called The Practitioner, and therefore I think it will be good to have her views. She has visited the world, India, Australia, India, and many other countries, and currently she is teaching on various aspects of how to become master through Ayurveda and environmental science. So I believe that it's rare to have that combination of the theory and practical, and I would be very interested to hear on just eye care today, but also I'm very interested in multiple sclerosis, Alzheimer's disease, and neurodegeneration, which she has done some work on. And I would be delighted maybe in not session today, later on, because in our traditional or conventional medicine, there is no treatment for it. Although there is some proposed treatment, but I know it's expensive and it doesn't work very well. So if we can find a proper treatment for multiple sclerosis, that would be amazing. So with that introduction, I would really love to have views from Shantala Priyadarshini. Let's welcome her. Fantastic. Floor is yours.
Thanks for such a beautiful introduction. You are able to hear me?
Yes, we can hear you.
Yes, yes.
So why is it said that Sarvendriyanam Nayanam Pradhanam? It means that among all the sense organs, the eye is the best. It is the most superior. And everyone can imagine that, because you can just for few seconds, if you think you are not able to see, then you understand how important vision is and how very important it is, a responsibility of all of us to safeguard our vision. So at the outset, I have been very happy to be here. It is the global platform of Healing Earth. So thanks for bringing me here, and thanks for the opportunity. So at the left side, we have the Indian flag, and the other side, we have the Latvian flag. So it is a privilege to be here, sent by Government of India, and the responsibility is huge. So today I would be speaking about only the preventive aspect, not much of the cure. So prevention is one of the basic human rights, that is the right to see. We all have to ensure that no citizen goes blind. If blind, it should stop to be deteriorating. And Ayurveda was the first to launch blindness prevention. Nidana Parivarjanameva Chikitsa. Nidana is pathological etiology that we are going to look at few things today. So prevention starts even before conception. So how a mother, the expectant lady, should behave. So today we hear fetal alcohol syndrome, smoking, drugs, the adverse effects and all that, which has been very well proclaimed by Ayurveda. So time tested things there, that is what we are going to speak about today. So one needs to be very healthy, very happy, to have very good eyes for a lifetime. And vision is to be always protected. So nutrition for the eye during the first trimester, as all of you know, we have we hear about the thalidomide tragedy, but instead in Ayurveda we have something which makes life not only easy, but it helps in morning sickness. It is a rasayana also, what we call as the Madi Phala rasayana. So all beautiful things and very tasty medicine is provided. So it gives nutrition for the eye, for the baby, for the expectant lady. So next I go to what Charaka has been saying, Atulya Gotriya. It means consanguine marriages definitely need to be avoided, or else vision problems could be from the mother to the daughter, and so on. So to prevent a lot of high myopia and associated complications, one need to have a lot of things that needs to be done. So when we were students, we studied about iatrogenic conditions, but today we have reached a situation where we have where we speak about hydroepidemic. It has become into epidemic situations, epidemic levels. So when one drug is given, we really need to see what happens to that. Is it safe? Is it good to take it, or what happens? So anti-malarials could result in retinopathy. Anti-tubercular drugs could create optic neuropathy, and topical steroids. Usually people are very fond of taking steroids with or without prescriptions, and this could cause a lot of issues. Then today we have the epidemic, a pandemic, which we are all very much aware of. But Acharya Sushruta and Charaka have been speaking about this many thousands of years ago. So how it can be prevented, and a lot of vision problems and ear problems, all the sense organs are also getting involved in COVID. So we need to know about it too. I will be speaking a little bit more about only the etiology today, and few slides I will be speaking about, because I thought there'll not be many doctors, but I see a lot of enthusiastic people here. So I will deal more with a little bit more about the therapeutic aspects also. So visual problems, allergic conjunctivitis is such a common problem, which Ayurveda can do wonders with. We could make life very easy for people like this. So these are all the, it's an occupational causes also are there. So dinacharya, rutucharya and all that everybody knows. But I would be speaking a little bit more, which everybody can do it. They need not be doctors, they need not be, just public also could do this. So what you eat is very important. Food is medicine, or rather if you eat proper food, you don't need any medicine. So kulata is horse gram, anything in excess. All the rasas should be eaten. It should not be like what I have been showing on this side. Excessive eating is asatmya bhojana, viruddhahara, adhyashana, excessive eating, or no nutrition or excessive nutrition. But what we advise is Shadra Sopeta Bhojana. Today, there is a trend that kids are not given sweets. And adults also fear that eating sweets can cause a lot of health problems. It is not like that. Eating sweets can also have a lot of benefits. It's not like putting everything into capsules and eating them. So you need to be very sure what you eat, how you eat, and why you eat, with whom you eat. So here is one big nidana that has become a global issue today. So here nidana parivarjana meva chikitsa. How you eat, how much you eat. See, the picture itself can show you a lot of things. Then mind your mind. So as Mrudu Sharma, Dr. Mrudu Sharma has been speaking about anxiety, here is something which starts even in very young minds. So there is a lot of rat race going on, and myopia could be the result. Anxiety neurosis can be in different forms. So mind your mind is what I usually tell. And this is something which everybody overlooks. Either a very high pillow or a very low pillow, or no pillow. So here are there are more than 100 ecological factors that Ayurveda has put, and you can't get anything apart from what is said in Ayurveda. So what we do is we create a lot of awareness in colleges, and being a teacher for so many years, I have lots of students who are already been professors in my subject. So I'm very happy about that. See, we want to check vision. So Ayurveda has given some very simple ways of checking vision. Plus 40 people usually have problems with putting thread into the needles. So we test it like this, and people have fun, and they are also getting awareness that they need to set right their vision. So I come to a few slides which I'll be telling about why palming is very important. Palming is, I suppose everybody knows it, is how we use our palms to cover our eyes. So we have this, the whole palm is shown, and each point is going to represent the whole body. So why do Indians eat with hands? Hands, when we speak about all this to the Westerners, you tell them, give them scientific reasoning, and next time you will see all of them eating with their hands. So it is very important for us to tell them that each fingertip has got a lot of neurons which are going to not only give you a lot of satisfaction in eating, it will help you in many, many ways. So when we speak about vision to the computer people or people anywhere who will be using these gadgets, so 20-20-20 rule is something which is very, very important. 20 minutes, once in 20 minutes, you need to look away for 20 seconds at a 20 feet distance. So that is 20-20-20. So Ayurveda speaks about Ati Yoga, Hina Yoga, Mithya Yoga. Excessive use of the eye, there's a limit for the eye. But if you use it too much, it could cause problems. Then you have Padabhyanga, which I had been listening to before. So Padabhyanga has multiple benefits. People feel they will not be able to sleep, they have anxiety, and just simple Padabhyanga can do wonders. Not just for vision. You don't need to put medicine always into the eyes, always into the nose. Just Padabhyanga could do wonders. So you have a lot of medicines which you could use, or you could use any oil except kerosene oil to use it for feet massage. Whatever oil you get, that you could be using. Then we teach all our students to do leech application, which has been in India as a part of Ayurveda since many, many centuries. But French company gets the benefit of supplying leech all over the world. It has got the patent for that. So we have a lot of things to work on. Then best drink for vision, I will be sharing something which you all know. One is licorice. Licorice is very, very important. We speak about licorice, yashtimadu, and it is, you could make tea out of that, you could make decoction out of that, you could make in any form you could take it in milk, chirapaka it is called. It has got multiple benefits. You have got so many benefits, you could take it every day. Then you have just simple lassi, you have dhanakadi kwata, you have kharjuradi manta, you have the golden milk, which is very popular today also due to being popularized in US and also because of COVID. So we have something known as Trataka, which helps both in the mind and the vision. So here is one of my students who is giving a demonstration for that. Easy beverage for vision, etiological factors. So if we can prevent eye disease not manifesting by dietary factors, lifestyle errors to be rectified, so no nutritional ailments. We can have that occupational demands are met to prevent eye problems. Dietary measures as per quality, quantity ensures best vision. Dinacharya, Rutucharya, Sadvrutta, and iatrogenic issues and adopt prevention. Thanks a lot for thanks a lot for giving me this opportunity. And if you have questions, I would be very happy.
I think it was amazing. Ish, do you want to take it through?
Yeah, I would like to really thank Dr. Priyadarshini first of all, because she holds a very responsible position and to stabilize Ayurveda in the European Union is a big challenge, and she is the right person at right place at right time. And we expect Ayurveda, the government of India expects a lot from her, and we believe that joining on this platform, this will be really very worthwhile and relevant for the foundation, as well as healing our earth is like being Europe based. You are very much near to Dr. Shantala Priyadarshini, Rajiv ji, and you really could be meeting more often. She could be traveling to you, you can travel to her, and you can really pull off some miracles, because as per the the policy paper 2030, Indo UK relations, the agenda number 32 highlights about Ayurveda, and Ayurveda only. Ayurveda products, getting Ayurveda doctors into UK, Ayurveda into national health services, Ayurveda and yoga research. So the scope is huge, and we are the torch bearers. We have a huge responsibility. We cannot sit back and relax. So this is high time we all team up and pull our socks and really get into some like a top gear. So thank you very much, Dr. Shantalaji, for this very wonderful talk. Very simplistic, applicable to all, very much conceivable, very simple techniques like 20-20-20, and very common herbs you mentioned, Nidan Parivarjan. And we look forward to hear more from you in the forthcoming sessions. Rajiv ji, yeah.
Fantastic. I think you are absolutely right. I can't express the gratitude to you for bringing all that together. And as you mentioned, Indo-UK collaboration, that all has been mentioned. And through our work, we should really strengthen that process, bringing it together. And Shantala is just together here, not too far from us. Funny enough, we had somebody who worked in our home from Latvia, so we know about it. It's a fantastic place. So I think we should really connect to each other. And 3 points that you have mentioned are extremely important. The first one is getting Ayurveda into health research, which is extremely good. So we should work on it, and through our collaborative group, we should do that. Second, Ayurvedic doctors from India. And third is how we can do that normal simple things of Ayurveda into mainline treatment, working with the NHS. And Agenda 32 of the Indo-UK treaty is going to be really very powerful. So I think that should do. There are two things I would like to mention about the talk. So you have been very simple and extremely powerful, Shantalaji, that you've talked about I, and you started from that, how the life will be without vision. And funny enough, nearly a year ago, I was on a trip giving a talk to some other country, and I was staying in a hotel, and in night time light went off. And then I realized that I couldn't see anything. And I realized at that time, just for like 30 or 40 seconds, light went off. Electricity cut off was there. I couldn't see anything. And that is the life of people who are blind every single day of the life. And I found it hard to live for those 40 seconds. And there are many people on this earth living that life every single day. And it gave me a lot of reflection, a lot of thinking that we need to be more humble and genuine and cordial to the people who are less fortunate than us. And your talk has given a lot of opportunity for people to prevent those eye problems, those eye diseases, those conditions which are preventable with simple things. And if people incorporate that into daily life, they would not have those eye problems and will have happy, healthy vision, so that they can see the beauty of the world every single day. So thank you very much once again for a beautiful talk. I'm thinking that we can move on to the next talk, but if anybody else has any question, we may be answering. You are going to stay with us for a little while, so people can just ask the questions a little bit later. We'll bring a panel together a little bit later. I can't just believe time has flown. We are nearly 6 o'clock, starting 2 o'clock. That is the beauty of the healing over these type of talks. People were saying to me, oh, 2 hours will be more than enough online, but here you see 4 hours have gone. This is not enough. We are still buzzing, we are still talking, and this method of delivering the things in a together way is excellent, good. I just wanted to ask you a question. Are there any things which you would recommend for bringing into routine for children, and also the eye health of children? And I forgot to ask, we are actually doing a program, and that is called Eat Smart, Think Smart, and Be Smart. And that is the program for the school. So we have done a lot of work here, and we are kind of bringing the whole document together. For school, we will start with primary school and then go into secondary school. So are there any things which you can tell which we incorporate for children for a better eye health, because eyes are so important for children?
Maximum patients that we get in our eye departments are usually small kids. And it is so important to train them at such an age. So I have a huge program which I could share with you.
Wonderful,
Which
because I
could be
know
wonderful for
fantastic. I included Tratak and a couple of other things which are simple exercises, and that is beautiful for preventing the errors of refraction and the squint, etc. But I think you would know a lot more, so it will be great to share, and we would be loving to incorporate into the program. So beautiful, beautiful, beautiful. If there are any
could mail it to you.
Thank you so much. Any last minute comments, Ish?
Yeah, really, I think I spoke a lot, and again I can reiterate one request to Shantalaji to ensure her availability in our next sessions also, and with variety of topics. The vast experience she has got, she has been an expert with like curriculum framing, so she can be a very right person to tell us what can be a right like academic module for various groups, where what can be delivered to whom. So there she can be a real point person, and we can have a session about it next time, like how to be like the most relevant to various sections, like students or maybe corporates or housewives or elderly. So we can be targeting more specific groups regarding heightening their awareness towards preventive and curative medicine.
Brilliant.
Here I would like to add one bit of news. We have more than 500 branches of Arogya Bharati. Arogya Bharati is a branch of RSS, which is doing immense work with regard to health and hygiene of all the people, even at the urban and rural areas. And it takes care of all sections of. So that would be my pleasure to be of any help. And I'm so happy that I'm here in such a great platform. So thanks again to Neilji and Isha Sharmaji, and of course Rajiv Gupta ji, Milan Jain ji, everybody. I am very happy for being with you all. Thank you.
Santanalaji, just before you go, which are the best 5 Ayurveda products good for the eyes? Because we need them. So if you could tell us, and then we'll move to Sonika in India.
It's a very difficult question because every herb, everything that we do is going to be of benefit. So if I say garlic, it might not be good for everybody. If I say guguru, it might not be good for everybody. So saffron is very good. Most of the time we use saffron for vision, and it could be almonds, which everybody could have in their house. So almonds, saffron, cardamom, cumin, fenugreek. So I think I have given you 5, but not just 5, it could run to pages. We have so much of knowledge that our ancient people have given. So it's only just we are sharing our knowledge which we have got from our rishis. So my guru, from my guru, whatever I got, I'm going to give my students and they are going to give their students. So it's a guru parampara. Thanks a lot.
Thank you very much, all the way from London, Mauritius, UK, for Latvia joining us, and you are now part of the family as a senior member. Please keep in touch with us, and Dr. Rajiv and Professor Ish. Let's move on to smiling Sonika in India.
Hello, 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 Sonika.
Hello. Good evening. Namaste. Yeah.
Namaste. Welcome to you. Healthy and joyous living through Ayurveda. That's a beautiful topic. And I think it would be great to hear from you. For people who don't know Sonika, Sonika is an author and speaker. And she is very, very prudent in meditation, yoga, Ayurveda, and the complementary practices. She brings the contemplative practices together and is one of very prominent Ayurveda professional in India, writer, columnist, and working as a holistic healing coach. So I think she is very proponent of women and women healthcare. Her listing is actually one of those where she is mentioned as a awardee, and International Women's Day Award has been one of them in her cap. I think she's going to talk of something very, very useful, because disease and health are two other spectrum opposite to each other. Preventing the disease, as we have been emphasizing all day, is a very important part, but keeping healthy and happy is the other important part. So she's going to highlight healthy and joyful living. So welcome, Sonika. Please share your views.
Thank you, Doctor. Should I start?
Yeah, please do. Please do. You are looking nice and smiley and pink. Nothing better than that.
And
You make me
joy is living through Ayurveda. First of all, good evening to all of who are present over here. Special warm wishes to my co-speakers, the mentors, and all the people, the audience who's listening. And it has been great that how Ayurveda is healing the world and supporting each one of us. And my topic is a little very easy and go lucky kind of a topic, that healthy and joyous living through Ayurveda. So somehow we think that how we healthy living through Ayurveda and joyous living through Ayurveda, how do these factors combine together? But that is what Ayurveda suggests. The Sanskrit shloka, I'll just repeat that first. Because Ayurveda is a ancient science of life, actually 5,000 years old science. This is actually being understood and very much followed world over. And through this science, there is a Sanskrit shloka that is Samadosha, Samadhatu, Sam Agni, Malikriya, Prasanna Atma Indriya Mana, Swastha Iti Baditi. That is Samadosha. Because I'll just come to the point that health is considered as a tripod between body, mind, and soul. Some dosha, there are three doshas, Vata, Pitta, and Kapha. Now, these three doshas, these are basically the bioregulating principles or the life force energies present in each one of us, and these make the backbone of Ayurveda philosophy. So they have to be balanced in every case. I'll just come to the details about that. Some dosha, then some dhatu. There are 7 dhatus. Dhatus are the tissues, the bodily tissues we are made of. Whatever the food we eat, it is converted first into the juice. These are the 7 tissues or dhatus: rasa, rakta, mas, med, asti, majja, and shukra. Or it starts with taking the food and it is first converted into the juice. Rasa, rakta is the blood. Mas is the muscle. Med is the body fat. Asti is the bone. Majja is the bone marrow. And shukra is semen in males and avam in females. And then there is an essence of all these 7 dhatus. One after the other, these are made up of. But then there's an essence called as ojas. And that is what keeps us healthy. That is our natural immunity we can focus on. But a good diet will give you a good system that puts on to the better ojas formation in the body. Then rasa, some dosha, some dhatu, some agni. Now agni also has to be balanced. Now what is agni? Agni is the bodily fire, and there is not a single agni. There are 13 agnis. 5 agnis are of the Panch Mahabhutas. The 3 doshas, they are made up of the Panch Mahabhutas because we are all natural beings. We have to be made from the nature. That is what makes us completely natural. And the 5 Mahabhutas or the basic fundamental elements, these are Akasha, Vayu, Agni, Jal, and Prithvi. These 5 elements, they have their separate agnis. So 5 agnis are that, and there are 7 more agnis from the 7 dhatus or the body tissues. Rasa, rakta, mas, med, asti, majja, shukra. I just told you what. So 7 agnis from that, and 1 major agni, that is the gastric fire, the Jataragni. And that these 13 agnis take care of the health of an individual. They have to be balanced. I told you some dhatu, some dosha, some dhatu, some agni. Then is mal kriya. Mal is the body waste. They have to be excreted from the body. The urine, feces, and sweat. Mutra, purish, and swed. They have to be removed continuously. The cycle has to be on. Only then we can actually be healthy. But the cycle doesn't stop here. It has to be a combination. It is healthy and joyous living. So it has to be prasanna, atma, indriya, and mana. Atma is your soul. It has to be in the state of bliss, in the state of healthy, happiness. And indriyas are the sense organs. Shabda, Sparsh, Roop, Ras, and Gandh. All the 5 senses, the sense organs, they have to be balanced in the happy state, and your mind, that is mana. So exactly the definition of health is you have to take care of all the parameters as a tripod. It has to be the body, it has to be the mind, it has to be the soul. All the 3, when they work together, a person can be healthy. And that is how a person, because in Ayurveda, it's about the basic roots, the definition of health, I just told you. But then what is our, in a human philosophy, our entity is the Sanskrit shloka. Again, I have to repeat it only. That is the health is considered as first the body would be dosha dhatu mal moolam hi shariram. if we consider that if we look at a tree, we take care of watering the roots of the tree, because once the roots are watered, the tree can take care of itself. The branches will come very nicely, the fruits, the flowers, everything. But then you have to take care of the roots, and same is in the human body. You have to take care of the roots. And what are our roots? We don't know about our roots, but then it is mentioned in the Sanskrit shloka. That is dosha, dhatu, and mal. Dosha, the same three doshas I just told you. Vata, pitta, and kapha. Vata is air, pitta is fire, and kapha is flame. So when the three doshas they are balanced, they make up our roots. Doshas, dhatus, the seven dhatus or the body tissues I told you about, rasa, rakta, mas, med, asti, vaja, and shukra, and the mal. They have to be moving out of the body. These are the excretory waste. Whatever the food we eat, it is converted into these malas, the urine, feces, and sweat. They have to be moving out. So that is how a person can be healthy and content. And basically, if a person needs to be healthy, he can just follow some of the, I've just noted on some points, some basic dominoes that you need to maintain for a very easy and healthy living. But then you have to consider that if you are taking care of your diet and lifestyle, that is shaman. You know, Ayurveda is basically, it has been into preventive as well as curative. Both the factors are there. If it has, this science is actually taking care of the health of a healthy individual, that it focuses on the preventive aspects of it. And then if you have a disease, then there are so many natural elements, minerals, herbs, home remedies that can be used. And when the medicines have so much of these natural ingredients that help to relieve a person. And another thing I would say, because the Ayurvedic treatment would be either shaman or shodhan. Then shaman is, you take care of your diet, you take care of your lifestyle, and then you can have a thorough health in your system. But then sometimes you have to go in for curative therapy. That is the shodhan. The thorough detoxification has to be taken care of. And for this, we have Panchakarma. Panchakarma are the 5 techniques, the 5 different techniques that are used. Vamana, Virechan, Nasya, Anuvasan Vasti, Niruhan Vasti, all these 5, the vomiting is induced, or the purgation is given, the nasal erhines are given, decoctions which would be decoctions of medicinal enemas are given, or the oil decoctions are given. All these ways, going through these therapies, in the way they would help you for this, and then a person can be relieved from the ailment that he is having. So that is how the shodhan can be given to him. But I just knew that there's very little time. I have to, try to give as much as possible. So we are understanding that it has to be healthy and joyous living. Then how we can be healthy? We're going to take care of our basic doshas, vata, pitta, kapha. I told you that 5 mahabhutas, or the fundamental natural building blocks, they make up the 3 doshas. Vata dosha would be made from the first 2, that is the Akasha and Vayu. When they combine together, they make the Vata dosha. Fire would result from the Pitta dosha would result from the fire. And the last 2, that is the water and the earth element, they will form the Kapha dosha. And then they come up in the bodies, and they form the basic, I told you, the our backbone basically, so that we have to take care of our basics so that we can be healthy. Now, how I want to give it in a very easy ways also, that how a person can be healthy. We are all, many of us are Ayurvedic doctors, and we understand of the basics, and some of the audience would be the people who would understand, want to know it very easy and easy manner. So I normally, as a speaker, I would always tell that how is a layman would understand it better. So the 7 points I could note down, that these are actually needed so that you can be joyous as well as healthy throughout your life. One is your everyday diet, because taking whatever the morsel of food you are having in your diet, that is so needed that it has to be in the purest form. You have to uh, be increasing your novelty and purity by taking the food you eat. I told you, because it converts into the dhatus, and then your ojas, that's going to take care of your immunity levels. Everything depends on starting the food properly. Try to include, one is try to include some water, not with the food, but after say half an hour, before or after, and that is with food, and otherwise in the whole day long it has to be 8 to 10 glasses of water. That is a necessity. I've come across so many people who this is the first factor that is actually needed in the diet. And then there are the 6 days that has to be included in your diet: madhur, amla, lavan, thick, katu, and kashaya. All the 6 days: sweet, sour, salty, pungent, bitter, and astringent. So, and try to include them in your daily diet, and take your food which is fresh, and it has to be appealing to taste, and it is not hard on you. Of course, the taste is good, but then it has to be easily digestible. So take care of the food you eat every day, and take care of the second point I would say is your everyday lifestyle. This has been mentioned in Ayurveda text, that starting from waking up early in the day, and then relieving your bowels, because these have to be excreted from your system. The cleaning of your face and your teeth, and going for oil pulling and some oil gargles. This is so much needed, and you can use some prasadana, that is the application of perfume paste also, in your everyday routine, and regular bathing. And the third point I would say is take up optimum exercise and yoga. That is so needed. So every day you should be going out for either you can have a brisk walk, or going for some yoga asanas, and yoga poses, and pranayama, or the deep breathing techniques. Anyways, you have to be releasing sweat, because sweat has to go out of your system, and then you can be more healthy. The fourth point that I have thought of sharing with you, that is favorable rest and sound sleep. This is also very much important. You have to be healthy, both physically and mentally. It has to be, you have to be in a happy and healthy state. So sound sleep is needed, and at least for 7 to 8 hours of sleep every day is needed. You have, so that your body gets rest, optimum rest, and then you can take up your system very regularly, because you will be replenishing the daily loss of energy in your system. Number 5, I would say take some herbs, supplements. Some of the herbs I actually advise for the rejuvenation, like amla. Emblica officinalis, and Harad is also good. That is Terminalio chebula, and Guduchi is one of my favorites. Dinospora cordifolia, and then ashwagandhas also, because I feel it is a body and mind boost. So Vithenia somnifera, and also some include some natural diet ingredients like cow's milk. That is really good. Honey is good, and then you can be taking some ghee. Ghee, I would really suggest ghee or the clarified butter. This should be included in your daily diet. Try to keep away from diseases following these easy diet tips also. And also, one is these herbs helps to enhance your health and vigor. And then they also, keep you away from the early signs of aging. From the debility of aging, you can save yourself. Number 6, I would say, is take to massage. Massage as therapy. This helps to relieve you from the dryness, the coldness from in the weatherly conditions also. Plus, they help to relax your muscles and your nerves. That is how it is so much needed. And of course, you have to be happy and healthy state. So you're going to have a glowing and soft and supple skin. So that is also very much, and you can go in for sesame seed oil for massages, and you can that is the tiltalum, or you can go in for coconut oil or mustard oil, whatever suits you, or some otherwise also. And what I would suggest is, as Ayurveda therapy would say, that at least 3 parts massage every day is needed. One is soles of the feet, that is Padabhyanga, and then scalp of your scalp also, and then around your ears. So these 3 parts, if you are giving yourself a nice massage every day, this takes care of the optimum massage that is needed per day. And number 7 would be optimum mental balance. This is also very much needed, because a positive mental attitude, this is considered very much necessary for, so that you can enjoy your life as a human being. So, and for this you have to take some enlightening experience, take some comforting experience through divine tranquility. I always suggest, please sit in meditation for some time, and Ayurveda actually suppose that yes, you have to keep yourself, you have to empower your mind, body and soul. And in this human life, it is possible for each one of us taking care of our bodily conditions, and taking care of trying to prevent ailments as much as possible for us. So I think I've been telling a lot about healthy and joyous living through Ayurveda. Do I have more time, or it's done? What do you say?
Yeah, Sonika, that was wonderful, and I believe we can take up some time for some discussions and interactions. And you really kept it to very simple, and the flow was wonderful, and I believe it related to all. And revisiting these simple tips really could be helping many of us. So great to have you, and maybe Rajiv ji, if we have got some questions, we can open the floor for Sonika.
Yes, certainly. I think it was very, very good, very practical, very simple, simple techniques, and I think it was very good for me. I've got 1 foot in conventional medicine and 1 foot in Ayurveda, and still it was very good. And one of the things that we are trying to do is to incorporate the two together. It will be very, very nice. My question again is a little bit focused that how do you see the two integrating together, Ayurveda with the mainline medicine? That's one. And second is also for school advice about young children. What tools and techniques can we use that we can give these tools to young kids to improve their health?
Maybe,
Uh,
yeah,
This
Sonika,
is
please. Okay.
our program, Eat Smart, Think Smart, Be Smart program.
yeah. And what was the first question you said?
First question is integrating Ayurveda. Ayurvedic medicine is one
With
discipline,
the modern medicine.
and the modern medicine or allopathic medicine is the other one.
Yeah.
And many people don't like each other.
That happens. So the best part, what I actually like about Ayurveda is focus more on preventing disease. There's so many, things that you just need to, I think in my talk I've told them that these are the 7 modules and Ayurveda suggests so strongly. Of course, you have to go in for curative, and now the world over the people are understanding that they want to be natural. They understand the basics of we are total natural beings, and that is how we can relieve ourselves from the ailments also going forward. Thorough detoxification, taking good diet, taking good lifestyle, that is all needed. You can prevent ailments from touching you.
I've got a question from Suryakant. So we can bring him in, and then we will continue the discussion, and hopefully soon we'll bring our loved Biju from Mauritius. Biju and Ish have worked together, and we were actually talking together yesterday for a long time. But before that, let's get you to answer, I think, some question which Surikant was trying to push. I don't know he is still there or not. So welcome Biju, but before introducing you, I would give one more opportunity to Surikant if he still has any questions, and if not, then I will just bring Biju in. So again, Sonika, it was wonderful talk, very practical, very simple, very easy, and I think I will appreciate. Over to you, Ish.
Yeah, okay. Thank you, Rajivji, and thank you very much, Dr. Sonika. And
Thank you so
we look forward to associating with you more regularly. And we have got a lot to hear from you, because you have been an awesome writer. So maybe if you would be introducing, some crux, some gist from your books, that will be
Yes.
more than enough of an education for us and information for us. And maybe Rajiv ji, we can welcome Biju for really much awaited discussion about this possible retreat.
Fantastic. So, going before Sonika, if you are such a good writer, we would welcome you to write an article for our forthcoming journal, The Health Practitioners, because we really need. And in fact, I was thinking that we can dedicate one of the issue to Ayurveda.
Yes.
Okay, wonderful. Let me know.
Yeah.
Thank you so
Sure.
much. Our lovely Biju Vijayan, a man from the island who is primarily focused, a successful entrepreneur, and has done a lot of work in field of Ayurveda, primarily from business point of view. He has established Ayurveda. He's a business administration graduate from IITM Bombay, 20 plus years of experience in various business management, and particularly his focus is Ayurvedic wellness. And I had a discussion with him on several occasions, and we are planning to establish Ayurveda in UK, and we had a few discussions, and some more need to happen before we go into that successful venture. But before that, I would like to tell a few more things about him. He was born in Kerala, and Kerala is a land where I had my first Shirodhara, an Ayurvedic massage. I was put under the head quite a few years ago, and the guy said, head under this, and this oil coming and whole body, and there was a massage. Initially it was the hot oil. I was thinking, oh my goodness, where I am. But I must tell you, It was such a delightful experience after this, and I had a wonderful sleep. All four of our family members just enjoyed it. So I think Kerala is the land. We just went there, going around, and it was wonderful experience. So here is a man from that land of Kerala who has got now established internationally. He's planning to do a retreat for us in the lovely island of Mauritius, and we have been just talking about it. In fact, he might actually share some of those. But let's just talk. Biju, how did you get into Ayurveda? Because business administration, business management is very different kettle of fish. I have done MBA from Open University here. 3 years. It was a slog, a lot of work. You go into that. So how did you land up into Ayurveda, and how was your kind of journey? And then we'll come to our other part, which is how do we take it into bringing it together, the whole integrated health and practical aspects of it. So to you, Biju.
Thank you so much, Dr. Rajivji and Dr. Ish Sharma, for giving a wonderful opportunity, and especially you asking me a fantastic question. Actually, it has been believed that after a certain age, we need to start doing something own. 40 years, we can divide our life is in 3 spans. At the 20 years, first 20 years time, we need to learn things from academically or from others. The next 20 years is need to learn things from experience. Then another 20 years time, we need to do something for own, also for the society. Then the last 20 years for the, we can go for sannyas kind of thing, society. So almost reaching the age of 40s, we thought of, I was thinking, instead of doing a employment, we can think about it something own. Then that moment, I met a fantastic person. He's an Ayurvedic doctor, some other things. I met him, then inspired with him. His name is Dr. Sethu Madhavan. He born in Kerala. He is the only person is doing Kayakalpa treatment. I don't know whether you heard about it. It is in Ottapalam, one of the most rarest treatment in India, in the Ayurveda system. So he's the person is doing that treatment in Kerala. So by meeting him, understanding from Ayurveda through Kayakalpa treatment, I fascinated with Ayurveda. Then I improved my thought. Instead of doing something, I thought of doing something for the society. So slowly started Ayurveda to spread other part of the world instead of the knowledge. And you said that Ayurveda is the knowledge. It's basically Kerala is known as the land of Ayurveda. In fact, not the right reality. Even the Ayurveda started in the north part of India. I need to correct it. Because of north part of India, these people were suffered a lot from the invasion. So we were from the south side as basically saved from the foreign invasions in ancient times. So most of the ancient knowledge preserved in South India side, it was safer side instead of invasion issues. So we were able to practice, especially Kerala, a couple of families, Ashtavaidyas, they call Ashtavaidyas, they were practicing Ayurveda, especially for the Panchagama treatment like Shirodhara and Kashayavasti and all the Panchagama treatment. So that's the reason it is getting famous in Kerala part. So I'm just brief about my way to Ayurveda. So meeting the Dr. Sethu Madhavan, he's a fantastic person. So made me to enter into Ayurveda. So he's having an Ayurvedic hospital in Ottapalam. That's my journey to Ayurveda.
Fantastic. Yeah, no, I think I knew I have been that's the whole thing, but the whole, people know about now Baba Ramdev, who actually is kind of, and I know the whole thing was a lot in North, but I think the purest form of Ayurveda I first experienced, it may not be right, my first purest experience was in Kerala. And I was told that guy does thing which is not available, and I was disappointed because on first day our appointment was rejected because he was full. So we had to wait till next day to get it. But I think you are absolutely right. Ayurveda is rampant. It's everywhere. I've been lucky enough when Swami Ramdev came to UK, he has appointed me as the chief medical advisor for Patanjali UK, and I have been associated with Patanjali and particularly Sunita Poddar, who actually have donated the Peace Island to Swami Ramdev, been there on retreat, immersing into this all. And I've been a yoga teacher myself, and with that comes Ayurveda, whole Pal Krishna Vaidya's, whole shenanigan which I had to go through, and I'm enjoying it. It's very good to have a feet on both sides. I am thinking that it will be good to have that immersion which you were talking about, and I was talking with you on a few weeks ago. For those people who don't know, we have done the holistic treatment pathway for National Forum for Health and Well-being, and Biju has provided our first speaker slot on the National Forum for Health and Well-being. It was a international global seminar a couple of years ago, and it was fantastic to see all that in action, particularly the Panchkarma. So I know that you have two business heads, the one which is like immersing into it but also globalizing it. So I think it'll be good to have your input into how do we take it further and how we bring people together, because on this basis we are bringing scientific people together, bringing thoughts together, and now the next step is how did we do on that aspect, and how can we convert that into practical aspects such as doing retreat or immersing people deeper into it. You might share that, or if you have any other questions or you want to highlight, because you are in the same island, so how we can make the best use of the next 15 minutes or so.
Yeah, I believe Biju will be presenting something very relevant, because what we have been discussing for last 3-4 months, that after having spoken so much and knowing knowing one another so well virtually, now this is a high time to see one another in real, and really learn and teach mutually. So maybe Biju can present one concept and we explore, because this will be very important, very relevant to all. And then we go on to Dr. Mamta from New York.
Okay. So Dr. Rajiv ji, you in the last discussion what you mentioned, I wanted to tell you most of the Ayurvedic practitioners, even in Kerala also, they are very good for the treatment, but expanding their business, they are not that much of professional and approach. So if you can add the professional approach, a little bit to modern approach for the expansion in profitable wise, and maybe more standard wise, the Ayurveda have a tremendous potential. See, you said that you are experienced in Ayurveda Kerala, but most of the time people will be land up in the wrong place because they are just simply looking at the website and going to some places. But why Ayurveda Kerala was successful? Because there are 8 families. It has been believed that certain families have got the knowledge of Ayurveda from Lord Parashurama, and they are practicing the knowledge for many generations. So they are professionally good for their practice, but they are not able to expand the knowledge to other part of the world. So the mission is to develop to other part of the world. So one of the reasons is that we need to more into professional side, or not only Ayurveda, all the integrated medicine. So for this one, I was thinking, myself and Dr. Ish was discussed many times. We are meeting almost 150 plus occasions, weeks for this Ayurveda time. Now it is a time we can meet together and join together and share the experience and practice each other, and by cross training each other and gaining each other. That is a basic concept we wanted to propose. It isn't just thought, it's a seed of thought. it can be expanded and developed. So I can share a small presentation to you. Is it okay?
Yeah.
Okay. Are you able to see the presentation?
Yeah, we can see that, Vijay.
Okay, 1 second.
If you want to enlarge it, it will be better.
Yes, I'm doing it. Yes.
Thank you.
See, basically, we are proposing a Healing Our Health International Integrated Healthcare Practitioners Conference. This can be the first physical conference because we are practicing, we are meeting and discussing and seminaring. So this is the first program we are proposing we need to do right now. So we are proposing Mauritius can be one of the best destinations to host this program. And there are various reasons. Mauritius is the country which can speak 3 major languages of the world: Hindi, English, and French. And third important aspect is that Mauritius is almost a seasonal time, especially whenever there is off season in the Europe and West countries. Mauritius is having a fantastic climate. So most of the time in Mauritius, we can host it. And especially Mauritius is one of the area, government side, which is allowed Ayurveda or any integrated medical practitioners legally. So all this aspect, Mauritius can capable of hosting the first International Integrated Health Practitioners Conference for Healing of Earth. So the objective of this program is to learn from the program, and we can also, there are a lot of expert people are in our group. They can teach, and also academic, apart from the academical things, we can experience by practicing, and physically by practicing it, it can experience almost all the integrated medical systems via also a holistic living. This is not only theory, because we are doing this program maybe 3 days or 4 days with an exactly holistic living approach with cross training each other, which means that suppose if I have an Ayurveda knowledge, I have to share to the other people Ayurveda knowledge, and somebody is having another knowledge, they have to share it and the other person experience about it. So this is the way it is been, this program will be charted out. And the expected outcome from this program would be improve the sensitivity towards other system, because many people knowing about the other system, they heard about it, but never experienced it. Once you experience that, your confidence level will be very higher about other system, because it's maybe very far away from our own country. Through this one, many Ayurvedic practitioners, holistic practitioners are in our group. We can expand our mind, which means the knowledge and spirit towards the other system. And also we can enhance our practice. Of course, when we are learning for the new system, slowly, if it is successful, we can implement that system also in our regular practice, and of course, enhance our income too. Without income, the practice cannot be successful. So that also part of that. And this program, the most important thing is the target segment, who are the participants. It is exclusive for the integrated healthcare practitioners and researchers, educators, clinicians, and therapists and trainers. So these are the target segment. Very selected group will be practicing this program. And the program title can be Healing Our Health, International Integrated Healthcare Practice. And the proposed time can be flexible. I'm just putting a date. It can be between 15th of January and 15th of February 2023. Because October, November, December will be peak time, so people will be very expensive to travel kind of things. And Mauritius, January to February will be very nice climate, and it will be after the peak season is over. And Europe, the climate will be very cold, so Mauritius is warm climate. It will be very good time, and we can propose, of course, Mauritius. And one of the major reason we can post it, that we got Dr. Ish Sharma in Mauritius as a very expert person, very supportive and true believer of Ayurvedic living. So we are proposing the program into 2 programs. One is exclusively for the integrated healthcare practitioners. This is a cross training workshop, because not more into the practical and theoretical side. And another way, another program is the last day, 1 day public program for the publics of Mauritius. As I told you, Mauritius have a lot of holistic way practitioners and believers also, and the government is also recognize the traditional medicines in Mauritius. And as I told you, the first program, closed training program, selected number 25 to 30 and not more than that. And the program timing is planning 3 to 5 days, not more than that. We can select according to your opinion. And public program will be 1 day program. It's a general publics of Mauritius, and we can have at least 10 international speakers from our group. And I know there are a lot of fantastic speakers. The Mauritius public can hear from you. The complete radio and TV will be broadcasted, because it can reach out the public. So whether we are speaking Hindi or English or French, the public can understand. So it will be a fantastic program. That will be a 1 day program. So altogether, maybe 3 to 4 days or 5 days. And the workshop which we are planning, actually the workshop we are living according to the fundamentals of our holistic way of life with the natural. We'll be preparing our food with natural food and organic food, and we have expert nutritions and cook chefs, so they can advise people to prepare our own food, especially not hotel wise, but we can do natural food. And we are starting our day, early day, with the yoga practices, because so many people may not be having that one. We heard about it. We are living in the 3 days time according to the holistic way. And followed by, there will be theoretical classes and seminars, workshop and cross training from the integrated practitioners all over the world. And of course, we have to arrange a practice of Panchakarma treatments, which we can host in Mauritius. And Dr. Rajiv Ji was telling that he experienced the first time in Kerala. Similar practice many people can experience from here, or the Ayurvedic Panchakarma treatments and other systems as well. As I told you, we'll be very strict about the diet in Ayurveda holistic way. So similarly, our lifestyle will be in the 3 working days, workshop days, will be holistic practice of food preparation, and we can share our cooking and cooking classes, which food, what food, because Mauritius you can get all the ingredients easily for the preparation of food and kind of things. And apart from the classroom training, these 3 days we can also have a couple of outdoor wellness activities, because Mauritius is a very beautiful place which can explore the nature. Because of Panchamahabhuta principle, we can really explore in Mauritius. That is also the clubbing altogether. We can structure a fantastic 3 to 5 days of workshop activity in Mauritius, which will be amazed experience in everybody's life. And to the final day, we can have a good function, like an inaugural function of the public seminar, and the participants can get we can definitely 100% make participation of the Prime Minister of Mauritius or President of Mauritius, and a couple of ministers also participated, and we can distribute the certificate from the Prime Minister and or President of Mauritius. They will be available in the program. And of course, we got a very good connection with the WHO Traditional Medicine Board and Ayush department also. They can also be part of our program, public program, and they can also they can also provide a couple of representatives for the program. It will be international reach. We will get a very good international reach for the program. And of course, our own, we also have around 10, we can select 10 to 15 good speakers from our group. They can also speak out very well. And after that, all of you have get a good opportunity to explore the Paradise Island of Mauritius. It's a fantastic, beautiful place with the skies, sand, and sea. We can experience that also in this program. So this is a small brief of thought. As I told you, it's like a small seed of this program. So I would like to hear mainly from you. If you have suggestion, we can discuss right now, or we can discuss the forum, open the forum for discussion. And if there is more suggestions, we can interact with our WhatsApp group as well. So this is a small presentation all about, and I would like to hear from you what we can do later.
Thank you so much, Biju. I think it was an excellent idea to really get it off the ground, because we have been talking about it, and effectively to bring people in same hall or same venue to have that heart-to-heart discussion and have the practical experience of different disciplines of medicine is extremely good. And as we discussed, Mauritius is a small island, beautiful. We can combine people's holiday package with the package of learning, and also a package of immersion into deep how the lifestyle and Ayurveda can help. So I think that will be really, really good. My view is that, as we discussed yesterday, the program overall is more a skeletal form. We will need to mature it a little bit more, but I think it'll be good to have ideas from people, and then this is just a draft. We will come back to all those people who are listening with more concrete idea, more clarity about where, how, what, and the costing and the stay and the travel, etc., a little bit later. And I think the timing is perfect, somewhere between 10th to 20th January is actually a golden time, because that way all the Christmas fairs have gone down, and now this is the real time. By February the holidays, I don't know, in UK half term starts and blah 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 and probably many other places, so that's golden time. We will probably do that, and I can see at least say 10 or 15 of us very keen on going it further. However,
And Rajiv, furthermore, and Biju, fantastic work. You've got the first draft done, as we agreed that in 2-3 weeks' time we'll go live. Just particularly about this retreat, will take more than a couple of hours live on an episode of Healing Our Earth. We will, once we discuss the potential venues, we will actually show them and take a tour and show them the wonderful Indian Ocean country of Mauritius and the hospitality of the people. We'll actually get Gayatri, the presenter at NBC, the attaché from the president to welcome people. Let's include all and make it a very good, complete 360 experience for people. So it's not only spiritual, social, educational, but also fun, holiday. And together, when they come back home, they want to just ask us, when is the next one?
Absolutely.
And the fact that Ish will be able to bring in so much value from an educational point of view, and Biju yourself and Ish, Biju, you will actually work that each one of them gets a nice Panchkarma one-to-one treatment where Rajiv can look and say, hey, it was me 15 years in Kerala, now you get it done. So it will be very good. And then method of communication will be very simple. We will share among lots of groups and see, and the option of the dates, end of January, beginning of February, which is beautiful because everybody's back. What we will do, we will agree with the venue, 2 or 3 potential 5-day dates, and see which is the highest take-up, and then we lock it. And then we'll give an extended option for people who want to see the local community, the local market, the local fruits and veg, the local sightseeing, which brings a complete experience. And then we can put up a package, not just for a couple, not a single, not a couple. If there's a family, we can plan something for them. So let's experiment. Beautiful parties, we are there on the ground because you, Ash, Ish, Gayatri, Saivani, I mean, in fact, we got about something like 19 people who are connected to Healing Our Earth, and it will be so beautiful. So Rajiv, Ish, well done. Let's just extrapolate this further. This is our first draft. The next draft can maybe include pictures and more and further better particulars. One of the Chef Daksha, who is here, who has just commented. Our producer, kitchen producer, Seema, who Daksha knows very well. She's already aware right now. She's watching us in Hong Kong right now because it's gone past midnight there. Our team in America, Sharon, Wai Ching, who still haven't seen the package yet. So what we will do, we'll show them the third generation package. So not the first one, the second one, the third one. And when we go live on this screen for more than 2 hours, because we'll get opinions, discussion, we will fine tune. And from the price point of view, let's declare right now, Healing Hour is not into profit for this. It wants to share its knowledge with you to make this happen after pandemic. Later, we can increase our retreats. So that's my bit for it. And superbly well done, Ish and Biju. You've been working very hard together with our Rajiv over here, who has been talking to you. So let's just extrapolate. And Biju, once again, you can keep on smiling. Well done.
Thank you. Thank you so much.
Brilliant. I think that is such a good ending. So I think Nil Kumar is the mastermind from the back end, organizing everything, and we are actually trying to work on it to make it manifest. And I'm also very, very pleased with the first draft. And I think there is still a lot of work to be done in order to make it happen. But I think it's a delight to speak to the group, and I think we are going to move shortly into session for open discussion. But before doing that, I would just want to have any more comments on it. I know
So Dr. Rajiv, shortly we'll be going to USA to Dr. Mamta Singhal. She's waiting with a smile over there. It's morning there in America, or if it's New York time, it's just 1 o'clock in the afternoon. In Mauritius, presently, it's coming to 9 o'clock in the evening. In India, it's gone 10:30, and in Hong Kong, it's 2 o'clock in the morning. We are all connected everywhere. So before we go to Dr. Mamta, yes, if there are anybody who has got any questions, you can raise your hand, or Ish, you can have a say, because we haven't had the say on our retreat.
Yes. Maybe I would request the wonderful audience, the wonderful participants, to keep thinking about it very positively and start submitting their consent that, okay, like we are kind of open, because everything would depend upon the numbers, how many are coming. All the costing, etc., can only be worked out when we know, like there will be 10 or 20 or 30 or 50. Things would keep changing. So please start making your mind and start conveying your willingness to us. You have got all the options to withdraw later on, no problem. So that's how we start working upon the costing, which is the most important.
So Ish, just because we are looking at a smaller group between 20 to 30, we already got 6, Dr. Rajiv, yourself, Biju, myself, Chef D, Seema, and this is the only ones who already know, because nobody knows about this except today. So I think we are already on our way. So nothing is going to stop us.
Oh, great.
We got Madan, who is our resident panelist, and he has got something to say. So here we go. Madan, you are yours, so you can unmute yourself, please.
Ishji, namaskar. Rajivji, namaskar. Biju, wonderful. Namaskar. Thank you. Enjoyed that very quick, very brief presentation. And you have given us the skeleton into which we can hang many things. And Ishji already knows, is engaged with the diabetes issues. And so my only comment at this point, a wonderful skeleton that can be taken to many parts of the world. In my chat box here with our Shantalaji, I suggested we could take the outline you have given and we can play it out in the Baltic region also, in a very beautiful part of the world, number one. Number two is to see if you can distill, Ishji will help us with this, and also Rajivji will help us with this, distill it into some very strong themes. Metabolic disease is one thing, So Ishji already has access to the large number of people with this complication. So you can actually engage in that theme and it will attract a global audience. Number three, the point I just want to highlight here, and this is for people who are connecting to us from America, the 77th United Nations General Assembly is to be held middle of next month, starting 13th of September to the 27th of September in New York. Now, if you can somehow, if Ishji, yourself, and Neil and others here can actually make a little pamphlet that can be circulated at the World Health Assembly, at the United Nations General Assembly, just to give it that global kind of perspective. I think Ishji will be able to guide us better because he connects with our Indian mission in Mauritius, and our ambassador there is very connected with. We have a new permanent representative representing India at the United Nations, and Her Excellency Ruchira Kamboj is the name of the person. And Ruchira was earlier ambassador to South Africa, and she's now the India's permanent representative in the United Nations. And Ruchiraji was earlier also with the UNESCO. And many of those points, I think Rajivji asked a question about children, how to connect this with children. And maybe it'll be easy for the Indian mission in Mauritius to discuss this with Ruchiraji. Ishji, you know how to do all this, but this is just an early thought that came to my mind.
Sure,
Listen
sir, I
to
will.
this excellent presentation by Biju. Thank you very much, Biju. Enjoyed that very, very clear presentation. Namaskar.
Thank you so much. Friend. Now we have Dr. Mamta Agrawal, who comes from New York.
Oh, Mamta ji, namaskar.
Namaskar.
Mamta, delighted to be here. We were just remembering New York, and you are based there in New York. You see the power of this connected community is that we can get a message.
I am so much honored to be here with all of you. Miss, I just feel like I'm a beginner in Ayurveda, and meeting all these London people. It's a great honor for me to be here, and thanks to Dr. Ish to invite me to be here, and Neil to help me with all the things. I'm really, really happy to be here and share my knowledge, whatever I have learned over learn over the years with my experience. I'm gonna share something on skincare.
Mamtaji, the thing is, as long as you are breathing, you are Ayurveda. So you are Ayurveda. And Ishji will say, you are already Ayurveda. You just need to recollect and remember what you are, what is Ayurveda that's already inside you. The other point is how to, this international community is a very network, very strong community, and to have you in New York and to take forward this suggestion that we've just discussed. Ishji will connect with yourself. And
yeah, sure.
Biju will share the outline, and just to have somebody on the ground is a big strength.
Yes, sir.
Whatever help, anything needed, I will be here. So, like, very close to New York City.
You can see I have just come out of this event in Toronto, and we have the blessings of the Council General of India in Toronto, and there is a foundation there called the Canada India Foundation. And Ishji is already our, anchor in Mauritius and engaging with the 55 nations of Africa also. So it's in many levels, it's a very strong network that we have. But every day we are adding a little bit to it. We are adding some strengths to it. And so here is today's event, and it's lovely to hear Biju talk about his vision for the future, which they've discussed. But what we were saying is to put some details that will attract more people into the specifics. I think Rajivji is very good at doing this, putting all those details and highlighting metabolic disease, diabetes, skincare, or dermatology. We would call it skincare, but the modern medicine people want to hear it as dermatology. Or we would say rough skin, they want to hear it as psoriasis or something, So it's just a way of connecting those two sides. And we would say, Vata, Pitta, Kapha, they would want to hear it as inflammation. So we will have to make that bridge and bring these two people together. And we have enough minds here who can do that. So we are delighted you're here. We want to hear your stories from New York.
So with that context, thank you very much, Madanji. I think your wisdom is unimaginable. You are so wise. And I think we would want to hear a little bit more about that during our panel discussion that's going to follow a talk from Dr. Mamta Singhal. Antonio from Italy is as well here. So we're going to hear him in in a short while after that, but I think the whole day has just been amazingly inspiring and very thought-provoking. So let me just introduce Mamta from the transatlantic area, and she is a esthetician, so basically skincare. And as we know, in UK there is dearth of the dermatologists as because everybody want to do how we can make beauty skin change, make it young, wrinkle free, and attractive, if that's the word. And there is a natural inclination for people to be attracted if the skin is smooth and wrinkle free. And with best below, I'm not a sexist, but women like it more. So it's not just that, because there is a lot of money. There is 3.6 billion pounds spent on making skin more young and attractive. And a point we have introduced and created a natural health and beauty product called Age Stop. And basically that means you stop advancing the age by increasing the collagen underneath the skin, so that if there is collagen, then the skin will look wrinkle free. So I think that is just the point to highlight why Mamtaji is spending her life onto the skincare product. She's a multicultural person. Inner purification is related to the beautification in external world. And although she doesn't call herself very old in Ayurveda, she has done a bachelor in the Ayurvedic medicine and surgery, and then aesthetics degree, and she's currently into USA and doing this all in day-to-day aromatherapy, perfumery, essential oils, etc. But more importantly, I think we would like to hear from you how ancient skincare is now applied into the modern context, and how would you see this working together in that way, so that we can bring those nuggets from that old gold part where people were using multani mitti for beautifying the face, to now all your facial massage and facial therapy, which is again using the same mud which I have been asked to go once by my wife to have a facial, and I found the same multani mitti which was used like 200 years ago is being used. So there is some parallels in it. So please go ahead and tell us more about, and we'll hear from Ish, who is also actually very good in it. So he probably will add some more value to what you say. Over to you, Mamtaji.
Thank you so much, Dr. Rajiv, for giving such a beautiful introduction to me and the work I do. And in addition to that, I also want to thank Dr. Ish for inviting me here, and Neil for all his help. So today my topic is ancient skincare in modern context. So let me share the screen. Just a second. Yeah.
Yeah, Dr. Mamta, you are muted. Can you unmute?
Hi, Mamta. At the moment, you are not sharing the screen, so you need to go to the green button.
I think I have to join in again. Give me a few seconds.
Okay, no problem. Carry on.
Okay, yeah.
I think it'll be good to hear from Ish. What do you think of skin and beauty? Because it's such a big business in
Skin is like, this is a very, very powerful area, and where we fortunately could experience like almost miracles when it comes to skin diseases, like very long-standing lichen conditions, and then SLE and psoriasis, chronic eczemas, all kinds of dermatitis. So I believe Ayurveda is very, very potential when it comes to skin care and skin healing. And this is one area where Viruddhahara, the wrong dietary habits directly impact your outcome. It might not be that easily like visible when it comes to your IHD or diabetes, but when it comes to skin, then your dietary corrections reflect immediately, like within no time. Okay, there we have Mamta sharing her screen.
Yeah,
So yeah, you can go ahead, Dr. Mamta.
yeah, pause it. We will hear back again from you. Let's hear Mamta, what she's saying.
So today my topic is ancient skincare in modern context. My interaction with skincare started when I was a small kid. I was born in the lap of Himalayas. And whenever I had any issues, cough or cold, or even any skin problem, my mother will get something out of her kitchen and she will fix it right then and there. So that was my first interaction with the Ayurveda and also the skincare to be treated with the home remedies. And then I did my studies in Ayurveda, went to different countries, and I worked in London, Switzerland, and USA. So it was so interesting to see people from all the different backgrounds and different ethnicities, to see how great Ayurveda is, even no matter which continent you are, we can use this universally. It's the principles of Ayurveda can be applied anywhere and everywhere. And during this time when I was traveling to stayed in all these countries, so I am a very big fan of fragrant objects. So always liked the beautiful cosmetics when I was traveling to all these places and all the good brands selling their products. So I was so fascinated, I started using them. And I used them for years, and I tried European products, I tried American companies' products. And then at one point I realized that I am not getting the results which I was expecting, spending so much money, but not getting results. And I was thinking about it. Then one fine day, I thought about what my mom would do if I have this, to fix this issue. So then I went back to Ayurveda. And then I started using all the Ayurvedic knowledge, the herbs I used. And then as a result, I end up making my own skincare products. And also then I volunteered for an NGO. They wanted me to make products for them. So I volunteered and make products for them. And I'm still making them and getting good results. And for today's talk, my agenda would be skincare around the world in ancient times, Ayurveda and its concepts, modern skincare, correlation between Ayurveda and modern skincare, and my approach to these connections in facial skincare. Skincare in ancient times. So if we look at this, in Egypt, skincare was not only for beautification, it was also for the protection. They used coal to protect their eyes. They used milk baths, and face packs made of milk and rose. They also use Dead Sea salt to exfoliate and rejuvenate and heal their skins. They use burnt almonds to paint their brows. In Greek, the best remedy they used to stay young was fresh berries with milk. And they used a lot of olives in a different ways. They used olive oil to stay younger, to reduce their fine lines, and they used olives as exfoliant too. They were very big fan of honey, so they used honey with milk, honey with the yogurt to make face packs. In medieval times, People, they liked to have fair skin. So they used aloe vera, rosemary, cucumber as a cleanser. They used seeds and flowers as masks, and they used vinegar as a toner we use. And then in Renaissance period, so people started to paint their faces with chalk. Again, it was, they wanted to look fairer somehow. And the very interesting part was, during that time, they dipped bread in rose water to reduce their puffy eyes. And also they boiled oatmeal in vinegar to treat pimples. So then in Baroque period, they used milk baths, but they were more into makeup. Women, they used lip color for their lips, and they also used color for your face powder. In 1800, Vaseline was invented. In 1900, many skincare companies came into existence like Spond, Estee Lauder, Oil of Olay. Until now, a lot of companies are making their products, and it's getting more into natural skincare. So now in India, during Indus Valley civilization, skincare was more about religion. People smeared their faces and foreheads with powders and herbs. Mainly they used sandalwood, saffron, neem, aloe vera, turmeric, amla, etc. During Gupta dynasty, they used cream and oils and paste, though during this period they were more into art and culture. During Mughal empires, they used surmas. Surmas are the it's kind of a kohl for the eyes, like eyeliner. So it also treats some disease in the eyes. So they used this. And henna was used to color their hair and also as a fashion, like tattoo. So when we go to India history, then there is also mention of Mirabai. She loved putting natural almond oils for her skin to keep it soft. And there is a mention of Rani Sanyukta, who was obsessed with, I would say obsessed with rose, because she used rose in everything. Her daily bath was full of water with rose petals and milk. She will put paste of rose on her body mixed with honey. Then there was Rani Padmani. She believed in the essence of natural oils. So she heated the oil and treated her hair and body and skin with the aromatic steam of the oil to derive maximum benefits. So now let's get into little Ayurveda, what Ayurveda thinks. According to Ayurveda, we all are made of these 5 elements, everything from peas to person. So these elements are space, earth, fire, water, and air. So when these 5 elements combine together, they form 3 energies. These are Vata, Pitta, and Kapha. So I will go quickly on this because everybody knows about this. We will focus more on the skin. So Vata, Pitta, Dosha, these are the 3 doshas or 3 energies we can say. These Vata is a combination of space and air element, and it is mainly related to the movement in the body. It governs circulation throughout the body. And Pitta is a combination of water and fire element, and its main work is digestion. It is responsible for all the biochemical activities in the body. And Kapha hold things together. Water and earth are the main elements in this. It's responsible for the construction of living body. We have all these energies, all these doshas, but in different proportion. That is how we look different. Our hair, nails, skin, they are all different. So let me, then there is a Saptadhatu. These are the 7 vital tissues that provide nourishment, growth, and structure to entire body. All the dhatus are nourished by rich, oily, or sweet food like ghee, almonds, and date. These are few examples. So these dhatus are Rash dhatu, tissue fluids, use food, whatever food we eat to nourish body tissues. Then Rag dhatu, it is blood nourished by Ras dhatu. Then Mas dhatu, which is related to muscles, nourished by Rag dhatu. Then Med dhatu, fat and connective tissues, lubrication and protection is the main function of it in the body. Then we have Asti dhatu, which is bone tissue. It supports essential organs, brain, heart, kidney, and also it gives shape to our body. Majja dhatu, it's bone marrow, which generates RBCs, WBCs, and also fill our bone cavity. Shukra dhatu is all about the gist of whatever we have eaten. It's the ojas, the main thing, which is the main power we have in our body. So it is also related to reproductive system. It's responsible for the secretions of estrogen, progesterone, testosterone. And then we go to Agni. Agni is the most important of 5 elements. We need energy to all our physiological actions and functions. Tissues are broken down constantly and rebuilt. When we eat, food is transformed into physical form to help building new tissues. The energy responsible for this transformation is called Agni. So the main functions of Agnis are digestion, it nourishes 3 doshas, nourishes subdhatus, it clears mind, thoughts, and ideas, maintains life force. There are many types of Agni, all 5 elements they have their 5 Agnis, then all the subdhatu, the 7 tissues, they have their Agni. But here we are going to discuss about Jathar Agni, which is the main and which is highly related to the skin. So even there are 4 kinds of Agni. These are Sam Agni, Vishma Agni, Tikshna Agni, Mand Agni. Sam Agni, when all 3 energies are balanced, then we are healthy person. And Vishma Agni is inspired by Vata. It's when it's in balance, our body and our movements becomes very irregular. And then Tiksh Agni is guided by Pitta. It's like overactive of the Agni. Then Mandagni, which is guided by Kapha. And when these Agnis are totally out of balance, they create Ama, which are the toxins. And toxins, according to Ayurveda, this is the main problem for any and every disease in Ayurveda. We really have to take care of Ama to have a healthy body and healthy skin on top of it. So Shushrut also, look at this picture, there is a milk pot. Acharya Shushrut has compared the human skin with the scum. When we boil the milk, we call in Hindi it's malai, with that. So it's very interesting according to him. Even if we think about how we cook milk, if we have appropriate Agni, all the layers of scum will become very nicely formed. And similarly, it's with our skin. If we have good digestive fire, good metabolism, then it will result into good skin. So according to Sushruta, the skin was formed when Shukra and Shonit, when egg and ova, they meet. So at the same point, then the many layers of the skin start developing. It's an interesting concept, and we will go into, we really have to spend a lot of time on it. So now let's move to the layers of skin. In Ayurveda, we have 7 layers of skin of Bhasani. This is outermost layer, devoid. It does not have any color. It reflects colors of the inner layers and the aura of the individual. When impaired by doshas, it creates pimples, acne, dandruff. Then lohita. Any changes or impurities on this layer affect the first layer of bhasani. And the disease we can have when the vatas are vitiated is moles, dark circles, pigmentation on the skin. Third layer is shweta. When it is impaired by doshas, then we can see eczema, allergic rashes on the skin. Tamra, it's copper in color. It nurtures upper layers, and if it's not copper, then it creates skin infections. This is also the main protection. It creates a barrier to protect the sun from the outer forces. Then Vedani, this we have sensations and feelings in this layer. It connects our body to it connects the skin to the rest of the body. And we can see the heart piece is the disease comes on this layer. Then Rohini, this layer is mainly for healing and regeneration. Doshas can cause disease like cancers and tumors. Last one is Mamsara. This is innermost layer. It's a platform for stability and firmness of the skin. Doshas can cause abscesses or fistula. So now skincare now. Let's have a look what skincare is now. So skincare now, let me go back. Just 1 second. So skincare now, layers of skin in modern science. These are epidermis, outermost layer, dermis, this is the middle layer, and hypodermis, this is the deepest layer. And we can also connect these layers with the Ayurvedic skin layers of skin. So like, for example, there is not direct connection, but there is correlation between the Ayurvedic skin layers and modern skin layers. So for example, the Avbhasani, we can relate it to the stratum corneum, and then we can relate Tamra to the stratum granulosum, and then Vedani, it's a papillary layer of dermis, Rohini, reticular layer of dermis, and Mamsthara, this is hypodermis, fatty tissue. So there is another way to look at skin, or I would say now we are coming towards the facial skin care. So the other way is to see the skin as elevated or flattened or depressed. So elevated is Vidhyatmak, flattened Roga in Swasthan, depressed Rog in Kshayavastha. So we can see how modern science is related to Ayurvedic science. It is, and we can use the same thing, elevated, flattened, depressed things, all the disease in the skin care with our dosh dusya samurchana, using our vata pitta kapha base. So practical application in facial skin care. When we have holistic approach to our physical, emotional, mental health, we can be healthy, and that reflects on our face. To do that, internal purification with Ayurveda and pranic healing and external beauty with modern skin care knowledge is done. So for example, if we look at the beautiful, healthy child, look how radiant his skin is, sparkle in his eyes, because he has not still faced the environment outside that much, and the emotions or the physical trauma we all suffer, whether it's mental, emotional, spiritual. On the other hand, if we look at the pale face of some person who is ill, we know that something is not right within. So that is why beauty is a reflection of your internal health. So we really have to take care of internal health. So that is how we study all the 5 elements, Vat, Pitta, Kapha, Dosha, Saptadhatu. So in Ayurveda, the skincare is not just we have something, some issue, some papules, some eczema, we put topical, some steroids and it's treated. No, it's not like that. We have to go deeper into all the skin layers, Saptadhatu, Vat, Pitta, Kapha, to really understand the root cause of the problem and then fix it. There was a case in, it was mentioned by my teacher. One lady came to him, she had like 4 skin problems for last 5-6 years. She had done a lot of treatment, allopathic, Ayurvedic, but she still had this. So it will be the steroids and other treatment, it will get fixed, and again it will appear after some time. So when my senior doctor, he went deep into the history of the patients, he asked him whether about contraceptives, are you using, did you use any contraceptive, are you using? And he asked, like, can you relate that you had this, when did this skin started having this problem? Was it during your when your child was born? So after that, the main reason for the skin disease in her body was the toxicity of the tamra dhatu, of the copper dhatu, because the copper tea she used after her child was born. So that is how deep the skin care in Ayurveda is. So for my facials, skincare, I used different kind of herbs. Okay, I think I'm the Panchkarma slide. Where is that? Oh, wait just a minute. Here is Panchkarma. So now we also, let's talk about Panchkarma in treatment for the body. So what is Panchkarma? We all know it's a treatment for body, mind, and soul to have a balanced and cleansed and rejuvenated body. So the main benefits of Panchkarma are elimination of toxins and toxin condition from body and mind, restore constitutional balance, strength immune system, reduce stress, slow aging process, and brings about deep relaxation and sense of well-being. So there are 3 stages of Panchkarma: Purv-karma, pre-purification measures, and which is very important in skincare. It's Snehan and Svedana oleation therapy. So in which we do the massage on the body with different oils. It's believed that there are several neurodermal points in our skin. And so when we, especially in our spine, when we do massage on skin, it automatically, it gets result in the brain, because spine is connected to the brain. So we get holistic results. And then fermentation therapy, this therapy is done, external heat is given to the body. It can be given poultice, decoctions, or heated clothes, or steam. In skincare, I used as a steam. And then Panchkarma, main therapy is Vamana, Virechana, Basti, Nasya. Vamana is creating emesis, then Virechana is purgative treatment, Basti is enemas, Nasya is putting herbal oils in the nostrils, or could be sometimes we use churnas also. And then Paschat Karma is aftercare. It's about diet and lifestyle. So now, since the Snehana and Svedana are the 2 most important things for the facial skin care, I will emphasize how as skincare is the largest organ, there was a patient, a boy with a very dry skin. So he was advised to sit in the tub of milk. So 2 hours of sitting in the tub and his skin was cured. So that is the beauty. And the Vaidya who did this experiment, he said that if we do Vamana on this person, we can collect 1 cup of milk. So basically, our skin also drinks. So we have to be very careful what we put on our skin. So I used these all Panchkarma therapies in my skincare. So I do Sanehana with the massage on hands, on the facial massage. I do Marma massage on the facial, then steam I use. Depending upon, I also add some essential oils to it when it's required. If sometimes, depending upon the patient, I do also Matha Pichu, which is dipping a cloth in the hot Ayurvedic oil and putting on the forehead, which also effects on our brain. And then I also do Nabhi Puran, which is nourishment of through the Nabhi from the navel, because Nabhi, our navel, is connected to all the meridians in the body, just to nourish all meridians. Then sometimes I also incorporate Padabhyanga, massaging the foot, because I feel like that this part, the foot is the main reflection of our whole body. And of course, Nasya. With Nasya, it is also very, during my skin treatment, it is also very effective in a way, because if like we live in New Jersey, close to New York City, so with the cold weather, people have a lot of cold issues. So when they come for the facial, so I incorporate Nasya also, so give some extra massage, and then also take care of their cold and open their sinuses. So how I incorporate modern into Ayurvedic, so the setting is totally modern. So with the modern ergometric beds, the towel, white, like spa-like setting, and when it's needed, I use high-frequency machines on the face, and also sometimes with microdermabrasions. And I am still now my next step is to learn hydrofacial in Ayurvedic manner, so that we can use our decoctions on the face to hydrofacial. Let's see how it happens. And in addition to that, I also use pranic healing, because the same concept of having having holistic approach towards getting a good skin. So I do pranic healing. So I scan the client and scan the chakras and to balance the chakras. And this pranic healing is also, it's a part of Ayurveda in somewhere, but not in a very detailed way. So this, when we reduce stress, that also brings glow on the skin. So the main ingredients I use are haldi, neem, tulsi, giloy, daru haldi, medish. These are all my own pictures, the way I do my facials. And then the oils, these are the few examples: sesame, coconut, olive, castor oil, kumkumadi oil is the gold elixir. So I use it for my facial and the massage. These are just a few main ingredients I used. Other materials are used based on the individual skin type of the client. This information, whatever I hear, it's based on work I have done research for many years, and I'm still continuing till this day. So this is a holistic approach by incorporating pranic healing, Ayurveda, for a calm, blissful mind, healthy body, emotion balance, and most importantly, a glowing skin. So this is the work which I have done with the NGO, with the products I had made. And this is the thing which I'm doing currently in New Jersey. So it gives me a lot of pleasure. It's so much fun to tell people what Ayurveda is, to
I believe there is some network problem at Mamta's, and perhaps maybe Rajiv ji, you can unmute, please.
Yep, I think it has been a fantastic talk. I think she's having some internet connection. Probably everything is stuck. I think we are almost in the time. We have got opportunity to have some discussions before we invite Antonio from Italy, and we will take it from there. I think overall skin is really good, and I think she has been extremely elaborative. I was very impressed with her talk. She's just given every nugget in a very simple and very easy to understand manner. So I think skin could be our selling point, because with no chemicals, everything normal and natural, Ayurveda has got a plus point to integrate into the mainstream medical treatment, and it has got some other additional benefit, which is that it is the whole mind body medicine working together. So I think that will be good. So Mamta, back, thank you so much. It was a very impressive and very good presentation. I think it has captured everything together in a very comprehensive way, and skin is the largest organ in the body. As I have been studying a lot part of dermatology over past like 10 years or so, because aesthetics and skin beauty is been drawing more of my interest over past few years, and I think it could be quite useful, because it's a very niche area, and I think we should work together on this. So I think any more highlights on that, a few more points before we invite. I think we got around 10 minutes to wrap up the session for the day. So any comments from you, Ish? Madan, you want to have a comment? Please do go ahead.
Yes, Mamta. Madan ji, you are muted. Please, can you unmute? Yeah.
So is there, did I miss anything? Could you see my slides throughout, or you said some connection problem? I don't know, even didn't thank you anyone.
We could see, Mamta, we could see your slides, and there was like a 30 seconds glitch, that's all. But we had all your idea, and it was a real time travel for me when she took us around Cleopatra and Mohando Zaro. So it was a real time travel. Padmini and Meera, you know, she knew them so well. What were they doing? How were they doing? Like she was very much there when they were doing it. So thank you very much. And she had this was your real practical experience. So that is, you surely did not treat your patients for teaching purpose. And this was, the beauty was, this was very natural, and this was like real, your raw and first-hand experience. So it was very valuable, and there are so many takers, as we can see. Professor Madanji supported your talk with so many, like 2 or 3 documents, Rajiv ji and Dr. Naveen Gupta. So skin surely is very relating specialty to all. And thank you very much for the valuable talk, Dr. Mamta.
Thank you so much. And also I'm like proud to say that I work in the place where I go in spa and salon. They think I'm like, maybe even the senior esthetician, she thinks I'm like 35. So I don't use any products from outside. I use my own skincare. So whatever the products I have made, I am the guinea pig. So I try everything on myself for 1 month. I give time to them trying this product for 1 month. So they feel that had a suggestion there. She thinks like my skin is like 35 years old. So I'm very happy to, I don't know if she lied or not, but yes.
Wonderful. Professor Madanji surely would like to add something to your value, Mamta.
Yeah, sure. Please.
Sir, you are muted again.
Hello, Madanji, please open your thing.
Madan, you need to unmute yourself. Here is the prompter. Unmute yourself. Thank you, over.
Thank you. Thank you. There was some problem with the muting. Thank you for this wonderful presentation. I particularly like one slide where you are talking about the Ayurvedic description of the different layers of the skin. And it's very special. The Ayurvedic classification of the different layers of the skin is very fascinating, because there is something there that might enrich the modern perspective of the skin. So there is that small area, there is a room for a lot of interaction between Ayurveda, Ayurvedic Twak, understanding of Twak, and modern dermatology. So that's something. The second, so we shouldn't underestimate that knowledge and how you are connecting the Panchabhut Siddhant to aspects of the skin, Tridosh Siddhant with different layers of the skin. There is something very, very deep there that language is not available for modern biology. So I think Ishji and yourself and all of us, I think I can see Shantalaji joining us from Latvia, and also Naveenji joining from London. Maybe we should all come together just to bring that one point and see how we can turn it into some interaction for the future. The other point that you mentioned about putting a child in a large amount of milk and the skin disappears. The milk is a very unusual material, because milk not only has, from the biology perspective, this is the genome biology perspective, milk not only is just the proteins and fats and all those other minerals, etc., but milk also contains microRNA, small RNA molecules. And these small RNA molecules are very powerful elements of reprogramming many aspects of human physiology. And the subtlety in Ayurveda, when we talk about the 8 kinds of milks, milk from 8 different animals. And then for us who go deep into the Ayurvedic perspective, we talk about Grishtashira. Grishtashira is milk that comes from a primoparous animal. So the animal that has had its first child. And the microRNA there is even more unique. So when you use very casually, you're saying the child was put in milk, but when we look at the biology of this from the modern perspective, there are many secrets there. So the Ayurvedic example can guide future biology. I think Antonio G will tell us a little more about these things from Milan when he joins us, about those perspectives of interfacing the so-called mystery areas of Ayurveda with the leading edge of contemporary biology and medical research. There are so many opportunities. So I stop there. Thank you for this wonderful presentation. We have enjoyed it so much. I've learned so much. It's been a delight. Thank you, Ji. And we look forward to your help for strengthening our position in New York. Ishji is doing a lot of work in Mauritius, and Rajiv Ji and colleagues are doing a lot of work here in UK. And we want that anchor in New York, and we look to you. Thank you.
Thank you. And I must thank Dr. Ish and Mr. Neil and Rajiv Gupta and everyone here for giving me a chance to share my knowledge, because otherwise what I was doing, it was just doing my own. When I do my facials, I don't use brushes. I use my hands, because I just try to do like my fingers, my Panch Mahabhut in my fingers, they connect with the skin of the client. So we have that connection. It's when I'm working on a client, it's just I am there for that client. I'm not thinking about my family or anything, what I ate, nothing about that. It's just the whole my connection. So the results I get, the relaxation, Sometimes people just say, we just want to relax, plus give me Ayurvedic facial. I just want to relax and get my beautiful skin glowing. So definitely Ayurveda is just, it's a deep, deep, deep well. And I think we cannot learn this in one lifetime. We need many, many lifetimes. And I really thanks Dr. Ish for he kept me pushing.
We
network problem maybe.
Okay, Rajiv, we've got a problem with the internet over there at Mumtaz, and let's go to Vaidya Naveen over here, who is very senior and quite experienced, and then we'll take a comment from Dr. Nutan, who's also a panelist. So,
yeah, comment.
Vaidya Naveen, you can unmute yourself.
We get Nutan. Thank you.
Yes.
Thank you very much. It's about to end, and we have 6 minutes left, and we have few speakers. So I would like just take 1 minute and say we were talking about Mauritius, we were talking about skin. So there is so much scope to do Sondriya Ayurveda concept. In fact, we already did it for so many years. And I myself was working as a chief physician in a college in Switzerland, where I used to live for 10 years. And we used to work with essential oil, one of the top teacher in the whole world. She's Lydia Busson. I used to work with her. And I have tremendous experience with the essential oil there, and even the hydrosols we were using for skincare. And it's not just about the skincare, it's in application in so many diseases. And I was the one who was trying to put all the facts and on the table to this all community, that in Ayurveda there is a Dasha Vidya Pariksha, 10-fold examination. In the 10-fold examination, there is one examination which is again 8-fold examination, that is called Sara Pariksha. And in the Sara Pariksha, we talk about 7 Dhatus Pariksha, plus we talk about Sattva Pariksha. And in the 7 Sara Pariksha, the first one is Rasa Sara Pariksha, which is Dhatu, but Ayurveda relates it to Tvak Sara Pariksha. So Tvak Sara Pariksha and Rasa Sara Pariksha is same. So that means that we have given so much importance to Rasa, the essence, and the skin is essence of the body and the essence of the health. And with these words, I would like to just pass on to other speakers who are waiting to deliver their keynote address. Thank you very much. Thank you.
Naveen, thank you very much. You've got a lot of experience. Stay around, because the next guest in Italy has got so much what he's actually hands-on experience with a business in Italy, with the knowledge in Italy, with the products in Italy. And after Diwali, I will be getting everybody together in person to person in London. Maybe invite some of you to Nisdan Temple, which is the biggest temple of the Europe, when I launched the Trafalgar Diwali with our committee, and say hi, hello to you guys. Because Naveen, you've got enough charisma in Ayurveda, and you've got enough knowledge. There are quite a few people who like you over here. So stay around, don't go. Madan will also chat with you. Nutan, you are a first timer here, and you've got a lot of experience. Meet Dr. Rajiv, who you've spoken to. Rajiv, one question from Nutan, and we go to Antonio Morandi in Italy in a moment.
Lovely jubilee, excitement, excitement, excitement. Ayurveda is the life, and we are going to hear how Ayurveda can be used even before life, before being born, and that is the Garbh Dharana. So I think Nutan actually has focused her attempt as a niche into that area, how to get this baby into the right position, right thinking, and right mind even before being born. So Nutan, please share what you do in a few minutes, and then we'll get Antonio. Thank you so much.
So first of all, namaste to each and everyone. I'm here and I'm thankful to everyone here for accommodating me as a newcomer in your community, and you have adopted me like just immediate, family like that. So I feel blessed. Sorry not to be present all the time because I was out. So not taking much time. Thank you, Dr. Rajiv Gupta, for introducing my work, that is Garbha Sanskar, which I am working in India. Almost now it's 5 years, last 5 years, more focus on this Garbha Sanskar. I have written book, The Ultimate Guide to Garbha Sanskar. It is available on Amazon, Flipkart, and everywhere. Physical copy I have. So I fortunately I met first time in London Dr. Naveen Kumar sir, and I have gifted him. So and I had some talk which and I'm meeting here some doctors personally also one to one. So I feel like Garbha Sanskar is the need of an hour because just now we have been faced pandemic where we know that immunity and how vaccine works. So when we try to work through Ayurvedic principle of Garbhadharana and then taking care of whole 9 months of that mother when baby is in the womb, I think that is the crucial time to work upon and build immune child. So mainly to produce immune child should be the goal. Then just Ayurveda obviously works for prevention and healing and everything. Once we are in this universe, but mainly when we try to reach to the root of the root, then we need to work upon that when life starts in the womb. Even before starting in the womb, when we do all this cleansing karma, means when parents or couple when started thinking of having child, so they need to have a lot of thought behind this. Proper thought plays an important role. They need to build their strong bond first. They need to work on their disease. If there are some hereditary diseases which may be there, so they need to get checkup done, and then they can identify how they can eliminate that factor, and then work upon the best one, so that they can bring the best version from them. Both of them coming together. So that's my focus area. Apart from that, yoga and Ayurveda both can be integrated. And obviously, we cannot forget contemporary science, modern science also, because modern science has a lot of technical help which can help in this thing. So I believe in both integration, like taking the today's science along with our Ayurveda and yoga together, and helping that couple for bringing the immune child in the world. So that's it. I would like to end my this 2 minutes talk. Thank you so much for giving this platform, Neil sir, Seema madam. That day also I have attended that cooking things on healing our earth. But and I'm listening, everyone. I'm listening. I'm looking at that your YouTube channel, and I'm trying to understand. Hey, so much work is going on. I'm glad.
So, Nutan, thank you very much. And say hello to Madan here, because it was his friend, Rajan Patankar, who actually introduced you to me. And Madan has got so many friends around the world, so they come on my WhatsApp. And once you know that it's come from Madan or Rajiv or Ish, then there is no due diligence, because they know the standard that I look for. So say hello to Madan, who you met, but say hello online, and we will move on to Antonio.
Yes, that is where I'm going to come over that. So Dr. Madan sir and mainly Dr. Rajan Patankar, who introduced the gem of all this European Ayurvedic community. So I'm really blessed. I'm feeling blessed being here among your community. Thank you to each and every. Namaste, sir.
Well, Rajiv, we move on from London, from Hong Kong, from Mauritius. We now go to Italy, to a smiling personality who has got so much knowledge, and it's an alternative view we are going to hear. So introduce him, please.
Thank you so much. I think we are moving to even more sunny Italy, because I think we are getting more and more sunny in UK, but I was talking to Antonio, it is far more sunny, far more warm. So let's give a warm welcome to Antonio, who is a scientific director of the ICAM and chairman. He is a medical doctor, and he has been doing like scientific work and has been introduced to Ayurveda in 1994. He specialized in neurology, but he has joined Ayurveda in whole world as a focus approach in this era of life. He is an award holder and honorary doctorate an Ayurveda Acharya. Ayurveda Acharya. I think that is very exciting. So the biggest benefit and the exciting thing for me, he has done work on integrating the conventional medicine with Ayurveda, which is one of our main focus. And he is going to talk about it, he's going to share his views. For people who don't know much more about him, he's a WHO consultant and he worked for benchmarking the practices, training in Ayurveda, terminology of the Ayurveda. And I think it is such an interesting thing that he has introduced a course, Introduction to Ayurveda. And one day we may all go into Milan in Italy to really have a faculty or a retreat into the Ayurveda. He's a board medical doctor, and I think I'm so delighted that he is with me on this page of integrating the medicine and different branches of medicine. So I think let's hear from him, bridging the conventional medical system with Ayurveda. Welcome, Antonio.
Thank you, Rajiv. Can you hear me well?
We can hear you very, very well.
Okay, yes. And hello to everyone. Hello to Madan. Is present everywhere, Madan. We have a long-standing friendship with Madan, so I take the freedom to make some joke with him.
He's a great guy. A great guy.
Yeah, yeah. And yes, my passion besides Ayurveda has always been the way of being understood by my colleague. Because the problem is that if we want to diffuse Ayurveda, if we want to diffuse at the high level Ayurveda in the medical and scientific world in the West, we have to let them, I speak of them, to understand what we are speaking about. And so I think that it's very important to address the epistemological problems that there are between Ayurveda and modern medicine. That is not only of Ayurveda, but also of all traditional medicine. I will speak about Ayurveda, but I think that what I will say about Ayurveda can be used for any other traditional medicine, traditional Chinese medicine, Tibetan medicine, whatever. Can I share the screen? Yes, here it is.
Yes, you please share your screen. Yeah, we can see it. Perfect.
Can you see my screen now?
Yeah, we can see your screen. Perfect.
Okay. So, and in fact, the title is Bridging Conventional Medical System and Ayurveda, because we will see that, in my opinion, integration is not the right word. Because we have to be very careful, because we are all speaking in English, which is, at least is not my language, but I think is not the mother language of many of the people of this session. We are speaking we are using a language which is, a language which is a mean of communication. But for this, we have to be very careful about. So, the epistemology of Ayurveda, yoga also, and modern medicine are very different. But because we have to understand the conceptual framework in which nature, science are interpreted depends on historical, cultural, social, and economic factors. But nature is one. There are not many nature. Nature is one. And there are a lot of different viewpoints. So if we have a complete, or at least if we want to attempt to have a more complete picture, we have to have a collaboration of multiple perspectives. We cannot only see things from one side. If we analyze a little bit the different knowledge system between the modern and the traditional and Ayurveda and yoga, we will see that, for example, modern is experimental, while the traditional is experiential. The modern is based on the analysis, while the traditional system is based on synthesis. The modern is based on objects, you know, giving the name to the objects, while the traditional and the Ayurveda is based on relationship. It's focused outside the modern knowledge system, while the traditional is focused inside. The modern tend to a standardization, while the tradition is dynamic. It depends. The modern since is static, while the traditional is based on transformation. And the modern is, the knowledge system is based on the shape. As I was saying, it's based on object, that, and from the object, they derive the function, while the traditional is start from the function, and then is the function that gives the shape to the objects. So we see that these two systems of knowledge are different. They are two different perspectives. Like, you know, the darshana, they are different. They see the different point of views. And if we want to integrate them in the way the integration is understood in the modern system, that means a melting of the two different points of view, there will be a loss of identity of one or both the system. I was speaking about the language. Language is, if you look at the dictionary, Oxford Dictionary, integration has two meanings. One meaning is two items, two people, two groups that work at the same level for the same object, for the same aim, for the same target. And this is what we mean for integration. But there is another meaning, which is the two objects that melt for getting to the same result. And this is the way modern medicine intends integration. And we have to be very careful, because this integration is not the integration that is good for Ayurveda. So we have to find a way of interfacing these two systems, because the secret will be the interfacing, not the integration. Because proper dialogue and communication between Ayurveda and modern biomedicine is absolutely needed, because we have to solve confusion. Because if we are able to do this, then we will introduce a paradigm shift in the vision of medicine and science. And in this way, we will have Ayurveda available for everyone and everywhere. So if we examine the two different systems of knowledge, we can make some interesting consideration for this kind of interfacing. And this interfacing is a collaboration, is not an integration, because we have to arrive to a synergistic therapeutic strategy that, you know, exploit in equal way the strength of both systems, which are the ability of Ayurveda, inclusive and systemic observation, and the analytical and technological ability of modern medicine. If we are able to put these two things together, we will get a fantastic result. I think that Ayurveda is the source of a lot of knowledge, of all knowledge actually. And if we take inspiration from Ayurveda and from Loka Purusha Samya, that means the problem solving through the observation of nature, we can, I think that we can find a solution to this problem. And this problem, for example, nature solve this problem to put together two different systems, for example, with the gap junction. Gap junction in nature are the way in which two cells, they interact together and they transmit information one to each other without losing their identity. So we can take inspiration from what we observe in nature. Ayurveda teaches us that we have to observe nature to find solution to our problem, because all the solution to all the questions and all the solutions are in the nature and in observing nature. So if we take this gap junction concept and we put the Ayurveda and Vedic science from one side and modern medicine and modern science in another side, and we put them in contact, we can see that there are some points of contact between these two words. And these points of contacts are the commonalities, things that these 2 points of view share. And through the observation of these commonalities, we can find new paradigm for exploiting the two systems in such a way that we can get higher results of a higher level. So we have to translate and localize Ayurveda. And for translate, I don't mean only the translation of the terms, but the translation of the concept, and not integrate Ayurveda. We have to find correspondences and commonalities between the knowledge system. And for this, we can create models for mutual understanding between Ayurveda and modern science. Basing on this, a few years ago, we have developed a new concept, which we have published and which we have used in many works, of collaborative medicine and science. This new concept, COMS in brevity, is based essentially on 3 moments. We can apply this concept of COMS to all the traditional medicine. And these moments are the reformulation of Ayurveda epistemology in such a way that is understood in modern terms, not that is bent to modern terms, but to be understood in modern terms. The second is modeling of Ayurveda, and the third moment is the localization of Ayurveda. Now I will briefly go, making an example on each of these. The reformulation of Ayurveda epistemology is the one that I like more, the one that I am more, interested in, but also because of my nature. I think that one of the points where we can start is that modern medicine is based on chemistry, while Ayurveda is based on physics, and chemistry is based on physics. So this means that Ayurveda has a more inclusive view than modern medicine, which is based on chemistry. And so I think that we can find a dictionary for the communication between the two systems through physics. And this is not only for Ayurveda. It's like 2 different levels. When one is chemistry and another is physics. Ayurveda, modern medicine. The world based on chemistry is a world where the reality is made out of objects, of molecules that interact with the receptors. Instead, the physics is the world of relationship, how the interaction happens between events. So it is really like 2 different levels. They are not, they are not wrong. One and the other is correct. It's like to see one side and the other side. And in the other side, there is the explanation of the one side. In Ayurveda, in traditional system of knowledge, we find the explanation of the observation of modern medicine and science. One of these evidence we can find in Samkhya. In Samkhya, for example, we have one of the first commonalities with modern science that we can find. We have the Purusha Prakriti interaction that in some way is a breaking of symmetry. And this breaking of symmetry is the same breaking of symmetry that give rise to the string of the string theory. And this breaking of symmetry give rise to 3 phases. A phase of movement, a phase of resistance to the movement, and a phase of balance, which are called Raja, Sattva, and Tamas. But if we plot Raja, Sattva, and Tamas, we find nothing more than an oscillation, that means a vibration. And that is, very similar to the primordial vibration of the string theory, which has nothing else than the Om from the Vedic point of view. And the combination and permutation of these vibrations give rise to the whole reality. like, the string theory is telling us. All the reality that is formed by a combination of different kind of vibration that give rise to different properties of this vibration, that at a certain level of dimension, they appear as particles. So this is one of the first commonalities we can find. Some string theories, Pancha Mahabhuta particles matter, and both of them are properties. And how we can perceive these properties? According to Ayurveda, we can perceive these properties with our senses, of course. Not only according to Ayurveda, but we have our senses. And this, vibration, the combination and permutation of this vibration give rise to the Pancha Mahabhuta. And we know that the Indriya are made in such a way that each Indriya is made for perceiving one Pancha Mahabhuta. And the moment of this perception is guna. That guna, one of the translation of guna is guna is normally translated as quality, but the real meaning is a rope. So it's something that is connecting two things. And in fact, guna is what connects the Indriya with Bhuta. It's the way of perceiving realities. But this is the main concept of all Ayurveda. How can we make this concept understood to modern science? Because modern science, as we have seen, is based on objects, on quality, not on qualities. It's based on quantity, on object to be perceived. We can understand guna in this way, thinking about the Bhuta and the Indriya has, ensemble of different kind of permutation of vibration as a phase interference. So we can think that perception, we can think as a perception as phase interference. We have a constructive phase interference with, similar Bhuta and Indriya, and then we have the perception. If we don't have this, we have a destructive phase interference, and we don't have the perception. So we cannot hear with our eyes, for example, or we cannot see with our ears. If we want to try to understand the guna concept from a modern point of view, we have to disassemble the guna. And we have to think that, for example, modern reality, modern physics, determine the event based on motion, cohesion, and transformation. And these three moments are very important because from the combination of motion and cohesion, we have other action which are consistency and density, and the temperature and time from motion and transformation. And from cohesion and transformation, we have the shape and structure. These are nothing else, the data that are contained in the concept of guna. So is the simultaneous, guna is the simultaneous knowledge and contextualization of data and information in their dynamic cause-effect relationship. So this is one possibility to translate guna, the concept of guna, in modern science, in modern medicine. And this could be very, very useful. And I will make you an example now, just to share, to tell you how useful it can be. This comes from when I was working in the United States. I was working many years in the United States in neuroscience, especially on neurodegenerative diseases. And we'll make you the example of Alzheimer's disease. This is half of it is a healthy brain, and another one is an advanced Alzheimer's brain. As you can see, there are different morphology. From an Ayurvedic point of view, the healthy brain is Nigdas Lakshmi Maridu Guru, that is, a kapha appearance, while the advanced Alzheimer's is Ruksha Kara Katina Lahu, which is Avata, which is the difference between, from a morphological point of view. And if we look at this morphology and we take the guna of this morphology, the beautiful thing is that we find the same guna, for example, at the clinical level. The clinical symptopathology of the Alzheimer patients are based with the same guna. And in fact, we have a memory loss, problem with the language, difficulty in performing familiar tasks, and so on and so forth, which are all the alteration of the values. And they are all alteration. If you look at the guna, you see that there are all alteration of the guna, which are referred to this to the value. So the alteration of the value is reflecting the loss of structural compactness and coherence that we observe already in the morphology. But the beautiful thing is that we can find the same things also at the microscopic level. We have the B is a normal brain and the A is an Alzheimer brain, where we can find neurofibrillary tangles and amyloid plaques. The amyloid plaques are, bunch of material, which is dysfunctional material and amorphic material, which block, interrupt the network of the neurites and cause a retrograde death, causing the neurofibrillary tangles inside the neurons. So you see that there is an alteration of the structure where you can find the same alteration that you can find at the level of big morphology and the gross morphology, and also at the clinical level, if you observe with the logic of guna. And with the logic of guna, if you see a healthy neuron, for example, the healthy neuron, which is different from the brain, because the brain we have seen that is a lot of kappa, but the kappa is needed to contain the neurons, because the neurons are, from a morphological point of view, Laku, Shankara, but from a functional point of view, they are Sukshma, Tikshna, and Vishada, which is, this pitta, which is very high pitta, which is very high agni, which is coherent with the high activity of the neurons, and this is why they are immersed in the kappa substance of the brain to balance the heat. So we have that the activity of the neurons is based on Sukshma, Tikshna, and Vishada, and the morphology in Vayu and Laku, Shankara. If you look again at the microscopic morphology, we can see that there is an increase in the in the disruption. There is an increase in Vata. Vata that becomes from a quality becomes a dysfunction, because there is an increase in Laku, Shankara, which are the basic morphological tracts of the neurons. But when they increase, they become a damage, they become a problem. And this corresponds to a decrease in Sukshma, Tikshna, and Vishada. In fact, we can see that the neurofibrillary tangles, the amyloid plaques, they decrease this quality, this guna. And instead, they give rise to Pichila, Manda, and Stula, which are, again, the guna that we can find also on the clinical side. And this happens also at the electron microscopic level. You can see here, for example, the tangles that are forming, which there is a structure which is conserved, and it is not conserved, is disrupting, the structure is disrupting, while in the healthy area, there is this structure. So there is a lot of structure, a loss of structure, a loss of coherence in Alzheimer. So, and this is an increase of Vata. But increase of Vata, we know that in some way is correspondent, as we have seen, a decrease of kappa, which are mainly in the brain lipids. And this observation that I made when I was in the United States is very important, because when I was in the United States, I was pointing the attention to the fact that the Alzheimer patient had always some kind of membrane problems. And in fact, if you think about the amyloid plaque, they are made out of a transmembrane protein, which is cleaved at the wrong level, because there is a decrease in thickness of the lipid membrane, and the cleavage of this transmembrane protein happen in an hydrophobic level. And so there is this piece of protein which is hydrophobic, and it goes outside, and then is assembled in the plaques, which are the root cause of the Alzheimer's disease. If when I was in the United States, I would have the knowledge of Ayurveda, I could have predicted such a mechanism. A mechanism that has been in the last year, in some ways, found out by medicine. There are a lot of discoveries about the alteration of membrane in Alzheimer's brain, but not only in Alzheimer's brain, but in the whole person that has an Alzheimer. Giving evidence to the decrease of kappa and to the increase of vata guna. If the modern science would have the understanding of guna in this situation, would have arrived to the same conclusion many years before. And of course, with this knowledge, we can have better therapy. Let's go to the modeling of Ayurveda, to create models. To create models to overcome communication gaps to the diverse knowledge system. We have to create models. Models are things that speaks without words, but describe and formalize in logical and objective way the Ayurvedic principle used to interpret reality. And in a model, we can have simulation, visualization, manipulation, gain of intuition about the entity, process, or phenomenon being represented. Modeling is very, very important because it can enhance individual understanding, can facilitate transfer of system details between individuals, can allow the individuation of system specification and create a reference point for future usage and collaboration. Let's make another example here just for modeling, a very brief one, because I could speak for a lot of time about the modeling of Ayurveda. If we think about the fact that a coherent ensemble of guna are grouped in conceptual items called dosha, and that coherent ensemble of dosha are grouped in functional items which are called dhatu, and that the coherence of dhatu results in ojas, as Charaka says also in the Sutrasthana, we can understand that the health and maintaining of the system, and so the ojas, is to maintain the system coherence. So we can see where the modern science look at the concept of coherence and the way and what kind of logic use to understand the coherence. And this is the complex system. So we can see the logic of complex system, and we can use the adaptive complex system logic in order to understand and to explain the way reality and Ayurveda are working. The complex system are this system. This is a flock of birds. It's a beautiful that it works and it acts like a whole organism, but it's made out of thousands of single birds which are flying. They think in an individual way, but they are flying in a coherent way according to the whole system. And you see the predator here that enter, and the flock behaves in such a way to let the predator pass, and the flock regain the shape that is connected with the health of the whole system, because it's the flock that allow to the birds to find temperature, insects, and whatever to maintain the whole system, the whole birds alive. And so the health of the system is linked to the coherence of the system and to the resilience of the system. So the capacity of the system to regain and to react to the variation of the environment. And this, for example, this is just a schematic. I think this is just a schematic situation on how it can work. You see that the flock of birds, separate and then enter again and regain again their own logic. Can you still see me?
We can see you.
Okay.
So I think that's
okay. I'm almost at the end. So we have that that higher complexity correspond to higher adaptability, and these correspond to higher health, and so higher ojas. Ojas, you remember ojas, the word ojas means luster, means shine, means that it's something that you cannot allow anything to enter, but that reflects. And while lower complexity corresponds to lower adaptability, lower health, and lower ojas. So this loss of complexity and simplification of physiological pathway represent typical features of many diseases, as well as of the aging process. And we know this, and modern medicine knows this very well. And the whole Ayurveda, and the whole treatment, the whole therapy of Ayurveda is for maintaining the organism to a higher complexity. To higher complexity. We explain. We examined this concept a few years ago in a book that we published with Professor Narayana Nambi for the spring, in which we were examining how this concept of complexity and adaptability is at the root of the possibility of find a connection between modern medicine and Ayurveda about the concept of health. Adaptation is the meaning of nature. Health is optimal adaptation. We can find these information also in Ayurveda. Of course, this beautiful shloka of Sushruta, as the moon, the sun, and air support the cosmos with releasing, receiving, and dispersing. Likewise, Kapha, Pitta, and Vata support the body. And this is fantastic because this is exactly the manifestation of resilience and of health at the cosmic level that we can find again in our level. The last point is localization of Ayurveda. Ayurveda must be available to everyone and everywhere. So we have to be able to transport and apply Ayurvedic principle locally. And this means that we cannot pass Ayurveda as it is. There is a whole story, from at the end of the Second World War. Americans were very much surprised because there was a big economic boom in Italy. And so they were, people were buying refrigerators, were buying a washing machine, were buying everything everything was American, but they were buying everything but not cars. And so they were surprised why, Italians are not buying cars. They have money. Well, they do not spend money for cars. They spend money for everything else, but not for cars. They realized when they arrived in Italy, the people from General Motors, they arrived in Italy and saw that the American cars were too big to enter in the streets of Italian cities. So we cannot bring, but we have the things as they are from one culture to another. But we have to maintain the engine, the tradition. This means the tradition the same, but it has to be applied to the local environment. It's like, these computers, we have the Microsoft Office, for example. We have Microsoft Office that the engine is the same. And then we have the localization of Microsoft Office that is different in different country with different, keyboards, letters, and other things. So we have to do this. We have to be able to localize Ayurveda. For example, in Italy, we have Rasayana, which are not known in India. And in India, there are Rasayanas, which are not known in Italy. Those Rasayanas which are good in India because there is an ecosystem which is good for them. Our Rasayana or products are good for our ecosystem. There are differences also between North India and South India. You know this very well. So we have to generalize Ayurvedic principle for doing this, and for doing this, we need very much the translation, the point one, the translation and the reformulation of Ayurvedic principle. We have to have an Ayurvedic interpretation of local parameters. We have to understand the Ayurvedic value of Parmigiano Reggiano. We have to understand the Ayurvedic value of wine. We have to understand Ayurvedic value of other things that we have here, and we have here from millennia, which are good for us. Even if they are in Ayurveda, they said that are not good, but because there is a different ecosystem, and our genetic background, our microbiome is different, and so we have to make an Ayurvedic interpretation of local parameters. And then we have to tell to the people what they can do with Ayurveda, rather what Ayurveda does. So we have to render something practical, something real to the people of what Ayurveda can do for them. Not just in general of what Ayurveda does. And this, I think, is the most important point. I conclude with the fact that we have found so far in this brief lecture several commonalities between modern science and Vedic science in Ayurveda. We have found string theory, in some kind of other darshana, breaking of symmetry, Purusha Prakriti interaction, primordial vibration, Raja Sattva Tamas Om, matter reality, Pancha Mahabhuta, reality, perception, phase interference, guna, coherent system, system resilience, ojas. So this is the way I think we should go on for finding a new paradigm that will allow to discover a new science in the future. Ayurveda is timeless. Ayurveda gives us a spectacle to see nature through the eyes of nature. Ayurveda is based on physics because it's inclusive, like Ayurveda. Physics and Ayurveda are inclusive. But for its inclusive nature, Ayurveda can explain modern medicine, while modern medicine, being exclusive, cannot explain Ayurveda. This is something that is very important. I mean, without offense for modern medicine, but modern medicine cannot explain Ayurveda. We have to help modern medicine to understand Ayurveda. We have to help modern medicine to become more inclusive to understand Ayurveda. Ayurveda and modern medicine can be interfaced but through physics, because physics is the way that we can use to make this kind of ampliation of modern medicine. In fact, Ayurveda can be of great help in directing the observation of modern medicine and science. It can lead in this way to a deeper understanding of pathophysiology and support possible alternative or complementary therapeutical strategy. And finally, the implementation of Ayurveda in modern science will lead to a paradigm shift and to a higher level of consciousness for the benefit of all mankind. And with this, I finish. Thank you very much.
I think that was amazing. It was fantastic to hear all the fantastic commonalities that you brought together. And it is really a hard job until you understand both sides to see that there are commonalities, because majority of people are one side or the other, and they commonly criticize one or the other, and that's something which has been going not for 5-10 years, that has been going for like hundreds of years. And the real life is that I don't want to criticize one or the other and one is better than the other.
No,
because both are good in their own way. If you have heart attack, you wouldn't be taking some herbal medicine or this. So each one has a place. I'm very, very clear about it, and that is the whole purpose why we are trying to bring it together in form of the integration. And just a word on that. Integration, according to the dictionary, if you look in Cambridge dictionary or that, integration is for bringing two together. A European integration does not mean Italy will disappear and France will disappear. You are integrating the economy of the country, so it's called EU integration. Same is calculus is integration of mathematics and physics. That does not mean that mathematics will disappear or physics will disappear. They will still exist. It's
but you know the biomedicine, and then sometimes the power of our colleagues that they use integration another way. They use integration in another way. It's a very dangerous term, in my opinion.
No, I think that is the reason that people misinterpret, and that's completely very, very different. So I think the whole idea is bringing the good things for everything together, which is what you talked about. Bringing what is good in Ayurveda, what is good in modern medicine together, what is good in homeopathy also there, because that's another science. There's something good in refluxology, there's something good in Ayurveda, something good in Tai Chi, something good in acupuncture. Why not? Acupuncture is an ancient science from Chinese, thousands and thousands, and there's something good from there. Why can we bring it together? And one of my colleague medical doctor, she's a diabetologist, she is working on acupuncture to bring it together. how they can reduce the neuropathy. And that is amazing work. Why don't we do it? And this is the whole purpose. And I think what you have talked today in a deep scientific way was amazing. I've not heard that deep science before. I think the way you have talked about Jala with Jiva, Tejas with Chari, Vayu with Trace, is Akash with Srota. It just goes. And how does it need, and gunas, bringing with motion, with the cohesion and the transformation, is just something which is extremely deep. And I think it's very good that we bring it together, and you would be a big asset to our force of bringing it together. And with that point in mind, we have had a plan to have different groups working together to bring the scientific and evidence-based approach, because we don't want to be quacks saying I have treated 2 patients here, 3 patients there, 5 patients there. No, anybody can do it. It's how good the scientific evidence is and how we can actually bring together. So it will be good to have a group working together on bringing all the evidence base for this, so that we can go to the health authorities and tell them, look, this is the benefit, this is the value of it, this is the evidence base, and therefore they can use. I don't know if you know, in the health system, the NHS, everything is free to the point of care of delivery, and you can't just go and have your health care from a person unless you want to pay for it, and people are very scared of paying because it's free. So we need to work in a very systematic and very conscious and in a politically pleasant way, so that we do not disrupt the pathways, we do not annoy or make people unhappy, but in a pleasant way bring where things can work together, and then make it more and more large to the extent that people can see the benefit even without us saying it. It becomes so robust and so transparent. So I think what we have done today is wonderful, and I think we have got more wisdom from Madanji, from Ish, and many other people like Naveenji. So I think both of you, Madan and Ish, I would like to have your views, and then hopefully we got another 10 minutes, so that whole day has gone amazingly. So Ish.
Yeah, thank you very much, Dr. Rajivji and Dr. Antinu. This was really enlightening. And you very rightly put across through the example of Alzheimer's, like how we see the rarefication of the brain tissues. So we can really find like Prakriti Purush Samya, or if we compare modern medicine with the Ayurveda medicine, so many similarities can be traced down. And surely Ayurveda coming much earlier, there was some very divine wisdom which existed like 10,000 years back, when there were no microscopes, when there was nothing. And how finally they could relate to, for example, if we take bronchial asthma, they have spoken that this comes from Vata Kapha, and Vata Kapha lead to nodule formation. For example, all the cancers are Vata Kapha predominant, because Vata Kapha, when they merge, they solidify. When a bronchial asthma patient is coughing, then he is coughing out like Kurtzman spirals and Ashkoff nodules, which are Vata Kapha solidification. So really, any modern parameter, it could be like cholesterol, it could be blood sugar, any metabolite, any inclusion bodies in the cell, as you rightly told, like fibers in the nervous tissues. So any inclusion body can directly be correlated to some kind of like Agni Mandya, or accumulation of some ama. Ama can be in maybe gaseous form like blood pressure. It can be in liquid form like many toxins. It can be in solid form like cancers. So there is so much to correlate, and that is what can bring us to commonalities. That is what where we both can be on the same page and that will be faster to move ahead. Maybe Madanji will surely be elucidating in a much better manner. So over to you, sir.
You can unmute, Madanji.
Yeah, I'm muting.
Antonio, thank you very much. You know, I missed your recent presentation at NIMHANS in Bangalore. I think it's a good opportunity just to see this. NIMHANS is the National Institute for Mental Health and something else.
Neuroscience.
And neuroscience in Bangalore. It's one of the leading. It's one of India's leading institutions for neuroscience, and Antonio presented there last week. I couldn't attend. Now, our connection with Antonio goes back a long time. It goes back to 2008 when we started our early interactions. In 2009 was when I had an opportunity to meet with Antonio, and this is a distillation of that event where we were together. And this is, Antonio, this is more important for our platform here in terms of global health and One Health and, One Health agenda. 2009, Antonio organized a very, very amazing meeting. It was titled The Meaning of Life Awareness, Environment and Health. And this was in March 2009. And we had several people with us. Particularly important was Brian Josephson there, who's talking, the professor of physics here, and of the Josephson Junction fame. And he said that in his lecture, he touched on the Eastern philosophy and Western science, which Antonio has elaborated so nicely. And then Brian Josephson went on to say that reality is too complex to be reduced to a formula in general. And this is where Antonio has taken us forward. He's taken us further into that story, using his curiosity to understand Ayurveda and the Ayurvedic terms, etc. And that thinking there, in that second slide of yours, you took us very deep into these principles, Antonio. You presented this concept of a synapse, and you said two things come together. And I look at it slightly differently. I look at it as saying that 2009 meeting where you gave us that entirety, and within that entirety are embedded different aspects. So it's like a cell having taken a mitochondria inside. See? That is where modern biology, modern medicine, modern physics sits in there. It sits in an entirety. And that vision was given to us in Advaita Vedanta by Adi Shankara. Adi Shankara's Advaita Vedanta is all about that one entirety. Within that, we have different systems. And I also take the point that there are details that would have been better understood in modern biology if they approach it from concepts of gunas. And I think this is one area where we need a lot of discussions, the Vimshati gunas, the 20 opposites, the 10 pairs of opposites, and how they change the workings of the human body. Even a single cell, or the rheology of blood, for instance, as that early trigger for disease. As Ishji says, there are certain conditions where simple aspects, you just need to change the pH just a little bit, and that is enough to bring back one guna that is going out of control. And I think those simple examples are the ones that we should pick up and present to modern biologists. From University of Perugia, there was a recent study on looking at the microbiome, the nasal microbiome in COVID patients. And what they find is that a large number of COVID patients have a dysbiosis here, the nasal microbiome. And the hypothalamus just sits just below the nasal cavity there. And if you have any inflammation in the hypothalamus, it upsets the entire HPA axis and you've got problems. And the whole immune system is compromised and so on. So the language is there in Ayurveda. And the treatment, when I looked at this study from Perugia and I look at it and I say, oh my God, they are changing with Nasya, Anutailam or something, a very simple intervention. They're changing
with ghee. You remember the Indian government advised to put ghee.
Yeah, put ghee, exactly. Put ghee, Anutailam or whatever, that you use, just to change the guna of that interface. And just by shifting that, you can change the entire coherence of the system. You use that wonderful word, coherence of the system, coherence is disrupted. So you have given us a very detailed and a very deep perspective how to bring that language. My only difference, Antonio, I mean, we've discussed this at length at many places, is that the darshanas, the Shad darshanas or the 9 darshanas, they describe reality, which you've touched on nicely, but that reality can contain modern biology, modern medicine. But temporarily, your representation is correct. You're saying, bring the two systems together and form those bridges, those synapses between these two. And we've heard from our earlier speakers about skin as a way. Skin is that interface between where we are and how we can enable major changes, systemic changes. You know, Vata sits on the skin. How with simple abhyanga or massage in the opposite direction, you know, Udvartana versus abhyanga. You just change the direction. One uses a dry treatment versus oily treatment. How you can actually bring about incredible physiological changes. Maybe that is a dialogue we can have where we can bring contemporary medicine people. You can see up here, I keep talking about this ongoing interaction with our colleagues in Toronto, with the university health networks in Toronto. We have put all the hospitals of Toronto together, and we are looking at these areas of work. And maybe Mauritius, maybe Africa, maybe Europe, maybe Italy can all, and UK certainly, can all come together under your leadership, where we can look at those practical, immediately tangible outcomes, you see. And I think...
Madan, very nicely put there. So we move to the next section where I'm interested. We have lots of experts in different countries, lots of specialists in different countries. For several years, and in fact several decades, they're trying to bring it together. If we agree that Ayurveda in Europe, in Italy, UK and Germany, doctors can now study Ayurveda medicine within the framework of postgraduate medical education, which is recognized by medical councils and the universities. Now, bearing this in mind, Antonio, you are there. Shall we agree right now on this forum that before next March, we all meet in London, particularly from the Italy, Germany, and UK experts in London, and we form what is the whole point of Healing Our Earth together, and we create a document, a working document that we can use for the correct media, and we bring them, and the parliamentarians. Now, Italy Parliament is quite good. It started now doing outreaches with even ethnic organizations, so particularly Indian, which are the sponsors of, through the Ayush Ministry, Ayurveda and everything. And India, which has started with the first wellness and well-being officially recognized center in Jamnagar, together, knowing that India actually vociferously markets Ayurveda very seriously right now, let us all unite together to go to the next step and speed up within 3 years what we've been trying for the last 30 years. Now is the right opportunity, because we are all able to come on meetings like Meet, Zoom faster, but we go person-to-person meeting in London. One of the biggest temples will maybe sponsor us a dinner and host it, so the value will be very good. We actually bring the people who make the decisions, who are there, education authority, parliamentarians, and the media, which are very important for us, who can actually bootstrap us and leverage us to the next solution. So Antonio, the way you presented today was exactly, without knowing much about you, when I was talking about you before you came on, it was an alternative view. So it was very exciting to watch. And which country are you from? Italy. What does Italy do? Italy recognizes this through the university as well. So Rajiv, what are your thoughts? Let's go. Rajiv, your thoughts for a minute. We go to Madan, then we go to Ish, because Ish will be, he's linked with the Ayush Ministry, so it'll be very good to get this thing rolling faster.
I'm very excited. It has been a fantastic day, and I think we have got a galaxy of speakers, and particularly this topic, as you know, for years I've been working on it, is so close to my heart. Bringing the things together, getting the things better together. So, as you have touched, we should do that. I think we have got enough time, we have got enough people now within our group so that we can meet together, do that thinking together how we can, as you mentioned, bring whether there is possibility of bringing into the curriculum, because if it is possible, why not we do it? And we have got evidence base that it is beneficial for both sides, so why don't we do that? That's one part. And as you mentioned, we can just organize that in London in the forthcoming time. And the beauty would be that it will be scientific people along with the media and people who are influencer, and I think we should not forget politicians as well, because it will be in their view as well. So we should have selected lobbied politicians into it to bring it together. So that's good. And second part is to bring it for the public as well, because public engagement is necessary. Public has been supporting us so far through these seminars, and I get so many messages every day about when actually is going to happen. So I think let's work on both fronts. So thank you very much for the whole team. I would just believe entire day has gone just like a dream. I cannot believe we started 2 o'clock and it's 8 o'clock. We are still going with full energy. There is no like sucking, nothing like that. We are tired. We are not tired. We are more fired than in morning. We want to make it happen. Thank you very much, everybody.
And Rajiv, at this point, on behalf of Healing Our Earth, the whole team, I would personally like to thank you and Ish for helping produce this episode over here. Tireless energy. You've been there before 2 o'clock. You're here going to be here after 8 o'clock. And as you said, we are more charged up as longer we go. Madan, your view on getting Germany, Italy, and London first, UK, because we'll go to Latvia, Serbia. I don't know whether you are aware of it or not. Those 5 countries are also into regulated Ayurveda, and Sweden might turn as a first country, maybe complete Ayurveda. So I think we go in a systematic way. People like Lord Ranger, who from House of Lords can maybe prepare and help us put up a document. He's actually part of Healing Our Earth. Lord Poppet is part of Healing Our Earth. These are all connected to us. Important thing today, exciting big, Rajiv and Madan is bringing Antonio on board. Because Antonio's website, if you visited, has actually got exciting facets to it. He has got the indigenous Italians on board, and he has got Indians. Plus, he has got also retreats that is being planned. He has got a nice view in a YouTube where he actually shows a sample room and the facilities as well. So you see, Antonio has actually got a hands-on approach from an Italian person loving the Indian background and merging into a business, education, and on-ground facility. So that's exciting. Ish, on the other hand, has actually mastered, even by bringing Shantanala, a counterpart in Latvia, and by the way, Latvia, Serbia, and those 5 countries, they are actually in a regulated zone, which is very beautiful for us. We must move on that before the March 2023, in London, we do a weekend festival of just thrashing what we call like a white pepper. And Madan, you will be very good because you'll point us to the right research which will be there. Antonio, you will be very good in bringing your perception. And Rajiv and Ish are already working on it. We don't need to go outside. Yes, there are more experts than us all pulled together, but they are experts only for themselves. That's not good. We want to be experts for the people, by the people, of the people, and towards the people. Ish, what are your comments?
Yeah, really wonderful. And maybe if I can update you regarding one more significant development in Mauritius. Like as you all know, Ayush has got 5 major streams, out of which 3 were already approved in Mauritius. That is Ayurveda, homeopathy, and yoga. And Siddha and Unani were not approved over here, and we were trying that all the Ayush spectrum should complete. Now, last week, the Parliament has approved Siddha and Unani as well. Now, out of India, Mauritius is the only country where all the 5 are approved. All the 5 from Ayush are approved healthcare systems now. And I had a meeting with the Ministry of Education experts, where the submissions I rendered to them for the primary school curricula, all of them have been accepted for the textbooks. I have forwarded the document to Dr. Rajiv Gupta, which can be circulated on this platform as well. I was specifically asked by the minister to submit 5 simplest points in black and white for each grade, grade 1 to grade 6. Those should be very simple points. And so I tried to simplify, support with the evidences, and submit it to the ministry. And all of them have been accepted. So these 2 have been really like nice developments, which would be rooting Ayurveda deeper into like children when they are younger, like from the age 5 to 12, they'll be coming to know about Ayurveda, which they can carry forward all through their life. And Ayush, all the Ayush system will be having like more say in the government sector, in the public health in Mauritius. And Mauritius, as Madanji rightly put, can be a real launch pad for like 55 African countries. So we are looking forward to like foray into African continent. And I'm requesting the Ministry of Ayush that I should be permitted to reach out to more and more African nations, and let's spread Ayush there as well.
So, Ish, you are a very instrument part of this expansion. And you mentioned, because you're Indian Ocean and Africa is within part of that, immediately, let's put you in touch with Minaben in Kenya and Sanjay in Uganda. If we start with those 2 countries, which will be faster.
Wonderful.
Then we move to Tanzania, Malawi, because you know Healing Our Earth is connected everywhere. And me personally, I'm connected with people. Let's concurrently get going. Shall we agree here right now? And Madan, you'll be very good at your time for it. Let's create a simple board over here. First of all, this tri-country, I just mentioned Italy, Germany, and UK because they've actually accepted postgraduate lectures on this and studies on this and everything. Because if we get that going first, then we'll go to the 5 countries, you know, Serbia, Latvia, and the other 3 countries with them. Ish, you be part of it. But as you say, an African country might adopt our white paper, let's just call it that, faster than any other.
Yes,
because
true.
they have a different way of doing things. So,
Yes.
Madan, we can work on that separately. We'll actually task it that through our expertise of these 3 European countries, which will actually be part of the board of the Indian Ocean and Africa, that we actually present. And I think we fly to Nairobi first, to Minaben. It is then her job to bring the Chamber of Commerce have been in on Healing Our Earth. Let her do our hospitality. We just have to pay for the flight. Let her find a sponsor who accommodates us. Let's find a sponsor in Uganda who accommodates. We just fly in and we just enjoy it. What do you say?
Excellent idea, Neil. Also, we have colleagues now in South America who can take care of the PAHO region. So I'm looking at the 6 regions of the WHO. We have covered Europe. We have a good interaction in Europe. We have Africa, Ishji is there. Mauritius is part of WHO Africa. And we have PAHO. We have good contacts there in several countries. And we have 3 other regions that we need to look a little more closely. I think we will discuss this offline, Neil, but
yes,
we're getting closer to where we need to be. And you already have good contacts in Nairobi. You can connect with that. The other thing I just want to say is that India, UK, there's a policy document from the Prime Minister's office on India-UK policy document. And it's very clear that thoughts on how Ayurveda needs to appear in the NHS is presented in the health aspect of that policy document. I don't have it here to share with yourself, but there is, in each of these countries are providing different models. Mauritius, as part of WHO Africa, is providing excellent initiatives that ISHG has started there. Antonio in Italy is a key entry point into WHO Europe along with UK, and we can make that happen. We have colleagues in WHO in PAHO region who can come into this. We will look at the 3 other regions also. So these are important discussions. If we can come together, then we can work through these in greater detail. Antonio is involved in a WHO technical document on Panchakarma also. And so, you know, these are things that the sooner we can get it out to people so that they can think about it. People take a lot of time to think these things through. And now India has the big responsibility of having the global center for traditional medicine. So India is in a very privileged position for a good thing.
Madan, we've already agreed. Before March, we are meeting here in London. And by June, our first paper should be there. And in the same year, at the tail end of Diwali, which is auspicious time, and I'm sure Antonio does some fireworks as well, we make sure that we visit Africa, and within the first visit of the retreat in Mauritius, we can even set the ball rolling, because there, the reach to even the prime ministers and ministries are faster than the other countries. Antonio, we want to have your views of what we have discussed in the last 15 minutes before we formally close with Rajiv and his Gayatri Mantra. You need to unmute, over.
Yeah, of course, I am excited, and I agree with everything, because actually what we need is exactly this: is synergic action, and that brings the right ideas. In the just for your knowledge, in Italy we have a school now that, as you have seen, we form medical doctors and technicians in Ayurveda. And the funny thing, by the way, in Italy is that we have we have a course of introductory course of Ayurveda at the medical school. Ayurveda is a medical act, so is acknowledged by the medical board. The technicians now, they are acknowledged by the Italian government as a full profession. Technician in Ayurveda, they are covered by law, but Ayurveda is not acknowledged as a medicine. So, I think that we need this kind of action to make a kind of equalization of the information in all the country, but at the political level, because this kind of discrepancy, they are due mainly to ignorance of the people. But there are other issues which are not so less important. Just one thing. One of the information that we have in Italy is that one of the problems that there is of a full knowledge of Ayurveda as a medicine is the law on herbal medicine. Because the problem is that a law on herbal medicine means that there is a kind of alteration in what are the possibility of sales of medicine, herbal medicine. And there are a lot of problems to have the countries to accept the Indian pharmacopoeia, or just to make the law less restrictive for herbal things. So in Italy there is, I think that also in the other countries, if a medicine is accepted as a medicine, full-fledged medicine, the government needs to give to the doctors everything they need. And what we need is a full pharmacopoeia. But they cannot give a full pharmacopoeia since there is not a law on the regulation of herbal medicine. And this is not only Italian level, but European level. At the European level, there is the THMPD, and then there is the Belfrit, which are different. And so there is a big confusion. So this act is not only for the diffusion of Ayurveda at the academic level, at the political level, but also to find a way to overcome these difficulties. For example, in Italy, we cannot have Guduci, Tinospora cordifolia, but in Germany is sold everywhere. But in Italy, no. Because Italy is part of Belfrit, that means Belgium, France, and Italy, where Guduci is not allowed. This is good from, this is very bad, but it's good from another side, because we have to find a way to substitute Guduci with some other things. So we have to think. Yeah. And last thing, one of the most important things, just one of the teachings that we have in our school is for the medical doctor to teach how to read in an Ayurvedic way the medicine of the allopathic medicine, in such a way they can use, if they do not have anything else, they can use the allopathic medicine from an Ayurvedic point of view, causing less damage. For example, if you take an hypertensive, I mean, if you look at the Prakriti, and then you understand, calcium block diuretic from an Ayurvedic point of view. I mean, you understand which is going which improves Apana, Vyana, other things, and then according with the Prakriti, then you find immediately the antihypertensive that you can give to the person. Instead, if you look at the Harrison, there is written that you just try, since it's a polytherapy, you just try which one works better. In this way, we reduce time, we reduce expenses, we reduce risk for the patients. But for doing this, we need information. We need to inform our colleagues. We need to inform politicians. We need to give the possibility to the politician to understand that they can get something with Ayurveda, because otherwise they don't do anything.
Thank you, Antonio. That's fantastic.
Antonio, I have put in the chat box. I have put a little thing there. If Neil will permit me to share my screen, because there are viewers here.
You are a co-host, Madan.
Thank you, Neil.
You can sing and dance.
This is for those who are joining us on YouTube. I highlight this document. It's the 2030 Roadmap for India-UK Future Relation. You can get it online, so there it is. I'm going to go, so it's a long-term vision, 2030 vision. I'm going to go to the end of this document. This section 5 is titled Health. And there are many things listed here. I leave you to look through, but I want to take you to point number 32 here. Ayurveda and alternate medicine, so there is a provision made in that high-level policy document here on Ayurveda and alternative medicine. And this is a key document for any other engagements with other member states in other parts of the world. So that is one thing that I wanted to highlight. And the second thing, Antonio gives us some very specific details about the conflicts, the lack of coherence in the European regulations. Many people may not know about THMPD. Many people may not know about the Belfrit nations. And these are technicalities that are very important to show inconsistency within the EU regulations and between the member states. And those technicalities can be resolved. There are discussions going on between India and the European Union in certain areas. So I just wanted to highlight this. It'll be good when we come together. And we have a little more time to share notes, and maybe in advance we can share many of these things.
And Madan, just to remind everybody, that vision was made before who endorsed Ayurveda to be looked into. So the date can be preponed, and actually there is a group which is working on it, just waiting for the elections to prepare. So the good news will be, we might be a bit earlier, and our meeting in March could be more fruitful for it. So more so reason that we want to go ahead and do this. Rajiv, let's go and close now and remind what's happening next week. And after that, we just close off and then we'll be private.
Thank you so much. And again, it has been a wonderful day. Once again, thanks to everybody, speakers, participants, and those who have contributed to discussion. It's 141st episode today, and 142nd episode will be next week, which is Sunday, 14th of August, and that will be dedicated to Indian Independence Day, and that is for us to celebrate how the independence has happened, and it's all enjoyment, fun, and a full-packed event with participation of people. So I think that's the next week, and I think we can formally bring it to close. It has been excellent day, very fruitful day, I said, and I think we have got concrete plans now. We have got a clear motive that we need to move. We have got 3 positive outcomes from today. One, we are going to have this document which we will need to work on between now and hopefully have an event somewhere before March, so that we can meet at least 3 nations and then try and produce a document stroke white paper that would then become a formal pressure point. Second is we're going to expand into other countries. So we're going to expand into the well-known Ayurveda Center, Ayurveda Point in Italy, and the nation in the Europe. We're going to expand into Africa with Mauritius and other countries, including the Kenya and other African countries, and we're going to expand into other Far East countries as well, and then our partner country, which is across the continent, the USA, at probably into the formal later part of the next year. And I think that will bring us a proper global input. And I think that is the aim, and I could see the dream becoming a reality now. So thank you very much again. Let's do a prayer to great God for everybody to be happy and healthy with the Gayatri Mantra. Om Bhurбhavасвah Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat.